suggest that you all be mindful of that as well, and our speaking limits and questioning limits, etc. With that, first, let me turn it over to the clerk, though, to call our meeting to order. Madam Clerk.
Thank you, Mr. Chair, and good morning, everyone. I'm going to provide a very shortened review of the protocols for electronic participation in this council meeting. This meeting is being live streamed. In order to ensure that this meeting remains accessible to the public, the meeting will be recessed for 10 minutes if the live stream is interrupted or fails. Staff will work to get the live stream up and running as soon as possible and will keep council advised. If you wish to speak, please raise your hand by clicking on the hand icon, which is located to the right of your name in the participant list. Speakers will be determined based on members who have raised their hand using the icon. Voting for this meeting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, please indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member and will confirm the vote for each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you are leaving the meeting, please send an email to council@peelregion.ca to indicate that you're leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We shall now commence the meeting with roll call. Mayor Brown?
Present.
Thank you. Councillor Carlson?
Here, thanks.
Thank you. Mayor Crombie? Mayor Crombie? Councillor Demerla?
Present.
Thank you. Councillor Dasco?
Good morning. Here.
Thank you. Councillor Dillon?
Present.
Thank you. Councillor Downey?
I don't know.
Present.
Thank you. Councillor Fonseca?
Yes, good morning. Here.
Thank you. Councillor Fortini? Councillor Fortini? Councillor Early, who is here as a delegate for Councillor Groves. Councillor Early?
Present.
Thank you. Councillor Innes?
Good morning, present.
Thank you. Councillor Kovac?
Good morning, I'm here.
Thank you. Councillor Mahoney? Councillor Mahoney? I think I hear, thank you. Councillor McFadden?
Good morning, everyone.
Thank you. Councillor Medeiros?
Good morning, thank you.
Thank you. Councillor Paleshi? Thank you. Councillor Parrish?
Here.
Thank you. Councillor Raz?
Present.
Thank you. Councillor Sato? Thank you. Councillor Santos?
Present.
Thank you. Councillor Sinclair?
Present.
Thank you. Councillor Starr?
Present.
Thank you. Mayor Thompson? Mayor Thompson? Councillor Vicente?
Present.
Councillor, thank you.
Thank you, and that takes us to our Indigenous land acknowledgement. We would like to begin by acknowledging the land on which we gather and which the region of Peel operates as part of the treaty land and territory of the Mississaugas of the Credit. For thousands of years, Indigenous people inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territories of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. And if you'll permit me a special shout out, I had a great privilege yesterday to hear from probably our most esteemed first resident, His Honor Chief Harry S. Laforme. And I was listening in virtually to Mr. Laforme because he was giving the convocation address to the University of Toronto graduates And I was also quite proudful, as my wife was, that our son Francis was convocating as well as the most recent graduate for U of T. But wonderful to see Chief LaForme there as well. Marvelous the speech that he gave to those virtually. And as I say, a shout out to is probably our first citizen in Peel. Second thing I'm going to mention as well is yesterday evening as well, we had our Pride event. Beautiful job by Juliet. The thought that I want to leave with you is something that concerns me and food for thought going forward in acknowledging Pride Week. One of the most disheartening things I learned yesterday was, whereas I very proudly would tell you, as you know, boy, I've had a great life. What a great wife, Anne Marie, and my two boys, Damien and Francis. Do you know that I learned yesterday that one half of our employees, if I were to make this comment that I just made and say, how about you, Bob? How's life? How's the family? If Bob's significant other was Paul and their daughter was Sylvia, one half would not tell you that or would feel there might be repercussions if they let you know that. Isn't that remarkable that one half of our employees might feel that is something that is inappropriate and might not be well received? Well, that in itself is inappropriate. And that's why we have these discussions like we're having. And I speak for all of us that we want to hear about your life partners and your life, and you should be proud. And it still tells us we have a long way to go. So thank you for letting me mention that as well. Okay, with that, I turn to declarations of conflict of interest. Do I have any conflicts of interest? Seeing none. Approval of the minutes of June 10, 2021 is moved by Councillor McFadden, seconded by Councillor Starr. Any questions on the minutes? Anybody opposed on the vote? That is carried. That takes us to the approval of the agenda. Madam Clerk, I go to you because I know you have some additions.
Thank you, Mr. Chair. Yeah, there were a number of additional items that were received after the revised agenda was distributed to Council, and perhaps I can go through the list. So there is a communication from Jim Nardi regarding an alternative approach for organic waste diversion solutions to be dealt with under Public Works, item 12.3. There's also a communication from Irene Ford regarding the proposed Greater Toronto Area West Corridor to be dealt with under Public Works, item 12.4. There's also a communication from Kathleen Wilson regarding the GTA West to be dealt with under Public Works, item 12.5. Communication from Robert Minesco regarding the GTA to be dealt with under Public Works, item 12.6. Communication from Kathleen Dutfield regarding the GTA to be dealt with under Public Works, item 12.7. Communication from Marl Ann Tate regarding the GTA to be dealt with under item 12.8. And a communication from the Business and Professional Women of Brampton regarding the expansion of funding directed to increase options for women who are victims of violence to be dealt with under Enterprise Programs and Services, item 16.1. And so, Mr. Chair, I could ask if you could get a mover and seconder if there are, and determine if there's any objections to any of these items being added to the agenda.
I have questioners first. Councillor Parrish.
Thank you, Chair Unica. Through you to the clerk, when did these items get added? Because I only got them at 9 o'clock this morning.
Through you, Mr. Chair, most of these items were received between yesterday up to about 9:30 last night. So they were after the revised agenda was distributed on Monday evening.
If they were received in the last 24 hours, I would suggest I will not be supporting their being added. I think we've done that before. It's very hard, especially if the subjects are of great interest and need a little bit of depth. So I won't be supporting the addition to the agenda. Secondly, I would like to move that we delete delegation 7.6. Our staff went to a meeting 2 days ago and have assured us there's nothing new in that delegation. The council has voted against the GTA at West Highway 18-6. It's a very strong position, so that, as the chair has mentioned, it's a heavy agenda. So sitting there and listening to something we've already heard before and made a decision on, to me, is a waste of our valuable time. So I would move we do not take any additions to the agenda that were in the last 24 hours. And I would also move that we remove 7.6 And with those changes, I would be happy to move approval of the agenda.
Thank you, Councillor Parrish. And before I ask for a seconder, I want to thank Councillor Parrish for reaching out and making those points to me. And I must say, I agree with everything she said. And furthermore, and Councillor Parrish is being consistent and others as well, we really have to send a message that we have to stop this practice, that after the additional agenda, within the last 24 hours, we're going to get more. And I realize, because I watch it, my colleagues in Mississauga are in the middle of a general committee meeting every Wednesday or a council meeting. My colleagues in Caledon are busy Tuesday. And so with all that we've got to have this continuing, I think we have to send the message that we're happy to hear you out, but there's a well understood procedure. Please follow the procedure. So thank you, Councillor Parrish, for reaching out. And as I say, I agree with your sentiments entirely. I'm looking for a seconder. Councillor McFadden, would you second that amendment to the agenda? So I have it moved and seconded. Madam Clerk, a point of clarification from my end. I don't know if you spoke to it, but I know our dear friend and former Mayor of Brampton, Peter Robertson, wanted to delegate or speak to us about the monument, the recognition for former Premier Davis. And I believe I've said, and appropriately so, Brampton just recently this week had a discussion about that and how that could move over. I wanted to reach out to Mayor Robertson and say, in lieu of a presentation today, now that I know we have the blessing of our friends in Brampton, maybe we can refer that back to the chair for a follow-up meeting. I don't think we need to get into it here, and see if we can come back with something more solid now that I know we're moving our way forward. So I wanted to acknowledge that and thank Mayor Robertson for standing down and giving us a chance to move that a little bit forward offline, if you will, so we can bring back something with a formal report, hopefully at some point to Regional Council. So I wanted to acknowledge that as well. I have an amended agenda moved properly. Do I have any questioners to that agenda before I take the vote? I see a hand. Councillor Downey.
Thank you, through you, Chair. And while I agree with Councillor Parrish in regards to, a drop-dead cutoff for additional items, the correspondence from BPW is time-sensitive, and they are requesting endorsement from this council for provincial funding. So I would ask for some indulgence from my colleagues on that one particularly.
Councillor Parrish, I see you nodding. Would the seconder agree with that for the reasons given? And I'm assuming that is correct. So that is your amended motion for the agenda. Do I have any other speakers to the motion before I call the question on the agenda? Madam Clerk, I see none on my screen. Trusting you have none, I'm ready to take the vote. All those, Madam Clerk, do I need a recorded vote through you?
We can start off by asking if there are any objections, Mr. Chair, and if there are objections, then I will have to do a recorded vote.
Very good. So we don't necessarily need a recorded vote if I have no objections. Does anybody object to the amended agenda? Hearing no one, our amended agenda is approved. Thank you very much. Okay, Madam Clerk, over to you for our consent agenda.
Thank you, Mr. Chair. So we've got the delegations listed section 7, so we'll skip down to section 8 will be the regular update, the COVID update. Section 10, we've got 2 staff presentations. Items related to public works. 11.1, residential financial support policy in relation to regional infrastructure failure. Is there consent for this item? Thank you. Section 12, communications. Jan Whitmore, resident town of Caledon, correspondence dated June 16th, 2021 regarding Highway 413. Is there consent for this item? Thank you. 12.2, communication. Letter dated June 21st, 2021 from the Provincial Minister of Transportation and the Associate Minister of Transportation regarding administrative monetary penalty system. Is there consent for this item? Thank you. Section 14, communication from Christine Massey, dated June 12, 2021, regarding a study that shows fluoride harms. Is there consent for this item? Thank you. 15.1, Canada Home Share, a pilot program in Peel Region. Is there consent for this item?
Hold.
And I'm sorry, which
It's Councillor Damerla. Hold.
Councillor Demerla. Thank you, Councillor Demerla. 16.1 will be the new correspondence that was added this morning. It's a communication from the Business and Professional Women of Brampton regarding an expansion of funding directed to increase options for women who are victims of violence. Is there consent for this item?
Please hold as there would be action.
Councillor Downey, thank you. 17, items related to planning and growth management. 17.1, response to provincial consultation on regulatory proposals under the Conservation Authorities Act. Is there consent for this item?
Hold Sinclair.
Thank you, Councillor Sinclair. 17.2, report of the Region of Peel Planning and Growth Management Committee for the meeting held on June the 3rd, 2021. Is there consent for this item? Thank you. Section 18, communications. Communication from Artie Sancheria, Senior Legal Counsel, Region of Peel. It's a memo dated June 16th, 2021, regarding the new Ontario Land Tribunal. Is there consent for this item? Thank you. 19, items related to enterprise programs and services. 19.1, statement of development charges reserve funds for the fiscal year 2020. Is there consent for this item? Thank you. 19.2, 2020 Treasury Report for information. Is there consent for this item? Thank you. 19.3, Peel Conservation Authority Climate Change Performance Measurement System. Is there consent for this item? Thank you. 19.4, 2020 Annual Transparency and Accountable Government Report. Is there consent for this item?
Sorry, Madam Clerk, if I could, Councillor Raz, if I can hold 19.3, please. I couldn't unmute quick enough. Thank you.
Thank you. 19.4, is there consent for this item? Thank you. 19.5, federal gas tax funding accelerated for 2021. Is there consent for this item? Thank you. 19.6, the establishment of a public art and monuments committee. Is there consent for this item?
Hold.
Is that Mayor Thompson? Thank you.
Councillor Paleshi.
Oh, sorry. Thank you, Councillor Paleshi. That brings us to the in-camera matters. 24.1, water pumping station construction related flooding event update. Is there consent for this item? Thank you. 24.2, automated school bus stop arm camera program implementation and processing center recommendations. Is there consent for this item?
Hold, please.
Councillor Raz, thank you. 24.3, Rapid Housing Initiative, June 2021 update. Is there consent for this item? Thank you. That brings us to the end of the agenda, and I turn it back over to you, Mr. Chair. Sorry, Mr. Chair, I believe you are on mute.
My apologies. Thank you, Madam Clerk. There you have it. You've heard the consent agenda as moved by Councillor Starr, seconded by Councillor Kovac. For the vote, over to you, Madam Clerk, on the consent agenda.
Thank you, Mr. Chair, and I'll begin with Mayor Brown. Mayor Brown in favor. Councillor Carlson?
Yes. Yes.
Thank you, Councillor Carlson in favor. Mayor Crombie? Mayor Crombie? Councillor Demerla?
In favor?
Thank you, Councillor Demerla in favor. Councillor Dasco?
Yes, in favor.
Councillor Dasco in favor. Councillor Dillon?
In favor.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
In favor.
Councillor Fonseca in favor. Councillor Fortini?
Favor.
Councillor Fortini in favor. Councillor Early?
In favor?
Councillor Early in favor. Councillor Innes?
In favor?
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
In favor.
Councillor Mahoney in favor. Councillor McFadden.
In favor.
Councillor McFadden in favor. Councillor Medeiros.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor?
Councillor Paleshi in favor. Councillor Parrish.
In favor?
Councillor Parrish in favor. Councillor Raz.
In favor.
Councillor Raz in favor. Councillor Sato. Councillor Sato in favor. Thank you. Councillor Santos.
In favor.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor. Councillor Vicente.
In favor.
Councillor Vicente in favor. Thank you, and that carries.
Thank you. So with that, we come down to the formal agenda. We have delegations. Again, I will remind everybody, just looking at the consent agenda, delegations and presentations, we're well over a dozen. If each one of them took 20 to 30 minutes, we won't be home for dinner. So just to emphasize through the chair, please, your comments and questions to the point, clarification questions, no more than a 5-minute presentation, no more than 5 minutes for clarification on behalf of my colleagues, and I will try to keep us moving along. That being said, I've spoken with the chief with regards to his presentation. I'm hoping I can give the chief a little bit of latitude given his very important presentation that he has. So with that, I'm happy to introduce our first delegate, Chief Nishan Duriappa, Chief of Police, Peel Regional Police, presenting an overview and status report regarding the provincial adequacy standards regulations. And I'm honored also to note that our board chair, Ahmed Attia, is here. And I'm sure in the virtual world, our very good citizen representatives as well, Len Howell and Al Boughton, are sitting in. If it was the regular world, I'm sure they'd be in our audience and council chamber. So with that, Chief, over to you and our chair, Ahmed Attia.
Thank you very much, Chair Unica, and I will do my best to honor the time of everybody that's participating. I know it's quite valuable, but with that, I think I will just, before we begin this opportunity to connect again with you, I know it was just about 4 months ago that I was before council, but much has happened, and it's just my pleasure to introduce Board Chair Ahmed Attia, who I think is going to kick it off with some opening comments.
Thank you, Chief. It's nice to see everyone again virtually. As the body tasked with police oversight and providing adequate and effective policing in the community, I just wanted to provide a few remarks on behalf of the board and my colleagues before you hear from the chief. Over the past 2.5 years, our board has made some very important decisions to make Peel Police a more progressive, innovative, and accountable police service. The board has been impressed with the dedication of all members of Peel Police to the safety and well-being of everyone who lives, works, and visits in Peel Region. Their commitment to our community and service excellence is truly inspiring. We have one of Canada's finest police services, led by Chief Duriappa, and a senior leadership team that remains responsive to the needs of our diverse and vibrant community. This includes a new strategic plan focusing on community outreach and organizational changes that reflect public feedback in the residential and business community surveys. Last year, the board commissioned a service delivery review to understand how we can better serve the residents of Peel. We embarked on body-worn cameras to enhance public and officer safety and enhance public trust, confidence, and police transparency and accountability. We signed a groundbreaking agreement with the Ontario Human Rights Commission to address systemic racism in the service. I think we can all agree that these are significant and ambitious goals for the organization, but they are necessary and they are achievable because we have the right people at all levels carrying out this work. Obviously, the past year has been very difficult for policing on both the local and the international level. COVID-19 and geopolitical events from around the globe have shown a light on policing everywhere. Amid public concerns and external pressures layered on top of the pandemic's impact on policing, Peel Police stood strong and continued to provide the high level of service and engagement that our community has come to expect and appreciate. The members of Peel Police met every new challenge with both professionalism and a focus on quality service. A key to this success was maintaining and strengthening countless partnerships with individuals and agencies throughout our region. I want to thank the Chief for preparing a presentation of our annual update We shared this annual report in our last board meeting and with the public, and I'm sure it has been shared with each of you. This is not a budget update, but it is to present to you what we've accomplished in the last year. And so as I turn the presentation over to the chief, I want to congratulate the men and women of Peel Regional Police on their achievements during the past year, and I'm grateful to the Regional Council for providing me an opportunity to address you today. Thank you.
Thank you. And Chair, as I turn it over to the chief, I was remiss. I didn't know if he'd be part of the presenting group, but our Vice Chair, Ron Chatha, another citizen member who I know is tuning in as well. So I wanted to acknowledge his service on the board also as a chair, and I know he's listening in as well. Welcome, Ron. Chief, over to you.
Thank you, Chair Unica, and obviously Board Chair Atia. If we could begin the slide presentation, please, that'd be fantastic. And the next slide, please. As just highlighted by Chair Atia, we have, as of October of last year, commenced our 3-year strategic plan. I think if anyone's had an opportunity to chat with me, or if I've had the opportunity to speak to you, I've almost always vacillated on 3 important buckets. And one has been obviously modernizing our community policing approach, making sure that our people are good on the inside, and so that we are always good on the outside. And that requires the investment in people. And the third is obviously modernizing our approach to be more flexible and innovative. And I'm pleased to say that our strat plan has also reflected those 3 priority areas. And most organizations will begin with their strat plan, but I don't intend it to be an item on the shelf, but I really want it to be where we root all our activities. You will also have received a PDF copy of our 2020 annual report. I think a hard copy will be following via mail, as well as it is available on our public website. I do want to recognize that, they often say, looking back at the past shouldn't be a place of residence, but rather a place of reference. I don't want to spend the time, just dissecting last year's annual report, but I do want to highlight some of the existing circumstances. But I think you would all appreciate hearing from me as it relates to where I see this organization, policing and public safety in Peel, headed. So my presentation will be a combination of all. Next slide, please. As you know, our region continues to, and I often say, I'm always happy when Toronto Police occupies CP24 more than I do. But we are a large urban municipality, second and third largest cities in one region. Nonetheless, we're very pleased to be able to say that, here's a current slide of, some of the interesting facts. We do have nationally one of the busiest communication centers in Canada. All our calls to emergency services come through our 911 communication center on Huron, Ontario. And as you can see there are 700,000 calls, and that reflects we've backed out the hang up calls and the pocket dials to 911, et cetera. They're not included in here. So when you look about the how many 911 calls, it's roughly 40,000 a month that we are communicators, and they are some of the best highly trained, compassionate people that we possibly can have. I'm very proud of all of our civilian members in communications. And they dispatch up to 2,000 officers, which is quite a significant task. To the right, our top 5 calls that come from the public. As you can see, the number 1 call is domestic related demands, which are inclusive of family and intimate partner violence. And just for frame of reference, medical assist calls, which we go to help our additional partners. Sometimes there's crisis that requires our capacity, is about roughly 23,000 calls a year. So just to give you a frame of reference on our demands. That being said, we are really blessed with some of the best trained and equipped police officers nationally, and I've spoken to this before, given the pressures that we've seen internationally across the U.S., we continue to have some of the best trained officers here in Canada, and pleased to say that our organization continues to build amazing people. Next slide, please. I also wanted to refer to, I can go through the ups and downs on the status of calls that are happening to get a lay of the land. I'll happily answer any of the trends. I think generally speaking, council should know that over the pandemic, we have seen sort of an artificial environment, and this is across the board nationally, where it has suppressed some of the typical trends in calls that we have seen. And they are inclusive of, property crimes, residential break and enters. We've seen a significant reduction over pandemic. We are alive to the fact that these are impacts of the COVID pandemic on the mobility of not just our community, the business community, but also those that may compromise our public safety. And we are also aware that as things open up, as summer rolls around the corner, we may see these trends increase. One of the things I wanted to highlight is when a call comes into 911, they are dispatched based on priority. Priority 1 calls are the ones that our officers go to right away, the need for them at the doorstep, along with paramedics and fire at the top of the list. And, those are our, violent crimes, the robberies, shootings, extreme risk to the health and wellness of people. But one of the things that we have seen as a trend is, if you can see and read the text on our other calls for service, which the police are called for, are alarm calls, unwanted people, suspicious persons, stolen autos, and break and enters, where there are no suspects on scene. We've seen roughly, as it pertains to priority 3 calls, over a 5-year period, a 73-minute increase in the amount of time it takes a citizen to see one of us, inclusive of 43 minutes for priority 4 calls. And I do want to acknowledge that we are in a growth jurisdiction, and the population growth over the next 20 years, we know is a 23% growth increase. You all know this firsthand. And that is a disparity between some of our neighboring municipalities. But what our goal is to make sure that our friends, families, our community members aren't on the end of waiting for service delivery like this. As I've said, my goal is to turn the dial down on an urbanization trend where we will always have significant urban pressures, but the expectations of our community and service delivery are built upon every one of those minutes they're waiting to see one of us. And that doesn't always mean that it needs to be a uniformed officer. And one of the things we've commissioned and are exploring, as I'll speak to later, is alternative models to meet the needs of the public that don't need to be on the shoulders of somebody with a uniform and a crest. There will always be matters that our people need to go to, but this is one of the goals for me, to turn the dial down on the demands that we have traditionally faced. Next slide, please. I think before I move on to where we're headed, I just want to acknowledge that council has been very attuned to the impact on the municipalities and police as it pertains to the COVID pandemic. Significant business process changes, of course, right from the community members being able to access our services, walk into the station. We've had to modify how we do service delivery from where possible, the curbside to front porch. Of course, always being there where needed with PPE, along with our emergency services partners. We've worked really well with Chief Peter Dundas, all 3 of our fire chiefs, to make sure we look at how we engage in tiered response in an appropriate way, where we don't have to expose public to risk or emit from public health compromise, where we see too many emergency responders. We see the right ones when we need them the most. I want to first of all acknowledge the work by Dr. Loh and Commissioner Polsinelli as it pertains to vaccinations of emergency responders. We know it's like I use the analogy: five kids trying to drive dad's car on Friday night. You know, you want to get everybody access to the vehicle, but there's a lot of thought process to being there. But having our workforce also in a safe and healthy way behind all of our healthcare professionals and other essential workers was critical. But we do also want to acknowledge that some of the business practices that have had to cause us to be innovative have been, for example, at 365 days of the year, we have to bring people before the courts, and the courts were closed down, which has propelled us into a place where you would think we would be before, but both our court system and policing have changed to remote bail hearings, which mean officers from a division are physically, virtually present in a courtroom providing testimony. And this is a significant one because also are the offenders that are before the courts. We've had to see a lot of additional expenditures, obviously due to COVID, but as you know, the province has been supporting us through the municipalities through COVID relief. One of the biggest ones I'd like to highlight is our airport pressures. As you know, we are the largest airport in Canada, and as the borders open, we have a critical role beside Canadian Border Services Agency, Public Health Agency of Canada, the Region Appeal, and the GTAA to manage incoming travelers. And some of that has been to support the management of the additional tests, vaccinations, screening that needs to happen, which has had an impact on us for resourcing at the airport, which we have arranged through the GTAA. We also are home to many designated quarantine facilities, as well as the hotels which incoming travelers are required to attend. And this has really highlighted the strength of ongoing collaboration between the region, public health, and the municipalities, which we are very thankful for. Next slide, please. So as we begin to talk about where we're headed, I wanted to reframe where we're going. The community safety well-being model, which I know all of you are very familiar with, I believe needs to be highlighted here in this slide. The traditional model of emphasis on the red, which is when people are in emergent crisis, has been our dominant need. We know that the model of investing in all the other areas, inclusive of social development, which is where we get the greatest impact on the health and wellness and social determinants of health, to reduce the emphasis on the need for emergency response, is where we need to invest. Also looking at where we can identify risk and mobilize intervention strategies is a critical way to stop us from being back at the doorstep again in emergency. And also efforts towards prevention are also very critical. I think before I move forward into our discussion, is that I wanted to baseline for the sake of the community that may be watching, that the Region Appeal has committed to using this planning framework to address all needs and risks in the community. And us as a police organization have equally adopted it to the framework. We're doing things differently here in Peel. And you've heard me say that we need to make a shift from a traditional law enforcement model to a very pro-public health model. I think it echoes the voices that Chair Attia has said has been very difficult, not just on policing, on the municipalities this last year, where people want to see other systems strengthened so there's a less reliance on emergency response. The way to do that is by coordinating our efforts with multi-sectors to get the right services to the right people at the right time. Next slide, please. I again want to base that the Region Appeal on the left column, you can see are the priorities that I have the pleasure of chairing on behalf of the Region Appeal with Commissioner Pulcinelli, the region's community safety well-being plan. And these are, the big chunky areas that the region have committed to in the coming year. But I also want to show you on the right side how Peel Police has entrenched our commitment to the same priorities: mental health, addictions, violent crime, which is inclusive of family violence, the priority populations, which I'll unpack later, which also address systemic discrimination, road safety, which we know is a significant pressure, but also embedded is our work with Commissioner Paulsonelli on these goals. Next slide, please. So my commitment to you and this community and this organization, my team has heard us say that we are fully integrating community safety well-being into everything we do. This is a seismic shift in the way we're seeing policing. And it's not just a performative act. The icon below, which could be a little confusing, is meant to just capture the fact that behind the scenes, I have completely deconstructed our org chart and rebuilt a whole new community safety well-being services, which is really woven into our frontline and investigative service delivery. We've recently onboarded a manager of community safety well-being who came from community and social services from Halton region, who's bench strength on our side to work with Brian Laundrie and Commissioner Paulsonelli and Marley Boudreau as we work on the heavy lifting of staff behind the scene. But we've also committed to building mobilization teams that were different than our old previous divisional neighborhood policing units. Amazing people, but now we've shifted our focus to making sure we support our service delivery through actualizing our community safety well-being plan. And the bottom right is a discussion on how we've been very thoughtful as being stewards of the resources that our community gives us to use them differently than we traditionally would have. Next slide, please. This next slide represents what we've done in this last calendar year is to reallocate 183 officers to our new priorities. If you remember that one column down the side, we spoke to mental health, addictions, violent crime, road safety, and priority populations. We have expanded our efforts as regional council endorsed in July of last year with their motion to advocate for enhanced mental health crisis response teams. We do continue to advocate for the province, and we're optimistic that CMHA may receive additional funding this calendar year to support growth in this space. But as it pertains to the carjackings and the violent crimes, the break-and enters that we continue to hear from our community, we've expanded the capacity of investigative services. I'll be speaking to you about the inception of our dedicated family and intimate partner violence unit. Road safety, we saw sort of a year that we have never seen before as it pertains to road safety fatalities. I've reallocated 16 officers additionally to committed road safety, as well as 47 officers. And these are all officers that were already within our strength, reprioritized to these areas. Behind the scenes, we've also made significant efforts on a civilian standpoint. And I know many of you have asked, how does this look like? Do we need to be throwing officers at all these resources? Can we find other ways of doing things? We had, upwards of 16 to 20 civilian individuals doing security monitoring in our stations. The ability and the capacity for us to automate some of our efforts have allowed us to redistribute 16 to 20 officers to 16 to 20 civilians to other functions that are continuing to be priorities that we don't need to come back for budget asks for. And this is our demonstration where we're trying to be thoughtful about the uses of our resources to realign them to our strategic priorities. So what I'm going to do is actually, I'll use my term of speed dating through our priorities again, but I would like to speak to you specifically about mental health addictions, intimate partner violence, our road safety, and plus some of the violent crimes, which are all identified priorities of the region. We know that the region has endorsed many of the efforts and many of the regional councilors are deeply involved with me and my team as it pertains to this. So I'd like to acknowledge that. Next slide, please. I want to first begin by talking about mental health addictions. The first red box showed you how we used to respond. Peel Police, along with most police organizations, have traditionally responded when somebody calls 911 or the non-emergency line for support. And the use of the 4 boxes and the colors represent the 4 rings of the community safety well-being ring. And what I've asked my team is to be thoughtful about how we program and service delivery to all these pressures, but ensure we pull together multi-sector partners inclusive of the region to help make sure we have a fulsome continuity of service delivery that mirrors the community safety well-being plan. And what used to be just frontline response is now grown from mobile crisis rapid response teams. We have, within the last several months, launched Peel's Situation Table, which the region and I co-sponsor with our many multi-sector partners. And people that are in risk are on a weekly basis being brought to the situation table and being connected directly to services so we don't see them in the red again. But we have also gone as far as to ensure that we've embedded mental health caseworkers to follow up on ongoing cases that are before the courts. We've supported with Daryl and Allison, our Crown Attorney, a community treatment court, which is also partnered with CMHA. Things like working with Peel Addiction and Research Council to connect impaired drivers right at the roadside with a connection to services for alcohol addiction servicing as they concurrently move through other processes, as well as working with other service providers, shows a fulsome approach to it. Now, mental health addictions continues to be one of our greatest demands. As you know, the optimal number of vehicles that we would like for mobile crisis rapid response teams for a population our size should be 8 a day. We are now operating at 3 a day, which is better than what we used to have, but is obviously not a lot. I will meet, the health system at the doorstep with officers to support them. And part of it is not just about taking the demand off our officers, but we know when there's a crisis worker on scene, less people are ending up in an emergency room besides a police officer, and that equates to less criminalization and stigmatization of mental health. It gets people to the right services they need, as well as our work to ensure that we have hospital transfer of care protocols. We've all seen the images of up to 16 cruisers outside of a hospital. That does continue to happen. They're not always there for mental health, but the hospital transfer protocol, I could say, for example, at Brampton Civic, we are now down from 3-hour times where an officer is in the ER room with a patient to about 1.5 hours, which is a significant change from getting people the right services. We are now being able to connect people right at the roadside to service providers in the region, which an officer may have sometimes had a conversation with somebody who's in crisis, maybe after the conversation left, but now we're able to connect them right to mobile referrals. We are also, it is one of the comments, I think, in March, or February, which Councillor Sato brought up, is really seeking the opportunity to work with the region to find out how we can have community-led response to mental health. So taking police right out of the equation. And so at the moment, we are exploring an opportunity for a complete pilot of an alternate response mechanism. Again, it's a difficult one because it's not been done before and requires funding for our support agencies. We are also looking at embedding a crisis worker in our 911 communication center. So right from the entry point to a 911 call, it can be diverted through to the appropriate services, which, frankly, gets people the right person they need to speak to. In the interim, we continue to strengthen the training of my people to ensure that we are at the roadside, which we dominantly are still going to most mental health calls, are trained and equipped to be able to triage them. But as we all know, the legislation still continues to say police are the only people that can take people to hospital and mental health crisis. I'm currently on the executive for the Ontario Association of Chiefs of Police. One of the motions we are intending to advocate for the province is to change the legislation to allow other approved entities to take people to places of care versus police. So this continues to be one of our greatest demands, as you saw in our top 5 calls. I'd like to move to the next slide, and it's going to also show this discussion on violent crime. Violent crime continues to be a priority. I know Chair Unica and I have recently chatted about, people's perception of safety and the community, the statistics of violence are almost two concurrent things. When people open the paper and they see something egregious that's happened, it has a significant ripple effect. And our traditional approach has always been in the red. And what I'd like to highlight to you is that, these 3 areas are ones that are on the priority for Peel Regional Police. When I arrived here, I came on the heels, and Councillor Parrish will know deeply the impact on the Malton community on the Darcel shooting. We saw youth not accessing Malton neighborhood services for programming because the parents were scared to send them out to a basketball game. And the ripple effects are very significant. And we recognize that the response to it has to have enforcement and significant strategies to reduce gang violence, especially for the high-risk individuals. But it also has to have a comprehensive strategy that builds resiliency and strength from a human services standpoint, young people supporting parents in the community. So what I want to show you is Peel's new strategy for doing this. We're not going to do it the way we always did it before. We're going to shift it. But I do want to say, because you do have the platform to help me on some narratives, I want to say that a smallest percentage of individuals are responsible for the largest amount of violent crime in our community. If you've seen me out quite publicly as it pertains to intimate partner violence or gang violence, a small percentage of individuals who are repeatedly released into the community for violent crimes are the ones responsible for almost the majority of it. I can't say all of it. And if we have a strategy and ability, the support of the judicial system to ensure that we appropriately use forms of release for those that have the opportunity to reintegrate and get better, but also, be discerning about who poses the greatest risk when the paperwork is not dry yet on the work that my officers do and they're back out in the community, has a significant impact to us. I do want to acknowledge that Chair Atia did write, with the support of the board, an article recently in the Globe and Mail that speaks to the horrific incidents that happened in London, and we know hate crimes have occurred right across the board. But as it pertains to violent crimes and those that have the most egregious propensity for violence, we do want to advocate for a greater focus on that. I'm not putting it on the shoulders of other systems only. We do own it ourselves, and I'd like to share with you. Right now, thus far, we are at a rate of about 7 homicides here in Peel Region. Sadly, we stay consistent to the fact that about 40% of them are intimate partner or vulnerable person related. I can say that thus far, the number of shootings that we've seen are lower year to date from last year, but we're also conscious that with the reopening and the increase in mobility of individuals, we may see changes in the region. Next slide, please. The traditional way for intimate partner violence response was completely on the backs of our front line. But as you can see, our approach has changed. We have now, our strategy involves investment in the other areas, inclusive of the development of a dedicated 40 or 50 person intimate partner violence unit. It's a shift to a model that is called the family justice model. These individuals are not working out of a police station. You can see a photo or snapshot of them and their inspector, Lisa Hewison. They're dressed down. They represent some of our most talented individuals with EI skills through the roof. And they are trauma-informed trained, involved, and are responsible for taking about 90%, 98% of our intimate partner violence calls, which previously fell to the frontline officer of the day, and which is significant. And I'm going to show you a little bit more about it. But what's happened is that they've taken, since they opened in April 20th of this year, about 319 intimate partner violence calls, which are inclusive of family violence and intimate partner. And 98% of what used to go to frontline now go to them. What is interesting is it's not just a story about survivors being served better by people who are trained better. These officers are now embedded by and surrounded by 15 other social services and human services agencies at Peel Safe Center. And what's happened about that is since April 20th, we have been able to provide 200 referrals to those agencies. 200 referrals represents more referrals than the entire Appeal Center had last calendar year. So what that speaks to it is that there has been a real need to get people connected to services, but it also highlights this narrative that other human services need to be strengthened to be able to build a resiliency for survivors of intimate partner violence. And we know that, we've seen the defund narrative, and listen, to me, it's just been an awakening that we need to strengthen other human services so that we can turn the dial down on intimate partner violence here in our community. And with that, I just want to play a short video, please. Thank you.
Officers arrived on scene and located an adult female victim.
53-year-old male, the victim's husband, was taken into custody.
The suspect has been identified as a 51-year-old man who is the husband and father of the two victims.
That female has since died as a result of the injuries she sustained.
Homicide Bureau has taken carriage of the investigation.
In 1993, I ran for my life with my baby girl in my arms, leaving my home and all my belongings behind. I had enough. I spent over a year being tortured and shamed for being me. Every day when the front door opened, I didn't know if it was going to be a good day or a bad day. My partner dictated how I was going to feel. When the physical violence started, I remember believing I deserved it. Why didn't I just keep my mouth shut? I spent so much time suffering in silence at the hands of this man, being choked up against the wall while holding my baby, punched while I was nursing her. If I left, he would kill me, and I could not have my daughter grow up without my protection. I hid all this from my family and friends. I was embarrassed and ashamed. When I made the decision to leave, there was no place for me to go, no beds available in any of the women's shelters in the region. Finally, I had no choice. I had to run. At the hospital, a kind nurse put me in a room and placed a telephone in front of me. She said, "Call the police or I will." My sister pushed me to tell my story to the police, and so I did. He was arrested, and I felt so guilty. How could I do this to him? I became angry, and then I became strong. I worked hard to give my daughter the best life I could. I taught her to be strong and independent. Now, here I am, a mother of 3 and stepmom to 1. Now I'm an officer in the Intimate Partner Violence Unit, responding to domestic violence calls. Why doesn't she just leave? How many times have I heard this question? I can tell you why she doesn't leave.
So as this video continues to play, I think it might have been glitching, but hopefully you're able to see some of the comments. We have some remarkable officers there that speak up to 14 languages, that are racialized, represent a variety of different communities, as well as just a great team that is representing the largest family justice model in Canada of this sort. It's not the first time it's been done, but we do know that we're going to have a significant impact on it. And this model is very similar to how we're approaching human trafficking in a variety of different areas. So as we proceed to the next slide, I do want to say that, with that domestic violence team taking most of the calls, that represents about 2,400 hours of uniform patrol time that is put back on the roads to take away from other demands. I think, one of the things we've always promised is to find ways of doing better at the front line. And we do know that there are a lot of pressures still that need to be handled, but this is us going back to what we need to be doing the most in the emergent response. The same thing applies with our gun and gang violence. As of this morning, we will be releasing another initiative that pertains to some of our local street gangs. We do still have, unfortunately, some very violent incidents in our community that are almost always deeply related to other municipalities. We continue to work together with our partners as it pertains to gun and gang violence. One of the things I want to highlight is that 90% of the handguns that Peel Police seized last year came from the U.S. And we have been working very hard. As much as the last 3 weeks ago, Chair Unica, Mayor Brown, Mayor Crombie, and I met with the other big 6 municipalities and chiefs to talk about comprehensive strategies to reduce gun and gang violence, the issue of firearms entering Canada, strengthening our awareness of how we can manage the high-risk offenders are always there. But I want to highlight our shift again, which we traditionally were in the red with some work in the prevention, has really shifted into finding ways to mitigate risk and build stronger communities. And, I want to thank, many of you for contributing to this programming. As you can remember in my last presentation, we talked about the intent to shift our strategy to involve community safety well-being. For example, Councillor Parrish had highlighted the connection to a program called Young Men's Empowerment in Malton. Out of that, we've been able to plug them into the strengthening of young men. That's just one example of what we've been doing to go upstream. So it's just not the enforcement piece, but the young men and women, the adults and guardians that are trying to support these environments are strengthened. And we are looking forward over the course of the summer to seeing many of these programs flourish. We've had to adapt them to a virtual environment, but happy to say many of our partners have been flexible to achieve that. And so we continue to advocate for other services and their funding as well to support us in this regard, because we know that's going to be a reduction in the gun and gang violence. I'm confident that we can make a significant impact right across this region here in Peel, and we want to be a model for other police agencies right across this country in our approach. Next slide, please. Road safety, as you know, traditionally was, in the last year or two, was always traffic enforcement only. We know that traffic enforcement is critical. It's tough to see the slides. I know they'll be sent out in the package, but we have also continued to make sure we refer individuals to the appropriate services should we have, for example, impaired driving. We spoke to our partnership with Peel Addiction Assessment Center. We've added 16 more officers to our road safety. Our Major Collision Bureau has been restructured to have a greater ability to respond to traffic fatalities. Sadly, we saw not just the recent anniversary of the Chisillo family's 1-year anniversary, but the number of road fatalities that we saw last year were the most we've seen probably in this region in many years. We have also seen many individuals take advantage of the open roads and parking lots with the drifting and the road racing. As a result, we've had several projects in combination with the OPP Toronto and York region that have been targeted enforcement for road safety, and they have had significant impacts. We do want to say that thus far, year to date, our fatal motor vehicle collisions are down from year to date from last year, but the victims are still high. Stunt driving still continues to be a demand in many of our municipalities, as well as the speeding. So as we continue to apply our approach to road safety, we want to make sure we're utilizing existing frameworks, and one which has been brought to our attention before is our Vision Zero, which is already an initiative at a regional level that involves up to 13 or 14 other entities outside of us, including roads, engineering, works, the school system, to make sure we turn the dial down on the traffic fatalities and collisions that we continue to see. Next slide, please. And finally, under the banner of supporting our priority populations, it's a term that we've captured for our youth engagement, older adult isolations, food security, precarious employment or housing. And the reason that's there is 70 to 80% of what my officers do and spend time on, you've heard me say before, often is non-criminal. And it's often a confluence of many of these pressures that you as the region and staff at the region also see as priorities. So our goal is to shift, as you've heard me say, to look at shifting outcomes instead of continuing to throw resources at the pressures. And some of that, the first one, as you mentioned, I've spoken to you about the situation table. We've looked at a new engagement model with our community to help inform some of the programming and service delivery inclusive of youth. I'll speak to it very briefly, is our work with the Ontario Human Rights Commission to ensure that we have a lens to serve our community equitably from a policy and a systems level. But it also makes sure that we look at how we integrate with other human services as well. Next slide, please. And very briefly, as you know, this could be a longer discussion, but our work and our memorandum of agreement with the Peel Police Services Board and the Ontario Human Rights Commission is to be the first organization in Ontario to voluntarily adopt at training, service delivery model, policy process, data collection, to shift our emphasis to a human rights centric lens. And this is an ongoing project that's resourced in my team. It's sponsored by one of my deputies. And it is a multi-year action plan that we intend on modeling and hopefully having other police organizations in Ontario and Canada shift to that. The House of Commons came up with a standing report on systemic discrimination last week. Peel Police was identified as an organization that has been embarking forward on a plan, and we want to continue to make this work meaningful. It's going to take time to change the gaps that may exist, and we want to assure the community that this is not performative. A significant component of it is engagement, and we want to make sure that it's open and access to the individuals in our community that have lived experience that can help inform our work. Next slide, please. And as I conclude, I just want to talk to you about our efforts to make sure that we reflect our community. We have, as I led with, some of the best officers in Canada. We continue to hire this afternoon. I'll be swearing in a new contingent of constables and cadets. And this is our new campaign that's about to begin in the coming weeks. It's entitled Faces Appeal. It's targeted specifically to the communities, the age demographics, and the audience that would consider and come alongside of us. We've shifted to use words that you hear me say, being inclusive, innovative, inspiring people. And we want people that are going to further us in that space. The last set of intakes last year, 58% of our hires were racialized. We know that, based on last StatsCan data, 60% is the average. We know it's probably increased from that, but that is a remarkable number. We want to represent our community. As you can see, some of the skill sets from a gender-based and a linguistic standpoint are also quite impressive. We still continue to see people coming to us from all sorts of walks of life, which we hope and continue to do is to reflect our community. The next slide, finally, you've heard me say, good on the inside, good on the outside. We do mean it. There's been significant investments. Tomorrow, I'm presenting to the Police Services Board on how I'm, committing to creating, strong individuals, civilian and sworn in it. We recognize that the wellness of our officers are a key factor in how they serve the public and whether they can serve the public. We have seen increasing impact of PTSD and occupational stress injuries on our employees, as are seen in other emergency services. Our organizational wellness unit has a variety of plans and programs to support them. One thing we do believe, though, is aligning our people to the vision of where we want to be is also partly culture and organizational culture. And one of the things that I've come is to protect what's best in class and build on them, but also to shift the gaps where we can be exactly how we are telling the community that we want to be. And we've had the PricewaterhouseCoopers come do an assessment from a culture standpoint. We've got a significant multi-year plan in place. I have established internal support networks for our racialized, our 2S LGBTQ community, a variety of different cohorts, our former military personnels. And also tomorrow I'll be presenting to our Police Services Board on our leadership development plan. And that's nurturing our people so that, from a EI skills, a soft impact, the soft skills that have hard impact are invested in, as well as our EDI. And also to mention, as we move into the next slide, if you can change to that, is that we want to use innovation technology as a platform as we move forward. And you continue to see some of our announcements, not just from our being thoughtful about how we use our resources, that innovation and technology are a platform to serve the community better. It's not intended to be items that are, the shiny new thing that we can, come out in front of the community for. They're there to provide transformation for how our officers interact with the public. We call it our digital officer transformation. We want our officers, when they step out of the cruiser, to be able to serve the public, where you've heard me say, where you can, buy a house on an iPad and sign for your mortgage and your offer on a home. Our officers are still using flip notebooks. The ability for them to provide services and information, to be more sensitive to the needs of people instead of transporting them back to a division or sitting in the back of a cruiser, to be able to take a statement on a handheld device, to be able to know information right where they are, to integrate with all our other systems is critical for us to improve how we serve the community. And some of it is on the back end element of innovation and business analytics, as well as here in Peel Region, one of the icons is a public safety broadband. We operate, and every police agency in Canada operates on Rogers, Telus, Bell, and they're intended to serve all of us as a community. But as we've seen, that infrastructure can fail sometimes in providing resilient communications services to police, fire, and ambulance. Here in Peel and in the neighboring jurisdiction of Halton, we have the only public safety broadband network where we operate emergency services broadband ourselves. What that means is also a less reliance on commercial data when we don't need it, but when we need it the most, it's in crisis for our critical infrastructure, which means that Peel has one of the strongest backbone infrastructure should there be crisis in Canada. Next slide, please. So I just want to leave you with this idea, and this is sort of the aspirational thing you get from Nish and my team, is that our desire is to be the most progressive, inclusive, innovative police organization in Ontario, Canada, in North America, internationally, and we want to see the shift in everything we do. What I've spent the time presenting to you is a departure from how we traditionally saw policing. And we're utilizing, existing framework that is tied directly into what region and staff have asked this community to embrace. We frankly are asking every organization, not-for-profit or otherwise, to also look at where they can see bringing in other entities in a collaborative format in an upstream approach, because that's really what this is about, is eliminating systems gaps and pulling in other agencies. And so, what I'm leaving you with is a strategic map, and we're starting to see the outcomes of that, really in how we're serving the community differently, how we're providing services differently, but also how we're being smarter with the existing resources that we do have in a growing population. And we're applying that to our facilities plan. We know we have growth in the north and densification in Mississauga, and many of the councillors have had continuing dialogue with my team. We are, looking for a new division and working well with regional realty to find, and the cities. We're very thankful for that relationship to find, in a day and age where finding property is hard, to where we can increase our footprint. But we also know that how we deliver the services, not just the bricks and mortar, is also important. So with that, I want to thank the board, the board chair, Tia, for joining me, Chair Unica, and regional council and staff. I want to just again throw a shout out to, this is the last slide will be fine, or you can turn it off, that's fine. I want to thank regional council for the offline conversations with me, and my team appreciates the relationship and the ability to be responsive to the changing needs. We won't get it right all the time, but you need to know that you've got a leadership team that's part of the flexibility and willingness to be able to change, is to be able to listen and say, okay, we can do better here, and we're happily willing to entertain opportunities to actualize on that. My goal is to make sure this region becomes, the largest safe urban municipality in Canada. I know we do have our pressures, but it's going to come from a seismic shift to the way we do things. So with that, thank you for allowing me to not only present the annual report, which is attached there, to highlight some of the trends and the activities that are happening. But Chair Unica, I'll turn it back to you.
Chief, thank you very much. And the first point that I'd make, thank you for welcoming me last month when we spoke. And I'm so grateful that, as opposed to the usual, here are the slides, here's the numbers, et cetera, very budgetary. I'm so glad you mentioned you wanted to have more of a conversational, here's the bigger picture of what we're looking at. And boy, do I think you achieved that today. So very, very well done to you and your team. And also Chair Atia and Vice Chair Chatha. Thank you very much for this. I have questioners. My list is Santos, Parrish, Dasco, and Paleshi. Councillor Santos.
Thank you so much. And through you, Mr. Chair, to the chief, I think the most progressive and innovative police organization is an amazing vision that you have for the department. So congratulations. And I will say that when you're challenging the status quo, doing things differently, you usually get criticized for trying and then criticized for not trying at the same time. And so it's tough work to do some of the progressive and innovative things that you're doing, and know that I certainly support the work that you're doing. As you know, I am a huge advocate to address gender-based violence and family intimate partner violence. And the video that you shared was incredibly powerful and impactful, I have to say. And I don't know when it's being launched, but I am very keen to start sharing and sharing that video and communicating that video. You also mentioned that we need to strengthen other aspects of our human services as we work towards a different model in approaching the issue of domestic violence. And we had our awareness campaign in November. We're continuing to revise it. And what I'm hearing from our agencies is that, as you know, with Safe Center Peel, and that slide you had, as we start to change the model, there's going to be more demand for the agency's support. And just like the woman in the video who said, she didn't leave because she didn't know what was available to her if she left. And there is so much risk associated as well with leaving. And so in follow-up to our government relations meeting that we had last week, I requested a meeting with Mr. Jill Dunlop. And I'm going to suggest that we have somebody from police there as well as from the agencies there, because what we want to show to the province is that we are taking a collaborative, progressive, and innovative approach, and we need more support and funding when it comes to our agencies so that we can provide that support to the women, and quite frankly, even the persecutors who are trying to, in an upstream way, we're trying to address the issue. So I'm wondering if we can just make sure we have a police presence in that meeting with Jill Dunlop, and show to them that we have the support for police in terms of making sure that our agencies are funded. I know that my colleagues will have other questions. I just wanted to focus in on this one in particular and say thank you very much for taking a different approach.
Thank you, Councilor Santos. And let me say that I'll have my team connect with you offline regarding some of the communication pieces as it pertains to that video and anything else that's coming out of the new initiative. I couldn't agree with you more. Chair Unica and Chair Atia and I have all separately had conversations. And the mayors definitely know we've chatted in the Police Services Board about opportunities to strengthen the narrative around funding human services here. We have some thoughts and ideas, and would be happy to engage you. They're kind of, let me just say they're getting the ingredients together. To say they're half baked would be an understatement. But we want to look at this. I think the appropriate discussion point and the lens for looking at systems coordination of funding here in our municipality is right in our doorstep. Frankly, it's the community safety well-being plan, and systems level coordination, especially the areas of priority through that lens, is probably the discussion point. And my team have been talking based on other conversations we've had on ideas. So we'd happily, connect with you as it pertains to any discussions you have with the province. But we are also looking forward to some work under the banner of our regional CSWB plan, which we're discussing now.
Thank you, Councillor. Go ahead, Councillor. So one last quick point.
Yeah, one last quick one. I just wanted to point out that we do have a delegation today from BPW who's actually going to be presenting on this particular issue and talking about funding as well. So anyway, I thank you very much, Chief.
Thank you, Councillor Parrish.
Yes, I want to particularly thank you, Chief. There's been a perceptible change in Malton. Things have started to improve greatly up there. Even under COVID, I think things are getting better. The police station being there makes a huge difference. And the gentlemen you have in that station are very good community representatives. I have a meeting tomorrow. The Malton Youth Hub is coming along really, really well. And one of the things that they'll be doing shortly is looking for agencies, youth agencies within the community to put 4 permanent ones in that building. It's going to be like a co-op building. There's no rent. They just pool the resources and cover all their needs. I'm going to ask them tomorrow to reach out to you, because there's 2 things that we really like, and that would be to have your plainclothes youth workers in the hub, socializing with the kids, moving around with them and making them comfortable and letting them know they can go to you if they've got problems. But the second thing is we're very shortly opening the Navatia basketball program in Paul Coffey Park. We're resurfacing the courts right now, and to have some officers out there playing basketball with them in 3-on-3, the more we can get the kids looking at the police as their go-to people if they've got a problem, the better it is, rather than uniformed guys coming in and whacking them on the head. It was interesting to hear about the flip notebooks. My father was an officer in Toronto for 37 years, and he had stacks of those flip notebooks. I can't believe nothing has changed, but it was always good because his buddies would ask him to fix a ticket, and he'd go, "Nope, it's in my notebook. I can't tear out a page." So they had their purpose. But I really thank you for what you're doing in Malton, and I thank you for the presentation. That's very progressive. This is a very, very good piece to put out to the public, and thank you very much. And I will be having them contact you tomorrow.
Thank you, Councillor Parrish. We're happy to engage with you on all of that.
Thank you, Councillor Parrish. Councillor Dasko.
Thank you through the chair. And again, I wanted to thank Chief Nish. just talk about progressive. Yeah, this is extremely progressive. Everything that we've been hearing, I think, is from what I've heard for years. Well before I got on council. This is conversation that people have mentioned in terms of policing and what makes sense, and good to see the direction that things are going in. And I think one in particular that most folks would know is road safety is a particular sweet spot for my heart and a passion for me. And I'm so glad to see the additional resources that are getting put into it, and as well seeing Road Watch coming back to life. And at road safety, we see the metrics that are coming in, and it just goes to show that I think it's resources well spent. And also, just to let you know too, Chief Nish is with regards to Project Noisemaker and Erase, etc. We had a motion that worked on with Councillor Raz. She had done last year and brought forward again this year. We also changed some things around a bit with regards to modified exhausts, because I know your phones must be ringing off the hook as ours do with regards to this. And again, recognizing that the tools that you have at your disposal as a department, they're not. I don't think they're ample, but I just wanted to say that we're trying to push for additional measures that you can have in the toolbox. I hate using that term, but it just seems appropriate in this particular instance. And just to let you know that we had started out of my office an unofficial petition to help support giving some more teeth into getting rid of these modified mufflers over 80 decibels, and also allowing you to fine people more than $110, which is I think way outdated. And in the 2 weeks that we've had it going, we're well over 1,100 signatures on this, and so we're trying to do what we can. But I just wanted to say a big thank you again for all that you're doing, because I think you're definitely on the right path and the resources are going in the right direction. And also, I think this community-based approach that you've got is bang on. So thank you.
Thank you, Councilor Dasco. And I'll just have my team, they're all kind of scrummed over here, 6 feet apart, are going to follow up with you, because there's some opportunities at the provincial level should the advocacy continue about changes to legislation and fines. We'd happily explore that with you to get a bigger platform. Thank you for your efforts.
Thank you, Councillor Dasco. Councillor Paleshi.
Thank you very much, Mr. Chair. Thanks, Chief. You and your team continue to impress. Two quick things, Chief. I'd like to. I'll send out an invite maybe in the next couple of weeks to get into a virtual room with the landowners group from the Northwest for that new division. I think we can come out with some new, different, maybe some innovative ways of delivering on what we can deliver at a reasonable cost. Maybe we keep real estate and legal out of it for now and see if we can all get into that virtual room and bang something out. Chief, when I was listening to your presentation, and I may have missed it, but one thing that I'd like you to touch on is the well-being of our officers, and we're always trying to look at different ways in handling the stability and mental health and well-being of our either officers or fighters at the municipal level. Can you talk a little bit about that?
Yes, absolutely. Thank you, first of all, for your contributions and your work and our conversations today. Happily chat about our footprint and opportunities there. As it relates to the wellness of ourselves, I know I've talked to Chief Bailey, Rizzi, and Boys, as well as Chief Dundas. Is quite significant. So one of the things we've seen is that having a strong and good workforce, many of our officers spend 30 years. I think Councilor Parrish, your dad probably had 30 plus. They're here for a long time, and the things that they see and experience is one thing, but we're also aware now of the concept of vicarious trauma, which our dispatchers, our communicators, the people who work in forensics and ident are all experiencing. So our efforts right now from an organization perspective are multi-pronged. So we've got an emphasis on well-being, health and well-being through an organizational wellness bureau. We have found an offsite property for them because there's some stigma in coming to get counseling and resources within the four walls of, you see the chief and then I don't really want to come in and talk to somebody when they're there. So, but part of that is we have a program called Safeguarding. It's not the answer to everything, but what it does is baseline people when they enter a team or unit with psychological assessment, and it has an annual cycle of rechecking in on them and looking for deviations. And so that's a significant one. It's not just for the high risk units. We would love to roll it out into multiple other units. We know that the OPP experienced a high number of officer-related suicides last year, and we've seen them in other organizations this year. It is at the front of our mind. We also have a peer support and chaplaincy program and a workplace mental health strategy. As of this year, we're enhancing the number of psychologists on contract on staff to help support us for in crisis. Our benefits and our plans and EAP obviously allow for counseling services for family and members, but sometimes there's that delta before they can get to it that the crisis is emergent. And so we're really trying to invest in that. Some of the more interesting discussions, and Chair Unica and I have had that chat and with the other emergency services, is there an opportunity for our municipality to pool or share service delivery? There's some economies of scale, perhaps even the ability to actualize on funding from outside of our region. So these are all on the go. Can I say that they're enough? No, but we encourage our people to make sure we look after each other, look over your shoulder, and we do know that there's a lot of pressure. I have officers from, and I'm not going to minimize the fatality at the fatalities we had. We have some officers that have just not been able to return well enough into the space of work again post a post-traumatic incident, and that happens infrequently, but it does have an impact on our people.
Thank you, Councillor Paleshi.
Yeah, and
go ahead, Michael. Go ahead.
Final, just really important that all the officers and frontline staff know that we don't live in the world of rubbing dirt in it anymore. We want to be here. We want to support. We want them to support each other. We want them to know that now's the time to talk. When we're working with the community, we want them talking, but we want all of those frontline officers and frontliners in total to know that we're there to support them, whatever they need. And so thank you, Chief. I appreciate the conversation.
Appreciate your support. Thank you.
Thank you, Councillor Demerla.
Chair, and good to see you, Chief Nishan, and my accolades to you as well. Great presentation. I just wanted to touch a little bit on Cooksville. I think pre-COVID, we had a date for you to come and visit Cooksville and see for yourself some of the challenges that we're facing, but I know COVID sort of put a bit of a spanner in that, and I'm hoping that now that things are sort of starting to settle down, that perhaps we can arrange a bit of a tour. I also wanted to say that Superintendent Robert Ryan, and I know he's just gone on vacation now, but he had been just fantastic in terms of the support that he's given the Cooksville area, and I do look forward to working with Superintendent Rob Hicks, who's taken over 12th Division. But when we meet and hopefully do the tour, I hope to introduce you to the BIA, and they can also talk to you about some of the challenges, particularly around homelessness and vagrancy, petty crime, that's being a real challenge for local businesses over there. And also perhaps to talk to you about some of the innovative solutions that we are trying in Cooksville, and so that you're up to speed. So I look forward to that conversation. But again, thank you for everything that you do.
Thank you. Absolutely. Look forward to joining you and with Superintendent Higgs. We'd happily come down there to the area.
Thank you. Thank you, Councillor DeMero. That concludes my list. I'm going to ask Councillor Parrish and Councillor Santos to move receipt of the overview. Is anybody opposed? That is carried unanimously. Chief, thank you to you. Thank you to Chair Attia. Chief, you bring to mind an adage that I didn't come up with it, but used for years when I was on the CVC, when all of us involved in that are out to trying to plant as many trees as we can. And wherever we were out to those tree plantings, I had the privilege of saying, because I learned it from someone else, as I would say to the young kids, the best time to plant a tree is 20 years ago, but we can't go back and plant 20 years ago. The next best time is today. Boy, Chief, you and the board and the service and all our team, boy, we're planting a lot of trees thanks to you and the team. So well done, because they're going to reap quite a harvest for us. Okay, thank you very much for that, Chief. I move on to our next delegation. That would be John McKenzie, Chief Executive Officer for the Toronto and Region Conservation Authority. John, welcome. And John, I can see your slides, but I can't hear you. Perhaps you're muted?
Yes, I was.
Very
can you
good.
hear me now? Thank you.
Yes, I can. Thank you.
Great. Good morning, Chair Ainika, and thank you so much. I really appreciate the opportunity to be in front of you today, and I know you have a busy agenda, so I'm going to get right to it. So I'm John McKenzie, CEO of TRCA, and on the call with me today is Michael Talensky, who's our Chief Financial and Operating Officer. And as well, I have Jen Moravik, Manager of Strategic Business Planning and Performance, and Victoria Kremkowski, who is our Government and Community Relations Specialist for Peel Region. So I wanted to begin by thanking the team at the region for your continued valued support as a partner in this unprecedented 2020 and the first 6 months of 2021. We, in partnership with the region, have quickly adapted to providing seamless service in the COVID-19 environment, and this has included a new digital platform for learning, safe protocols, for working outside in the field. And additionally, we've been able to accelerate work on some of our shared priority projects that I know, Chair, you hold near and dear to you, including Jim Tovey Conservation Area. We've also included and expanded our role as a scientific and trusted advisor to government on projects ranging from the GTA West to Lamentria, Dispar, Moth infestations in Peel Region that I know you and your colleagues have heard a lot about. So we thank you for your involvement, and so many of you have participated in our webinars and information sessions related to LDD, and we greatly appreciate all of that. So we remain committed to working with your staff and your team on the details of all of our on the details of this proposed budget, and we greatly appreciate your continued support. So I'll move to the next slide. Very quickly, I wanted to recap that we organize our activities according to Peel's 3 funding streams: watershed, climate, and infrastructure. And the following slides provide some of our high-level outputs anticipated in 2021. I won't go into the details, but these slides have been provided to you for your review. So you can see many different outputs here, and we're very focused on the metrics to make sure that we have those tangible, reportable results for you and the citizens of Peel Region. I'm going to move to the next slide, please. So on climate, in climate, our outputs include works to improve our adaptability and resilience to climate change impacts. 50 local businesses in Peel Region were engaged in the materials exchange program, as an example, to divert 14,887 kilograms of waste from landfills. Waste materials diverted include furniture, organics, plastics, single-use items, and textiles. And we also have advanced many of the important SNAP projects, Bolton West SNAP, retrofit projects across Peel Region. And so lots of great activities underway, and I know many of you have participated in those virtually, and looking forward to getting back out there in person soon. Moving to the next slide, please. On infrastructure, our outputs include works to protect Peel assets and address hazards. So we are always looking to make sure we protect the Region of Peel's infrastructure investments. On property acquisition, and I'm very, very excited about this one, with the Region of Peel's support, we acquired over 60 hectares of land to complement Albion Hills Conservation Area over the past year. And this was an amazing addition to the Albion Hills Conservation Area, the Humber River Trail, and I'll talk a little bit about that later, but that's just an example. And I think, you know, we are doing a lot of great work with your staff, you know, Commissioner Dedman, others. We're doing great work to protect your infrastructure. Next slide, please. Watershed studies and strategies. So here are a few highlights by service area. One of the things I wanted to bring to your attention was that TRCA launched the Watersheds and Ecosystems Reporting web application on Earth Day, April 22nd. Staff will soon be setting up webinars with our partners at Peel Region and our local municipalities on how to best navigate this platform to help you get your work done and to gather the information they need for informing their projects and plans. This webinar will discuss how CVC and TRCA will support future iterations of the Peel official plan monitoring and measuring reports. And we've also advanced the watershed characterization work for Etobicoke Creek. That work for the Etobicoke Creek watershed plan is now complete. And we're working to ensure alignment with stakeholders on the current scope sub-watershed study. We're also scoping for the updated Humber River watershed plan, and that work is now underway with additional data being collected in the field to support the future plan. These two watershed studies will inform TRCA and Peel's approach to growth and infrastructure planning to create certainty for the many investments that are coming to Peel region. So next, I'd like to go to water risk management. For water risk management, TRCA's erosion risk management program will continue implementing phase 2 of the Bolton Berm project, which will remove 30 buildings from the 500-year storm floodplain. Portions of this work are now complete and performing, and the portions east of Humberlea, I think if you're out there, you can see the berm. It's coming together, taking shape. There's been plantings on it. Looks great. Additionally, we've undertaken work for the Brandon Gate Park Bank Stabilization Project, and this is being implemented this year to protect portions of a public trail in the city of Mississauga. And so a couple of great projects, this as an example of what we're doing on that front. So I'll move to the next slide, please, also on water risk management. So TRCA supported the City of Brampton in their successful application to the Disaster Mitigation and Adaptation Fund. This resulted in a $38.852 million federal contribution to this $95.9 million project that will mitigate flooding in downtown Brampton. We are working closely with the City of Brampton. We are working closely with the Region of Peel on the implementation of the Downtown Brampton Flood Protection Project, the Riverwalk Urban Design Master Plan, and to implement the project through our MOU, an updated MOU that we recently worked through with the City of Brampton. The process will complement the flood protection solution that was approved through the EA process, where TRCA and the City of Brampton move forward as co-proponents, and it will create a dynamic, resilient public realm and green space for downtown Brampton. Next slide, please. On regional biodiversity, we are continuing implementation of the Jefferson, Jordan, and Jayfield Parks Stream Restoration Project in Brampton, which was initiated in 2020 and will be phased over multiple years. This will restore a stream that was a concrete trapezoid channel, and I gotta tell you, it looks great, and really proud of the work going on there. Staff worked to leverage $700,000 of funding to expand the scope of work to incorporate aspects of the City of Brampton's Eco Park concept into the design. Trails will be better integrated into our natural system here and will be realigned where appropriate. Exercise amenities will be added to the park, and natural playgrounds will be installed that incorporate natural logs and wood features as play structures to connect residents to nature and to beautify this area. TRCA has made great progress in creating a more natural channel to decrease flow velocities and improve fish and invertebrate habitat. And this is a great example of how, when we work together, we can restore our aging infrastructure to create a net ecological and community benefit. Next slide, please. Green space securement and management. In 2021, Glen Haffey Conservation Area will be the focus of planning activities, including the initiation of the Glen Haffey Master Plan as part of the Niagara Escarpment Parks and Open Space System requirements. Over the last year, TRCA, with funding support from the Region of Peel, has acquired 62.6 hectares of environmentally sensitive green space lands near Albion Hills Conservation Park. 41.7 hectares was acquired at the end of 2020, and 20.9 hectares was acquired at the beginning of 2021. And like I said, this is going to be very helpful in us advancing the components of the Humber River Trail and our regional TRCA's regional trail strategy that we've worked with Peel on, and that implements the Active Together in Caledon. So it's a win for the community and a win for the citizens of Peel region. Next slide, please. On tourism and recreation, TRCA will continue to expand our trail network in Peel region. We'll continue our construction of the West Humber Trail and around the Bolton Resource Management Track. As well, we've installed a high-efficiency air source heat pump to the Indian Line campground area. Units will be a primary source of heat for the buildings and are projected to reduce electricity usage. So again, another example of making improvements as we upgrade aging infrastructure. TRCA secured a revenue-generating film agreement with productions including C that's taking place at Clairville Conservation Area and other sites across our region. TRCA revenues will help to offset COVID-19 losses and will help TRCA provide conservation parks and lands amenity improvements for visitors, notably at Clairville, but also at Heart Lake. And we've had filming there, and when we had The Man from Toronto being filmed at Heart Lake, and Councillor Peleshi's word, he'll note that we got the crews to help upgrade some of the walkways and the stairwells, and et cetera, going down to the lake. And so we're trying to use these opportunities that are great tourism boosters and economic boosters to upgrade our facilities as well. And appreciate that we're able to do that in this COVID environment. Now moving to planning and development. Planning and development is, of course, fast and furious in Peel region. From a planning perspective, TRCA continues to be involved in growth and infrastructure planning in a big way. Our staff will continue to support Peel regions and our partner municipalities' ongoing work as part of their municipal comprehensive reviews. That's something that we play a big role in through our many studies that help inform those processes. TRCA is working with partners on several minister zoning order requests that are being considered or pursued by landowners and being considered by the ministry. They do reach out to us and take into account our advice on these. TRCA is part of the Conservation Authority's working group, the provincial working group that is providing advice and to the government. And I do want to just thank the chair of that group, Hassan Bassett, for his incredible leadership and his work with First Minister Urick, and now we're moving forward with Minister Piccini to ensure that we carry on the good work and collaboration involving the municipalities and the AMO representatives, and also the building industry and agricultural representatives that are part of that. A large focus of TRCA's effort will be on informing upcoming regulations by MECP and MNRF to make sure they reflect our relationships that we have with our partners like Peel. There's the Phase 1 Regulatory Proposal Consultation Guide, and our second report on this will come forward tomorrow to TRCA's Board of Directors, and we'll be submitting our detailed comments following any additional input at that meeting tomorrow. TRCA is going to keep working towards meeting the required timelines that the ministry has put forward for having MOUs and service level agreements, MOUs in particular, in place. We'll continue to work with staff at the region to develop MOU and SL agreements, and we're doing that with all of our partners across our jurisdiction as required to deliver our programs and services. So we have reported to our board many times on this already, and we've got template MOUs, and we're advancing this as quickly as we can in partnership. And Leary and team at the region have held a number of great discussions with us to continue as we work forward on this with your senior team at Peel. And I really want to thank the administration at Peel for jumping into this and really setting the bar for the province of Ontario in terms of getting ahead of what is going to be a requirement to have these MOUs in place. So moving on to education and outreach. TRCA's education and outreach training has developed a whole virtual learning strategy, which provides direction for staff to develop and deliver online programming. As we move it through 2021, we will continue to focus on virtual learning, as well as develop blended teaching models which combine in-person and online learning. We hope to engage 48 participants this summer through Girls Can Too still. Building projects will include revitalizing the beach at Heart Lake Conservation area and building 1 or 2 cabins at Albion Hills Conservation Area while working alongside mentors in the skilled trades. So great opportunity that we're doing in partnership with others. I'll move on to the next slide, please. Sustainable communities. SNAP, Partners in Project Green, and other programs plan to engage over 2,000 community members across Peel through a variety of mediums this year. We have a new ARC hydroanalysis project, which is a GIS data structure system that links hydrological data to water resource modeling. That's being carried out in partnership with Credit Valley Conservation to support the town of Caledon in development of their master plans to understand how green infrastructure could be applied. And that's just one example of some of the work on sustainable communities, but there's many others, and I just wanted to bring that up. So now I do want to just very quickly, and with the support of the team, your great team of clerks, I wanted to show a very short video without sound of how we are advancing the Jim Tovey Conservation Area project in partnership with of course, Peel as our main partner, Credit Valley Conservation Authority, the building industry nearby that's helping us and that we work with on this project, the city of Mississauga, and also to our waterfront stakeholders and the community that are completely on board in support of this. So hopefully we can get some images up here on this, and I appreciate. Many of you have been out there, but I did want to maybe speak about the great progress that's being made on this project since you've been out there last. And I know I can see so many of you that are familiar with this site, but you can see that we have, over the last year, actually been able to accelerate some of the good construction work here. We've been able to move forward and put in place some of the habitat islands that connect and also the elements of the shoreline that connects Marie Curtis Park to the Jim Tovey Park. So a lot of great work underway. With the CVCA, it's been a lot of that's been planted over the last couple of months, and we'll continue to work recognizing that there's also the infrastructure upgrades going on behind at the plant, and and again, work to make sure that this is going to be an amazing benefit to the community. So, and a great legacy to Jim Tovey, who we all hold near and dear to our hearts. So next, I just want to speak a little bit about our climate change and our climate change performance management system. We've been working very closely with your team, and over the first half of 2021, our project planning team made up of both the TRCA and Credit Valley Conservation staff completed all required consultations and secured project approval for moving forward with this performance measurement system. An endorsement for the implementation of this project to support Peel's review of TRCA's climate change levy is being sought by regional staff and will be detailed in a recommendation report included on your council agenda. So that's again the work that we've done. The measures have been incorporated into a staff report that is also being considered by council. TRCA and CBC staff, with guidance from Peel's Office of Climate Change and Energy, will continue to operationalize this performance management system. This will include the collection of data and analysis as informed by the system as we move forward together. So just want to now move to our 3-year forecast from the 2021 budget. This slide shows the approved 2021 budget and forecasted amounts from the 2021 budget submission. Given economic uncertainty, no budget target was recommended by the Region of Peel Council, but I think we, as we always do, work very closely with staff to take into account your envelopes and what is I guess required based on your other budget priorities. Moving to the next slide on 2022 provincial funding impacts. We have not yet received confirmation from the Ministry of Natural Resources and Forestry regarding the Section 39 funding for the 2021 and 2022 fiscal year, but at this time we anticipate the funding to be the same as 2020 and 2021, so there's really no anticipated change. Moving forward to the next slide. This slide is our revised 3-year forecast, and it shows and it reflects some of those current fiscal pressures that have been identified by your staff to us. And the 2021 general levy was revised to be consistent with a 3% increase year over year. TRCA recognizes that this forecast may be impacted by proposed Conservation Authorities Act regulations, which have not been released as yet, but TRCA is continuing to work with our partner municipalities to proactively prepare these service level agreements and transition towards a fee-for-service model for all the non-mandatory services once that's confirmed. We appreciate that you are facing unprecedented fiscal pressures related to COVID-19, and we are committed to working with you to ensure that we meet the funding envelopes that are provided by staff, as we always do in collaboration with your staff. So next slide, please. I just wanted to, I guess, point out a few risks just for Council's consideration and our collective consideration as we move forward. We're still involved in providing input, as I spoke to before, on the regulatory proposals. We don't have detailed regulations, but we are providing our insights. And again, through the great leadership of Hassan and team, we're working through that Conservation Authorities Working Group as well. We're working to develop and implement these memorandums of understanding and service level agreements with our partner municipalities and the lower tier municipalities within Peel to deliver the TRCA services that they require and desire. The local municipalities have expressed interest in understanding and procuring TRCA services to help advance some of our shared objectives, including elements of their capital plans that make sense if they're within TRCA's permitted area or it's within an area where we have expertise in delivering projects. We continue to hold those meetings with our municipal partners and agency partners across our jurisdiction to highlight the need for these SLAs, to discuss priority projects and opportunities. TRC has developed a template MOU SLA, a municipal council report that can be used by our partners as they move forward into this process. We've already had some early discussions with the Peel team on a transition plan report required by the province by the end of 2021. We will engage your staff and the local municipalities as needed as we go forward on that. And we will continue to respond and adapt to the ongoing provincial announcements and direction related to COVID-19. Our conservation areas are reopening. More and more elements of the conservation areas are opening up. Summer day camps were at issue, and education programs have adapted where possible to provide virtual learning opportunities. And we continue to adapt just like you have to under this current situation with public health being paramount. So just one last slide on residual impacts of the pandemic and recovery. TRCA continues to mitigate our financial impacts that we felt during the ongoing pandemic through expenditure reductions, ongoing monitoring of authority-generated revenue, and also, I think I mentioned on the filming front, looking for other opportunities to get revenue within our conservation areas. We hope to see more parks and facilities permitted to safely open, and we are offering, as we are able to offer more of those services as required and in concert with public health. With regards to education, we are in ongoing discussions, and we completed our education task force work. We're moving forward, discussing all of the findings of that with the school boards to begin to plan a safe reintroduction of class field trips when appropriate. Hopefully in the fall, and where public health conditions permit, with day field trips anticipated perhaps in late 2021. And we're optimistic that we'll get back to overnight excursions in 2022. There's so many other things I could speak about, but I guess in closing, I just want to thank you on behalf of all of our team, our senior team at TRCA, and all of us in our organization for your continued support of these important partner initiatives. My CFO, Michael Talansky, and I, and members of our team are here to take any questions. Thank you, Chair Anika.
John, thank you very much for your presentation. And I do have a list of questioners. Ines, Demerla, Dasco, and Santos. TRCA Chair Ines, you're up.
Thank you. Thank you, John, for your presentation. I just wanted to say thank you to your team. And I'm not going to speak at all of the presenters, so I'll say it now. Thank you to Hassan, who I'm sure is also on from Halton, for leading the charge in the Conservation Acts Working Group and providing comments on the draft regulations that are coming forward. It's a big effort. It's very important for Peel, especially in regards to planning matters moving forward and ensuring the protection of our watersheds, and that we're planning with the watersheds in mind. So a big thank you to the team for working on that. I also wanted to just say, Chair, I think that last year we made the comment that we asked that CAs not be done at the same time as our police. Because it's almost 11:30 now. We're going to be rushed through these next three because we haven't even gotten to COVID yet. And quite frankly, this is very important. It's a big part of our budget. It's over the past year, we've seen how important our green spaces and the ability to connect people to nature are. And I want to make sure that it's given the proper time. And I have all kinds of questions that I could ask. I'm sure lots of members have questions in particular about SNAP or the Jim Tovey and the Lakeview. There's lots of great work and initiatives that have happened, but I feel like we're all kind of being rushed. So I would ask again that next year this is not at the same time as the police, that it's separated, because they're both very important and should be given that a lot of time. That being said, I just wanted to say thank you. Thank you for all of the work. I did speak about the acquirement through the Greenlands Acquisition Fund at Peel Region to the expansion of Albion Hills, which is a huge accomplishment and significant achievement for all of Peel, as that destination is within an hour's drive of 8 million people. So a very big thank you to the team in making that happen. And Chair Raz from CBC and I had the honor of doing a little tour a couple weeks ago to get an update at Lakeview, and it's spectacular to see how much work has happened and how it's coming together and how Jim's vision is being realized. So a very big thank you to you and CBC for your hard work on that initiative. Thank you.
Thank you. Councillor Demerla.
Thank you, Chair. And John, I just want to take the opportunity to thank you on a few levels. One is for really strong leadership. You've helped steer the TRCA through some very challenging, issues around MZOs and, all sorts of things, and the changes to the Conservation Act, and sort of negotiating and trying to make decisions in real time as we've had to deal with some of the changes to the Act. So thank you for that. You and your team did a fantastic job in helping the board sort of navigate those issues and clarify. And the second thing that I really want to thank you and your team and Victoria is, the progressive lens you really put on the issue of the scattering of the ashes and some of the changes that I know we are going to make to our policies at the TRCA with respect to that. I think that's shown a lot of leadership. I also want to congratulate Chair Innes for her interest on this issue. And I really, really hope John, that as we make these changes, that we will share the changes, small as they might be. They're very meaningful in terms of the lens that we put from the idea that somehow scattering ashes is degrading the environment to moving on to a more balanced approach, and share that with the other conservation authorities so that hopefully they can also, align themselves with the leadership that the TRCA is taking on this file. So I really want to thank you. I know the city of Mississauga is actively engaged in looking at providing further facilities for all of the communities that like to immerse ashes. I really want to move away from the term scattering of ashes to the immersion of ashes, which is more appropriate. So it's all very exciting on this file. It's a file that I'm personally very interested in, and I'm really grateful for the opportunity to be able to serve on the TRCA and sort of bring some focus to this particular issue. So thank you.
Thank you. Councillor Dasko.
Thank you through the chair. And John, great presentation. Nice to see all the work at the Jim Tovey Lakeview Conservation Area. And I just, more of a comment than a question, because just seeing all of this and the collaboration that's going on with between yourself, CBC and the Lakeview partners is pretty incredible. I was down there last, I guess about a month and a half ago, and saw Searson Creek, and I've got to say it just about knocked me over. It's incredible to see. Unbelievable is the best way that I can really put it, and also it's really exciting that we've got morphology coming up later this year, which I think is going to be pretty incredible, and it's going to knock the socks off a lot of folks because we didn't have it last year. It wasn't just with the pandemic. It was planned that we would take a year off and then come back again this year, and all the changes that have gone on down there, pretty incredible, and it's a real legacy in the making. So I just wanted to say a big thanks again for all the work.
And thank you, Councillor, for being with us down there and getting those ministers out there and working together and making sure that there's ongoing awareness of this project. I know every time I go out there, it changes, and I pop by to the construction camp every couple of weeks just to check in with staff. And I know Chair Raz and Chair Innes, we enjoyed consuming a whole bunch of non-biting midges, even with masks on and glasses and all of our PPE. We were still, I don't know, I still think we ate maybe a pound of non-biting midges for lunch that day. But anyway, it's great, the work that's continuing on. And again, the partnership between the region and the city and the Lakeview partners and the community groups that are supportive of this project, and Great Lakes Waterfront Trail and a whole series of people involved here. I think it's an amazing tribute to Jim Tovey, who we all respect, and again, I really appreciate all the continued support on this. Thank you.
Thank you. Councillor Santos.
Thank you, and through you, Mr. Chair, thank you, John, for this update. I have to say it's a real honor and privilege to serve on the board of the TRCA with Chair Innes and Councillor Pleshy, Councillor Fonseca, and Councillor Demerla. I really enjoy being part of the TRCA. We are doing incredible work across the region together, particularly with the Riverwalk, as well as with the JJJ, as well as Bike the Creek, which is a lot of fun together to do this year. I have to say, though, like in the public discourse lately, even at the table of FCM, there's a lot of conversation about recognizing infrastructure assets beyond just concrete and sidewalks, and actually starting to put some monetization, environmental economics onto our natural heritage as we start to move into that direction. And a lot of the work we're doing at the TRCA and other conservation authorities speaks to that type of natural green infrastructure. Just wondering if you could comment on some of the things that perhaps TRCA is doing to start to contribute to that important conversation related to recognizing our natural heritage and green infrastructure as assets for municipalities.
Thank you so much, and again, I really appreciate your energy and commitment to the work that we're doing there on our board. But on valuing and green natural assets and the work that is going on at TRCA, we've actually undertaken a number of reports and have been trying to put values against natural infrastructure, green infrastructure, to inform the asset management planning of our partners and also TRCA's own asset management planning. So we have conducted a fairly comprehensive study. We actually have PhDs that have done some of their work and that are TRCA staff that have done their work in this field and have brought that information back into. So as follow-up, I think this is an important need from our municipal partners. We've got some leading edge work here on valuing natural and green infrastructure as part of the whole asset management process. So I think through the Peel Climate Change Partnership and through our ongoing work with your team and our partners, we can pass along some of this to inform the asset management planning. And I'll make a point to include it on and to discuss this with Commissioner Dedman, different commissioners in the system to make sure we've got the right information going forward to inform your asset management planning. But thank you for bringing it up.
Yeah, no, it's awesome, because I think that we're starting to shift the culture and discussion around climate change and the environment. And I think living in the suburbs, people just automatically assume that the environment is just something to enjoy and to be consumed, versus it actually being an asset that saves and will save, given the impacts of climate change, municipalities' money, and therefore hit the property, like the property taxes, and be potential savings for the future. So that monetization and valuing our natural assets is an important piece, especially as the federal government, provincial government move into the direction of funding such projects. So thank you, John, and thank you for all the work you do.
Thank you. Councillor Fonseca.
Thank you very much, through Mr. Chair. Thank you, John, for the fulsome presentation, fitting so much into a quick bite of time. I echo what Chair Innes has said, that to you, Mr. Chair, if we can ensure that there is moving forward time allotted for the conservation authorities to present, I think it's extremely important, and we don't want to rush through this. If there's one thing that I have learned over my time on the TRCA, but also through the pandemic, is that moving forward for a resilient recovery for Peel and Mississauga and Brampton and Caledon is that our commitment and time invested in our natural resources, in conservation, in our watersheds it's essential. So I do want to echo what has been said about the programs and the commitment of TRCA, in particular the flood monitoring and mapping and mitigation, 2D and 3D modeling in the Dixie, Dundas, Little Etobicoke Creek and Etobicoke Creek watersheds. This work, it's a long time coming, but the work that's being done there and the time invested in that by the TRCA, working in collaboration with the City of Mississauga, different departments, is essential for moving forward on Dundas Connects, on appropriate built form for residents and for businesses. So I do want to say thank you for that. Echo what's been said about the trail strategy and all the work that the TRCA has put into the trail strategy throughout the watershed. I also wanted to just comment on you went through it pretty quickly through the presentation, but the amount of waste, plastic waste and other, that TRCA and through stewardship programs and staff have taken out of the TRCA watershed is just unbelievable. And I think there would be a lot of more devastating impacts if there wasn't that commitment that was in place. And to also comment on what the TRCA has achieved in terms of innovative ways to continue to engage the youth throughout the pandemic. There's a whole list of them. Is just been wonderful. And just to comment to Councillor Santos's point, I know that TRCA last year, and I believe the year before, applied for and was successful in applying for through FCM, the Green Municipal Fund. They were recognized for the Sustainable Neighborhoods Action Plan and participated in the Sustainable Communities Conference. So I hope and encourage TRCA to apply again through the Green Municipal Fund, because if there's one thing that's certain, programs like the SNAP and also partnerships through Partners in Project Green is that TRCA has successfully shown that there's programs that can be rolled out both in the public realm and also for the private sector, working together and collaborating that can ensure conservation and resilience for years to come. They're programs that can be adapted and worked on to what has already been recognized is valuing our natural infrastructure just as much as our hard infrastructure. So didn't really have any questions, just wanted to say and extend a huge thank you. And I too will echo that it's an honor to sit on the TRCA. Thank you.
Thank you. With that, that concludes my list of questioners. I would ask Chair Innes and Councillor Fonseca to move receipt. Are there any objections? Seeing none, John, thank you very much for your presentation. Okay, moving on, and maybe in terms of time management to help everybody out, I know we have our two other friends from the Conservation Authority, 7.3 and 7.4. It's 11:45. I'm sure they're going to take us to the 12:30 hours. So I will be calling a break then so that the back office and the team can get a bit of a break. Then I will be continuing on when we get back, I'm guessing 12:45, 1 o'clock with the rest of the agenda, just so that the deputants and Dr. Loh know they won't be called upon until that time. So it's my hope to get through Deborah Martin Downs and Hassan Bassett, and then the questions that relate, we're going to take our break then, and I think we'll be coming back for the continuation of the agenda around 1-ish, and I repeat, as a courtesy to our deputants so that they can manage their affairs. Okay, with that, Deborah Martin Downs, Chief Administrative Officer, Credit Valley Conservation, presenting the CVC mid-year budget update. I think we're also, Councillor Rass, we're going to bring up item 19.3, which you asked to be held, and I'll allow you to bring that forward and ask questions on that should you wish at this time as well. Deb, please.
Well, I can still say good morning, Terry and Nika. I was expecting to have to change it to afternoon, but thankfully I'm still on my notes here. So thank you for having us, and to the members of council for your indulgence. I'm going to be more than 5 minutes, but I will try to be less than the chief. So we'll do our best here. Somewhere out there in the little Hollywood Squares is Jeff Payne. He's our Director of Corporate Services, a Deputy CAO. So he's here to also answer questions and help us with the presentation. So next slide, please. Today, I'm just going to cover a few key accomplishments for 2020 and 2021 accomplishments to date, and of course, a few comments about our 22 budget. So next slide, please. So let's just move straight into the accomplishments for 2020. So it's time to update these slides, obviously, because they're not nearly as pretty as John's, but if I asked staff to provide less detail, they would be apoplectic. So they want everybody to know all the things that we've been doing. So it's our custom to provide these input-output slides so you can see the magnitude of the things we're doing, but I'm sure you're happy to know I don't intend to go through them in any detail. The slide accounts for what programs and services are supported through the general levy in this one, and the outputs roll up the level of activity towards the desired outcomes, which are in the right column. So building resilience is part of our core business, and we are, through the general levy, keeping development away from flood-prone hazard areas and matching managing for flood hazards, managing natural resources on a watershed basis, and protecting public lands. Next slide, please. This slide outlines the work we complete with our watershed projects in the special shared levy, and that's for watershed-wide projects. And much of this work is focused on understanding our watershed environment through inventory and monitoring data, collection, forestry operations, and restoration work. We take the view that you can't manage what's not measured, so we need that data to be able to apply science in our watershed. And these kind of projects are at risk from the recent changes to the Conservation Authority Act if municipalities are not able to continue to support them. Next slide, please. This slide outlines the substantial and imperative work we're doing under the Peel Climate Change funding. And there are three pots in this account that we roll up here into one, and that's water management, natural heritage, and education and sustainability actions. So the work here is largely accelerating much of the work we already do under existing programs and services. So we plant more trees, we're getting more stormwater management in the ground, we're engaging more landowners to take action on their urban and rural properties, and developing a variety of new tools to help us respond to climate change. Without these programs and services, we are not going to be as resilient to the change before us, but there's still a lot of work to be done, as you all know. Next slide, please. And then a final category that we report back on is our infrastructure projects, which supports our conservation area facilities, information technology, and information management systems, of which we've made huge progress over the last few years. And frankly, without it, we wouldn't have been COVID friendly at all. Our flood risk mapping, as well as major maintenance to our dams. Next slide, please. John already presented this slide. We weren't sure who was going first when we were putting our slide decks together. So I'm just going to skip this, other than to say that CBC is also committed to contributing to these KPIs with the Peel Climate Change Partnership, and we've been heavily involved in that progress. So I know that's on the agenda later on for you guys. Next slide, please. So just a brief update on some of our accomplishments. Next slide. I did provide a fair number of these over the last presentation in February, because we were later getting to you this year, but we were able to open the Bell Fountain in the Badlands in time for fall colors at the end of last year with an online reservation system in place to control the crowds. And we did extend our season, but we have still continued to see tremendous demand for outdoor recreation into 2021. And for the first time ever, we had over 1 million visitors to our park in 2020. Next slide, please. We've seen the trend continue into 2021, and this just shows you the increase in the first quarter of the visitors to all of our conservation areas. So almost 170% increase year over year, which is really been taxing on the staff, and certainly we're trying to do that with lesser people coming into the park. So it's been a real challenge. And with the next slide, it shows us the actual increase just in the Peel parks, so slightly higher, just at 174%. But this has been, a real. It's both. It's been certainly a recognition that our trails and public spaces are I'm going to call them essential services, and that we really need to consider them that way, and probably change the model and how we're doing some of this in the future, because we've just seen a complete change, and this is on top of the 200% of increase over the last decade we've seen to coming to our parks. So it's a huge change here in Peel, largely because of the growth that's going on, of course. Next slide, please. Due to, of course, the COVID restrictions, we were unable to open the Badlands until just this past weekend. We consider it a tourist attraction as opposed to an exercise attraction. So we're now up and running. It's only by online reservation. So if anybody asks you, please encourage them to go and make that reservation. While the park was closed, though, we took the time to complete the construction of a new staff operations structure with some air conditioning to get them out of the heat, which has been an objective of ours for the last couple of years of running it. And this will form the base of operations at this site. Slide, please. Now, we bought a drone and we've trained a pilot, so we want to share some of our great work and giving us a different view of the work we're doing. So, and it seems to be working, so this is good. On April 19th, we conducted a controlled burn at a naturalized grassland habitat in our Upper Credit Conservation Area. And this video clip shows the day that the drone fly over with the controlled burn and how it was progressing. The whole point of this burn is to maintain and protect prairie and grassland habitat. So the fire is carefully managed by fire experts to burn low to the ground and capturing dried grasses and leaves without harming the larger trees. So a pretty cool thing. And we were luckily that we had good weather and no incidents coming out of it. This spring, we also continued on with our nursery operations. Staff worked hard to pot over 40,000 trees and shrubs that will go into our projects as well as into Jim Tovey Conservation Area. The staff, I must say, they've come in every day up there and they're working very hard, and they've done it all with masks and shields and just as everyone has had to adapt to these things. But it's a tough slog when you're moving all plants and manual labor with masking on. So. Next slide, please. So we too have got a view here of Jim Tovey Conservation Area, but we took a different season, and than John's. And this video clip shows some of the work that staff have been doing with the naturalization. We have our invasive species crews completing over 2 weeks of garlic mustard, common reed, Japanese knotweed, and other invasive plant removals, which have already moved into the site, even though we're not even planted up very much. We've planted roughly 1,000 aquatic plants so far in Saracen wetland and installed roughly 2 kilometers in advance of planting 40,000 aquatic plants that will be installed in Applewood, this wetland, this summer in that wetland. Applewood Creek was connected to the new Applewood wetland in February, and the Saracen Creek channel works were completed by TRCA and Lakeview Community Partners over the winter, with hopes of redirecting the flows into the new naturalized Saracen Creek channel in July. So, and we're currently working on the public realm that we will be consulting on soon. The habitat we are creating is, and I think this is not, oh, oops. All right, yep, there we go. I could only see part of that. So the habitat we're creating has also attracted a lot of wildlife, both local and migrating species. And here's just a few shots from our motion-activated wildlife cam that are providing that overview for you. So while we have all been working hard and getting the physical structure, it doesn't take long before if you build it, they will come. It's happening. So next slide, please. And here's a video flyover of our Bell Fountain Conservation Area. Our board awarded the contract Friday to begin work on phase 1 of our management plan construction, which includes the channel, dam, bridge, and trail works that you've heard me talk about far too often. We're completing the restoration of the Bell Fountain as well. And in order to safely undertake all this work, the park will be closed for the public for this season. And it's already closed. It's been closed, of course, since last winter. Prep work is underway. We've been drawing down the head pond, and the contractors on site now, and we will start to remove sediment from the head pond in the coming weeks, and then start to work on the dam. And it all has to be done within the fisheries timing window for the brook trout. So we have a very, very significant and short timeline to get this done. So working with the Peel Climate Change Partnership with funding from Natural Resources Canada Zero Emission Vehicle Infrastructure Program, we've installed 6 level 2 chargers for electric vehicles at our head office. It was a goal of mine since I bought a plug-in hybrid 3 years ago to get these things on the ground, and so we now have them. We've now been able to purchase an electric vehicle, which we couldn't do previously. So, and it is open, of course, to the public who come to the Meadowvale Conservation Area nearby. So, thanks to the work of the Peel Climate Change Partnership to getting this reality in place. Next slide. And then the final clip I want to show you is showcasing our LID project that's part of the Fletcher's Creek Sustainable Neighborhood Action Plan in Brampton. We've been fortunate to have a lot of support from Brampton, Peel, federal government, and FCM as well. Fletcher's Creek Snap neighborhood is an older urbanized area that uses traditional curb and gutter systems to convey stormwater directly to the creek with no water quality or quantity management. So this area of Fletcher's Creek was considered heat vulnerable. And it's a particular issue for Fletcher's Creek because the creek provides habitat for red-side dace, which prefer to have clean and cool water to support their habitat. So when stormwater runoff comes in contact with paved surfaces like roads, it increases the temperature of storm runoff, which directly enters the red-side dace habitat. So the LID project will filter and cool the water before it heads into the creek. So we're really thankful for all the support we've got from Brampton as we've done this project, and I'm sure there's many more to come. There's lots of roads with this kind of opportunity ahead of us. See the progress over the time. And then this picture is just a recent photo from a few days ago showing the swale with the plants added to it. So all done and ready to receive water if we'd only get some rain. Next slide, please. To tie all of our work together, you've heard me speak about this before. We are continuing to develop our watershed plan for the Credit River watershed. We'll call it an update to our 1956 plan, but it's long overdue. It's just an update. But the watershed planning process is always a collaborative effort between CBC, municipalities, any federal and provincial agencies, Indigenous communities, including the Mississaugas of the Credit First Nation who've been involved, community groups, associations, local residents, and businesses. So we're just launching our municipal facing process with our first steering committee planned for next week. We're working towards getting this completed before changes to the act come in, but I'm sure it's going to be a little more work than that. So I know my team is sweating a little bit as we think about the need to get this done as fast as possible. But it will allow us to establish goals and objectives and actions for the protection of our natural resources, the management of our human activities, land, water, wildlife management as well. And watershed planning ends up being cross-jurisdictional, addressing watershed-wide threats to the environment, and then providing the best places to do the best actions first so that we get the best resources used to start really tackling the big issues. So, next slide, please. So that was the end of our quick update. Now I'm going to just quickly go on to our 2022 budget, which is brief because we're not very far along on it at this point. We're still working. This is the 3-year forecast that you were seeing in our February budget approval. And as we had a question mark for 2023 and 2024, not knowing what the provincial intent was around the Conservation Authorities Act. And the special levy figure includes both Peel's portion of the special shared levy and the Peel only special levy, including the climate change bucket as well. Next slide. You asked us to address any provincial funding issues. We have received our transfer payment agreement for 2021-2022, and there have been no rumblings of further cuts, but frankly, they can't go much lower. So at this point, we're confident that we will continue to get our $95,000. So next slide, please. We're now in the process of working through our 22 budget, and we're not in a position to provide you with a target at this point. We still have some potential risks for COVID into 2022 budget year, and we're hoping we can get back on track. I think things are certainly looking like we will be able to. I think it's important to say that we are aiming for a budget submission that's in line with your expectations for cost containment, and we will do our very best. Next slide, please. And then this one is talking about our residual impacts of pandemic recovery. So at this time, we're seeing inflationary pressures. Just the contract we let for Bell Fountain, we basically have $1 million other extra over top of what we anticipated having to spend on the construction materials and construction services. So. So that is, certainly a concern for going ahead with some of our other projects. Our traditional revenue generating activities have been modified. We're just going to be starting with weddings in a short time. We've been unable to do those. Picnics in our shelters have remained very constrained. So we haven't had the additional revenue sources that we normally would have in our parks, but we've also been constraining some of our staffing there. So that's helped us to offset those costs. We do a report to the board every quarter that outlines the the impacts that we're seeing. And at this point, we're not seeing an impact to our budget, and largely because we've been managing the staffing very carefully. We are also seeing our liability insurance going up as well, with of course the changes that the insurance industry sees. Next slide, please. So with that, I will be happy to take any of your questions, and Jeff's here as well, and hope that was fast enough for everybody.
Deb, very well done. Thank you. First up, I have CBC Chair Raz. And Karen, as I said, I'm also bringing forward at your request related item 19.3, should you wish to question that at this time as well. Karen.
Okay, thank you, Mr. Chair, and thank you, Deb, for coming today, and for Jeff, I know you're somewhere out there. First of all, I would like to thank Deb for her amazing leadership as a CAO of Credit Valley. She recently announced that she will be retiring, so we have her till the end of this year, so she'll probably be in front of council maybe one more time for budget. So we'll certainly sing your praises there as well. But I would just like to thank you and your senior leadership team for really steering the organization through the pandemic. I hate the word pivoting, but pivoting the workforce, at least those who work in the office, to an online work from home option. I know a lot of them are really, really keen to get back into the office. They have such good camaraderie amongst each other and work well in their teams. So I know they're looking forward to that. But when we talk about resilience of the watershed, I think it really speaks to the resilience of our workforce. So thank you for everything that you've done. I guess I can ask this isn't necessarily to staff, but it's really related to the KPIs in that report. I think it's under Gary. Certainly that how are the KPIs going to be related to the work that we're expecting, or the changes that we're expecting from the province with respect to potentially the formula change? Because I know the KPIs are really connected to how we're going to be measuring the impact of climate change and the actions that we're taking, which is fantastic. But if, for example, we find out that and maybe I'm getting ahead of myself, if the funding is going to be changing drastically, are we putting the cart before the horse in terms of attempting to measure things that we may not be required to measure in the future because it won't be available?
Yeah, through you, Mr. Chair. Thanks for your question, Councillor Raz. And Christine too's on the call. She can jump in, but as far as I'm aware, we're certainly aware of those changes, if not the details around them. So we'll keep an eye on that risk, and the KPI development won't go faster than the new regulatory framework, and it should strengthen the MOUs as well. I don't know, Christine, if you've got anything else to add.
Thank you, Gary, and through the chair, thank you, Councillor Raz. You raised an important point as we move forward in strengthening what the investment would be. I think it's absolutely important to indicate that the region does see the climate investments that are being, I'm going to turn off my virtual background to get a bit more bandwidth. The climate investments that the region has been leveraging and investing because the conservation authorities provide a level of expertise that are critical, that remains. I think that going forward, whether the new framework in the regulatory world for the Conservation Act is non-mandatory or mandatory, it remains important. So these KPIs are going to strengthen that. The investment, understanding what we're doing in the right, what we're investing in is going to bring back the performance, the impact that we want to see. And I think even thinking a bit further, as KPI measurement is best practice and the region is moving into that, the other thing that it's going to help the region understand is our climate risks and how well we are dealing with them. And that's actually another aspect of what's emerging for municipalities in terms of disclosing our climate-related risk practice that is emerging at the federal level. It's expected to come to public sector, and as the region is considering how we manage our own risks, having a performance management system with a considerable amount of our investment is going to help us disclose, if that's what we choose to do, to investors and to the public on how well we're doing, and that we understand what the investment is achieving. So those are more about, I would call it municipal climate-related disclosure financially, as it will be coming as we as staff are investigating this. And I think it aligns really well with how the CAs are being proactive in finding, ensuring that the impacts that we need to see on addressing climate change are being met.
Okay, perfect. And I look forward to the annual reports that are going to be coming forward to council as well. So I do appreciate your time on that. And back to Deb, I don't have any questions. I know that we work very closely together. And on behalf of the CBC board, I just want to thank you for all of you and all of your work and your team's work. You certainly serve Peel proud. Thank you.
Thank you very much. Gary, did you have something further? I still see your hand up.
Yes, Mr. Chair, just to, there's been a lot of environmental objectives put forward. Just from an accounting point of view, and John maybe touched on it, finance staff are very aware of the UN Sustainable Development Goals, or ESG responsibilities, but more importantly, or as importantly, our credit agencies and our financial institutions are asking us questions. So the portfolios that you've been talking about recently in the last hour are really critical to the financial health of the region of Peel going forward. I could throw lots of acronyms at you, but the Peel Climate Change Partnership spent a lot of time on Monday looking at something called TCFD, the Task Force on Climate-Related Financial Disclosures. I'm personally a member of A4S, Accounting for Sustainability. There's some exposure drafts out there from IFRS and PSAB. And then I'll maybe just lastly mention that Michael Puskarik, who's the director of PSAB, the Public Sector Accounting Board, is actually a Peel resident. So we're highly connected on the reporting side, and I'm really excited about how this is going to go forward. So thank you.
Okay, thank you. With that, I have no other speakers, so let me deal with the administration first. I'm going to have Chair Rass move receipt of Deb's presentation and related report 19.3 as seconded by Councillor Downey. You've heard the motion. Does anyone object? So that is carried. More on another note, I believe Deb will be before us again, so we'll have another chance to heap some accolades on her. The question the chair has is, I didn't think anybody could retire at 42 years of age, but good for you if you can. So Deb, thank you. We'll have another opportunity to regale you a little bit more. And I asked before the agenda to make sure that that would happen. Thank you very much for this. Okay, moving on, our final Conservation Authority presentation.
My apologies, Mr. Chair.
Sorry?
My apologies, Mr. Chair. Can we deal with the report at 19.3? That would require recorded vote.
Oh, my apologies. I tried to kill two in one. So we've already moved receipt of the presentation, but I need a formal vote with regards to 19.3. It was moved by Raz, seconded by Downey. Madam Clerk, for the vote, over to you.
Thank you, Mr. Chair. And I'll begin with Mayor Brown. Mayor Brown?
Yes.
Mayor Brown in favor. Thank you. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie? Councillor Demerla?
In favor.
Councillor Demerla in favor. Councillor Dasco? I think that was in favor. Councillor Dasco in favor. Thank you. Councillor Dillon? Councillor Dillon?
Councillor Crombie is here. Sorry about that. I just missed being unmuted. Sorry.
Thank you. Councillor Crombie, your vote, please.
I support. Thank you.
Thank you. Mayor Crombie in favor. Councillor Dillon? Councillor Dillon? Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini? Councillor Early?
In favor.
Councillor Early in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
In favor.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson? Mayor Thompson? Councillor Vicente?
In favor.
Councillor Vicente in favor, and the motion carries. Thank you.
Thank you all. That brings us to 7.4, Hassan Bassett, President and Chief Executive Officer, Conservation Halton, regarding Conservation Authorities Act Phase 1 Regulatory Proposals Consultation Guide. And I know we have related item 17.1, which Councillor Sinclair asked us to hold in the hope of moving us along. I want to deal with that at the same time. And Councillor Sinclair, I will come to you first after the presentation. Hassan, please proceed.
Thank you. Good afternoon, everybody, and thank you for having me on. Before I start my presentation, I'd actually like to pick up where John McKenzie left off and just mention that at my parks, we have had Matt Damon, Eugene Levy, Dan Levy, episodes of Star Trek, The Umbrella Academy, and a Designated Survivor film. So not that I'm here to compare A-list celebrities, but conservation authorities and conservation areas bring all sorts of interesting opportunities to local communities. I have a presentation, but as you referenced, Chair, there is an excellent staff report in front of you, which actually details out a lot of what's in my presentation. So rather than really focus on all of the slides, I maybe want to take a few seconds to provide an overall narrative as to what has changed as a result of these amendments to the CA Act, what regulations are coming down, and what does it actually mean? But to really do that, I want to maybe take you back, and I know Deb over the years has done excellent presentations on a history of conservation authorities, so I'll try and summarize it very simply. Conservation authorities have always existed and were formed because we're talking a lot about categories here, mandatory, non-mandatory, all of this new jargon is coming down at us. And so conservation authorities were really formed to do two things. They were formed to implement and carry out provincial priorities, and they were formed to carry out local priorities. That's you. Those were the two main areas. The provincial priorities were always backed by legislation. So there were rules and laws, and CAs were to work to implement those. But the local priorities were driven and continue to be driven by a mix of necessity and vision. It's a vision for your community. What do you want Peel to look like in terms of green space, in terms of climate change resilience, opportunities for residents? And you know, on the local priority side, which CAs have done for the better part of 6 decades and more, they were all, whether it's something out of necessity or whether it's something that is driven by a vision for your communities, they're always backed by science. Because if you don't have that finger on the pulse, it's difficult to know where you want to go. And so a lot of the programs that the conservation authorities have done fall under that local priorities. That's why the CA model exists. That's why our boundaries are jagged and don't follow municipal boundaries or other political boundaries. They follow watersheds to be able to work with those local communities. And so the reason, if that's always been the case, then why make changes to the CA Act? Well, there's a reason for that, and I think it's important to acknowledge that. The province, through their consultations, felt that over the years, there had been some ambiguity had crept in across the province. And keep in mind, CAs serve close to 400 municipalities. So there are vast differences in the municipalities, in the regions of the province, and in the CAs, where there were a number of municipalities who were not clear on what programs the CA was delivering, how the costs were being determined, you know, whether municipalities had clarity on what they were paying for, were there things being cross-subsidized? And so all of that was out there. And to address that, the province made some of the changes to the CA Act, and which fall under governance, transparency, and accountability. And so what the province is doing is they're saying, okay, we're just going to clarify everything, but we're still going to leave that core of a conservation authority's ability to work with its local communities to offer programs intact. And that is intact. And I just wanted to reinforce that off the top. What has happened is there are labels now for categories. So there are mandatory programs and non-mandatory programs. And while I don't like the label non-mandatory, it is essentially a continuation of everything that has existed for decades at the local level. It just falls under non-mandatory. And that makes sense because to the province, the only thing that's mandatory is what is backed by provincial legislation. So if we can go to the next slide, it takes you through a bit of a chronology of how changes have occurred. And again, you're all aware of this because both John and Deb over the years have kept Peel Council up to date on all of these changes. If we can go to the next slide, please. I wanted to reference, there are various documents to reference when it comes to, the importance of conservation authorities, but this one is more recent. It was commissioned by the current provincial government, and it really does speak to the multifaceted approach that CAs take when it comes to keeping our communities safe from flooding. If we can go to the next slide, please, and this document is available online. So what has happened over the last few weeks is, as a result of the work that the working group has done, which John mentioned, the province has posted a public consultation guide. The Peel staff report you have in front of you, relates to comments that Peel Region will potentially submit to the province in response to that guide. This guide lays out the mandatory programs and services. It talks about the agreements that the municipalities and the conservation authorities have to have in place to cover non-mandatory programs. It establishes a transition period and requirements for each CA to establish community advisory boards. And I'll talk about that a little bit, but it is also, again, addressed in the staff report you have. And then Section 29 regulations. Section 29 has always existed in the Act. It is what covers the operation and management of conservation authority-owned lands. So this is a little bit of a cleanup. It's not necessarily an improvement, on some of the things, but it doesn't take anything away either. It's a cleanup and a consolidation of the various pieces in that section. If we can go to the next slide, please. So what are these categories now? What is under mandatory and what is everything else? Again, you'll notice, the provincial narrative really focuses around transparency, consistency, and accountability, and that's what these changes are meant to do. So mandatory programs that every conservation authority must offer, so it's the floor, not the ceiling, include the Natural Hazards Program, backed by provincial regulation, the Clean Water Act responsibilities, Lake Simcoe Protection Act, which doesn't apply to RCAs in Peel Region, Section 29, which is the land management ability, which I just referenced, and then two other mandatory programs to be enacted through Minister's regulation, and they include core watershed-based resource management. This is a very progressive approach to have this recognized as a mandatory program. The Conservation Authorities Act consists a purpose for conservation authorities. And it's nice to see that purpose actually reflected broadly in one of the mandatory programs. And then 5B, provincial water quality and quantity monitoring. Again, it's something we've always done, but to have that listed as a mandatory program is important. So those are the mandatory programs that the province deems every CA must deliver. Then there are non-mandatory programs. That's items 2 and 3. To me, and talking to Deb and John, these are really interchangeable. So what is 2? 2 are programs that a municipality would ask a CA to deliver on its behalf. And 3, category 3, are programs that a CA determines to be or advisable to deliver, and they would come to you to say, we would like to do these things. So 2 and 3 are interchangeable because they both require collaboration, they both require an agreement, that should include a funding formula. They should include KPIs. They should include objectives. These agreements are to be renewed periodically, which is also a good thing because our environmental priorities continue to change. They require changes in adaptability from both the Conservation Authority side and the municipal side. So 2 and 3 is where the collaboration occurs. 2 and 3 is where I hope we continue to work forward and move forward the way we have in the past. And then there's a fourth category, which are fully self-funded CA programs. The only reason that stands out as a fourth category is if it's fully self-funded and there are no tax levy dollars going to it, no agreement is really required, at least not for financial reasons. There are very few CAs that would have fully funded programs, but there may be. Some of them may be perennial, some of them may be grants driven. So you get a grant for 2 or 3 years to do something, you launch a program, you do it, and when it ends, maybe the program doesn't exist anymore. In terms of accountability, things under those categories, as I mentioned, anything that is non-mandatory, in other words, that is a local priority, requires agreements. We have to have those agreements in place by January the 1st of 2023. The need to establish community advisory boards is a new requirement. We're still working back and forth through the working group with the province to ensure that these community advisory boards they don't become or are not perceived as duplicating or replicating the work of the governance boards, which we already have, which many of you serve on across the 3 conservation authorities. And so we're working on that to ensure that an advisory board is separate from the governance board, which has fiduciary responsibilities, and we're going down the right path. So we had some initial concerns, but it's been a very good collaborative effort. And then Section 29, as I said, these are regulations pertaining to CA lands. If we can go to the next slide, please, it'll show some examples of this. I won't stay on this slide because you have this in your report. But this shows you examples of what some of the mandatory and non-mandatory programs are. And if you just refer back to John and Deb's presentation, a lot of the excellent work that they've presented would technically fall in the non-mandatory bucket, but they are obviously invaluable programs. We can go to the next slide, please. So this shows you the transition timeline. We're in the orange phase right now. And what that means, to summarize it, is that by the end of this year, we should have an inventory of programs submitted to and signed off by our local municipalities. And we should have a bit of a transition plan submitted to the province. And what they want to see is to ensure that every municipality and CA has that January 1st, 2023 deadline clearly identified in their work plan. They basically don't want any surprises where we get close to that deadline and municipalities and CAs are saying, well, we haven't been able to work out and meet that deadline. So it's not an overly onerous task at this stage. We need to submit inventories to our municipal partners. And what is an inventory? It merely states these are all the programs that we're offering. This is roughly what it costs or what the funding structure is. And we sign off and we say, okay, so based on this list, these 5 are mandatory, these 21 or 5 or 30 will require agreements. How do we structure these agreements? And then you work towards getting those agreements in time for January of 2023. It is, I'm sure I can say this with certainty, when we submit those programs to staff at Peel, none of them will be a revelation because they have always been developed in collaboration, not just with Peel staff, but also with council. You see details in our budget submissions and our budget presentations. But we need to ensure that we continue to work on it. What are some of the risks with that? Well, January 2023, a lot stands between now and then. A provincial election, a municipal election. And so it is our desire, at least the 3 CAs on this meeting today, to really front end this and not treat January 2023 as the deadline, but rather treat 12 months from now as the deadline. And we would like to get these agreements in place by Q1 of next year, so that the budget cycles cannot be disrupted, and we can actually flow through that and complete all of that, with this term of council. So that's our desire, and there's a lot of work to do when it comes to those agreements, but that is a risk. Of course, the other risk is that the regulations are still not posted. We're still working, we're negotiating, we're improving through this working group. It's all progressing well. So, the reason we wanted to appear before you today is to give you that heads up to say we don't have to wait for those regulations. We know where they're going. The province has indicated that intent, and we hope to continue to work at a staff level so we're not pushed up against the clock. And I believe this is my last slide. If we can go to the next one. So again, as I mentioned, we would like to continue to work on these MOUs, agreements. The province has left it fairly broad as to what format they take. There are no templates. It's whatever makes sense at a local level between the CA and the municipality to work out those agreements. And with that, I'd like to thank you for your time, and apologies for rushing through it, but you do have a lot of this information in place, and I'd be happy to take any questions. Thank you.
Yes, thank you, and well done. First up, and as I said, we have the report itself before us, the delegation and related item 17.1. First up, Councillor Sinclair.
Thank you, Mr. Chairman. I'd like to make a number of points, mostly related to the 7.1. Mr. Azam's presentation is very useful. And I point out that
Ian, this is Nando here. Ian, I'm sorry to interrupt you, but it's sort of splintering a bit. Might I suggest we lose you? There you go. We'll lose your video, and maybe you'll just go to audio, and that'll help. Please proceed, Ian.
Hope it works. So referring to the Credit Valley Conservation 56-57 program that Deborah Martin Downs had an image of, that was put together working with all the local communities that were involved in the formation of Credit Valley Conservation and the conservation branch of MNR. So it was really collegial. But this CA Act review poses some questions where, whose agencies are the CAs now? The questions about provincial funding are up in the air, and the regulations seem to reflect provincial priorities. So the notion of being community-based organizations seems to have been changed. I want to make the point that conservation working with landowners requires long-term cooperation and trust with rural landowners, not so much people in subdivisions. So it's quite an issue. The generic regs, when they came in, were really intrusive, and they went far beyond natural hazards to the point where they were covering broad areas of the countryside. And there seemed to be a change in attitude of conservation of working with landowners to enforcement. To the point, along with the Endangered Species Act, the Peel Federation of Agriculture sent a letter out to all its members advising not to allow CAs on their lands because they had no idea what findings would happen and restrictions on their lands. And that's a real shame. So I wondered at some point if we could find out what's happened to the generic regs. Are they going to disappear or maintain? I guess the natural hazards focus for CAs is important, was always there. But, the first Town of Caledon official plan in 1979 had two different schedules. One which showed hazard lands, and the another one showed environmental protection areas. And I think we should go back to that for clarity. And I guess the other one is to deal with the sub-watershed planning. And, you know, Credit Valley Conservation was a real leader in that at sub-watershed studies. And I think sub-watershed study 19 was for Orangeville area. Way ahead of its time, cost a fortune. I don't think anything was ever implemented from that study. And I noticed the same thing with other studies that were done in Caledon. They never made it into the Caledon official plan, to my knowledge. So there's a real implementation problem here doing this detailed, scientific-based sub-watershed studies and then getting them into operational day-to-day official plans. And I would hope that sub-watershed planning doesn't lay on an additional layer of complexity, particularly for the rural areas in the GTA and Caledon in particular. You know, we've got the Greenbelt Plan, the Oak Ridges Marine Protection Plan, the Niagara Escarpment Plan, the Growth Plan, and then you've got the conservation authorities. So eliminating duplication here and simplifying policies is really critical for us. So those are my points, Mr. Chairman. Thank you very much.
Thank you. Hassan, a comment or response on what you've heard, and I'll allow Deb Martin Downs the same briefly. Go ahead, Hassan.
Thank you, Chair, and thank you for your comments, Councillor Sinclair. With regards to a specific question related to generic regs, as you mentioned them, so Section 28 of the Conservation Authorities Act is what lays out what our role is when it comes to natural hazards, and that's where we have the regulations that look at hazard lands related to floodplains, valley systems, erosion, lakefront, and other hazards. And that section of the CA Act is the only section that looks at our role in that area. Now, unfortunately, the public consultation guide covering that very important regulation has been continually delayed and is not yet out. It's also important to recognize that CAs are, in their responsibilities at least, split between the Ministry of the Environment and the Ministry of the Natural Resources. The lead ministry is the Ministry of the Environment. They have issued their public consultation guide, but Section 28, the hazards piece, still resides with the MNRF, and that has not been released. So we'll have to look at that. That's the only piece that, to use your words, Councillor, looks at where the regulation needs to be enforced. And that's basically a public safety regulation. Everything else, in my opinion, is still intact when it comes to local community-based focus of conservation authorities. When it relates to watershed plans and watershed planning, my conservation authority also has watershed plans that were exceptional and that were developed years ago, but then the implementation falls off because they're not operationalized. And I think there's a new way to do that. A watershed plan is not an enforcement document. It should not be. It's a collaborative document that lists out which areas do we as a community want to improve, where do you want to plant, which valley systems need enhancements, restorations, where do we have data gaps that we need to. So a watershed plan is a collaborative document. The Conservation Authority perhaps forms the secretariat, so they convene the table, but there are multiple stakeholders, quite often all equal, at that table. And so it's my hope that as a result of these changes to the CA Act, as a result of watershed-based resource strategies being a mandatory program, that there can be a renewal of watershed-based planning and its incorporation into whatever appropriate municipal documents are, whether it's the OPs or other areas. But a watershed plan is not an enforcement tool.
Deb, your thoughts quickly?
Yes, thank you, Mr. Chair. Just two things. I think to Councillor Sinclair's point, I think we did a lot of subwatershed studies that we did not necessarily emphasize implementation with. And I think that I'm going to say that's something that I think is tremendously important. So the staff have been charged with making sure that implementation is, and with the partners, is a key activity. So I'm hoping that you would see that coming forward as a more urgent activity. they do need to be refreshed, and hence, the notion to bring forward a new watershed plan with new tools and new science. And then the third thing is thinking about the cascade at a watershed level. It's very hard to implement anything other than big policy moves. But so how do you drive that onto the ground? And when I was working with TRCA, we had the same kind of conversations, and we developed the Sustainable Neighborhood Action Plan, or what you know as SNAP, as the vehicle to deliver that on the ground in a very comprehensive way, because then people could see themselves in that, and they could get energized by a local implementation. And so you've seen, we showed you some examples of things that are already on the ground. They're a lot more labor intensive, but they are working to really start to hammer away on the actions. And John had mentioned them in his as well. So that is one of the ways that we sort of cascade it through at the watershed to subwatershed to SNAP level.
Okay, thank you. Ian, you still have the floor. Anything further? Ian, I'm not hearing you. Did you have anything further, Councillor?
Sorry. Good discussion. No further comments. Thank you.
Thank you very much. I see no other speakers on my list. So first, I will have Councillor Sinclair and Councillor Downey move receipt of the Hussein's report and his presentation. Is anybody opposed? That is carried. And now we will deal with item 17.1, again moved by Councillor Sinclair and Councillor Downey. For the vote, over to the clerk.
Thank you, Mr. Chair. And this vote is on the recommendation contained in the report at 17.1. And I will begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes, and if I may have missed a vote, I'm having technical issues. Could you cast me in support of the staff recommendation?
Thank you. We did capture your vote for the last staff recommendation. Thank you. Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yep.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini? Councillor Early?
In favor.
Councillor Early in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros? Councillor Medeiros? Councillor Paleshi? Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Thank you. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor, and I know I missed the last one, but I was trying to get on. I've had technical issues on and off all day here, so my apologies.
Thank you. Mayor Thompson in favor. Councillor Vicente?
In favor.
Councillor Vicente in favor, and the motion carries. Thank you.
Thank you. That takes us to almost 12:45. As promised, we're going to recess. I'm going to say 1:15 now to give the staff at least a half hour to take a respite for the back office. So we stand in recess till 1:15 promptly. Thank you all. Well, we're back promptly at 1:15. Well done, everyone. Let's carry on with our agenda. I am on to item 7.5, a deputation from Robin Manson-Hing and Evgenia Karakiohova, resident Region of Peel, requesting that the Region of Peel increase the minimum age for COVID-19 vaccination consent to 14 years of age. Okay, I welcome the deputants, remind them of our 5-minute time limit. And so to Robin and to Evgenia, please go ahead.
Good afternoon, Peel Council. Can you hear me?
Yes, go ahead.
Great. Myself and Evgenia are here representing dozens of Peel residents you see on this list and many more you don't see. We've come together because we're united in promoting informed consent for novel medical treatments in line with long-standing ethical practices. Specifically, with the current authorized for interim use only COVID vaccines, we do not believe 12 is an appropriate age for a child to make an informed decision. I say this as somebody who's fully vaccinated both of my kids to date with traditional vaccines. Next slide, please. So we saw the resolution a few weeks ago asking the province to raise the required age for no parental consent to at least 16. In voting against this resolution, at least one councillor said it was too much to ask the province to reconsider its current stance of 12 years old being able to consent. Next slide, please. In an email exchange with Peel Public Health, this theme was reinforced. Specifically, Peel Public Health stated to us, the validity of consent to treatment by a minor was governed by provincial legislation, specifically the Healthcare Consent Act of 1996. So the resolution put forth last council meeting was done with asking the province for permission to change the age of consent. Next slide. However, during Q&A at the prior council meeting between, I believe it was Councillor Raz and our Chief Medical Officer, Dr. Lau said that he deferred to the Peel Regional Councillor on age of consent. We also saw York Region choose 14 as its minimum age for no parental consent. So after informing Peel Public Health of these facts, we were told that the age of consent was indeed Peel's decision to make, and that was on June 4th. Next slide, please. So after noting it was Peel's choice to determine the age of consent, Peel's regional solicitor stated that no additional responses would be forthcoming. So again, this took place June 4th, and prior to the June 10th council meeting, where the same regional solicitor said that we should ask the province to change the age of consent. So because I was not able to ask any more questions via email, I'm forced to come on here and ask at a regional council meeting, why ask the province to change the age of consent when Peel has the ability to change the age of consent itself? Next slide, please. Sorry, I think, oh, maybe I have it in a different order. Okay. So Dr. Lau's comments at the end of May referencing the Ontario Healthcare Consent Act leaves open the possibility that children under 12 might be able to consent to interim use only vaccines. Next slide, please. Okay, I think there's a slide missing there, but I will continue. So following this same 3-week delay between manufacturer authorization of an age group and Peel matching that authorization's minimum age of consent, we're tracking to an October timeframe for potentially letting 2 to 11-year-olds decide whether this interim use only vaccine is right for them. It would be great if Peel could come out and just say, we will never lower the age of consent below 12. Next slide, please. So looking at what's been done in the past, Peel Region has always required parental consent for kids under 14 and for fully approved vaccines. Looking at what other North American cities are doing, like Calgary, New York City, LA, Miami, just to name a few, they all require parental consent for anyone under 18. So again, we're not here to change provincial legislation or even ask them anything. We're here because we want Peel bylaws created that will respect a parent's right to make the best decision in the interest of their young children. Next slide, please. So we're just asking Peel Region use its own authority and choose to increase the minimum age for consenting to a COVID-19 vaccine from 12 to 14 years old at a minimum. Ideally, we would prefer this raised to 18, in line with Calgary and some of the largest cities in the US. But, you know, it's a give and take, I guess. So, Evgenia, maybe you can speak.
Sure. So
and Evgenia, you've got 2 minutes more. Go ahead.
Thank you.
So today we ask Peel Region to recognize that children under the age of 14 are not capable of providing informed consent because they cannot fully appreciate the risks and benefits of the medical treatment. Quebec law, for example, states that children under the age of 14 can't consent to being vaccinated. Understanding the nature of the medical treatment really is extremely relevant to providing informed consent with these novel COVID vaccines. Please ask yourselves, will a child under the age of 14 know and understand the following? First, this is a novel mRNA technology, never before used on humans. Second, in Canada, it has been authorized under an interim order and not a traditional approval. Third, the vaccine is actually currently in clinical trial with an estimated study completion date in 2023. So I believe the answer to this question is no. A child will not likely know or understand these facts and therefore cannot really provide informed consent on their own. Moreover, raising the age of consent to 14 could shield Peel Region from potential liability in tort law. Imagine this, a 12-year-old signs a waiver to receive a COVID vaccine on school property without the knowledge of the parents. And then imagine that, just like you saw in a couple of slides before, just like the son of Portia Hoffman-Strang, a woman from Pembroke, Ontario, the child suffers a severe reaction, and then as a result, the parents decide to sue. The region could be liable, as very likely courts will not recognize a waiver signed by a 12-year-old as a form of valid consent. So these events could expose Peel Region to huge potential liability. So to sum up, what we're asking you to do today is to realign with established ethical principles and to raise the age of consent to a reasonable 14. This will make Peel Region safer for our children, for concerned parents, and for the regional administration itself as well. Thank you for listening.
Thank you. Thank you very much for your presentation. I have a list of questioners, but I want to remind all members of council, as I was reminded by the clerk, this matter has in fact been dealt with by council. If we wish to enter into debate again, I first need the matter reopened by 2/3. So I'm going to be watching for that carefully under direction from the clerk, but now it would be appropriate if anybody has any questions of clarification, and only that for the deputants. Councillor Kovac.
Thank you, and through you, Mr. Chair, and thank you for providing clarification on that. I just wanted to take an opportunity and thank. My microphone has been cut off there. Thank the delegates for coming forward and for presenting. I wanted actually to provide a bit of clarity from my end. There was a motion that I had tabled a couple of weeks ago, which had gotten on the floor, and while it set it at 16, that was the ask that the provincial government would take that into account. I know you're rightly pointing out that we do have the ability, the region does, to set that. It was more my thinking that it might be appropriate for the government of Ontario to step in and try to synchronize better and create better consistency across the different regions, because as you pointed out, there are I think it's York region that is above 12, I think at 13 as a minimum. With my motion of a couple of weeks ago that I tabled, I based the 16, I know you're calling for 14, off of the World Health Organization's admitting that the vaccine has only been tested in children above the age of 16. And for a very long time, they were not recommending that anyone under that age get vaccinated. That's where I was coming from. And I would just sort of add, before I get off the board, and I imagine another member of council might want to speak to it, because of the urgency of the pandemic and what we've had to deal with, I really do believe that there's been a strong push, a rush, you could even say, that typically you would like to see a trial last a lot longer prior to there being, strong encouragement that people go and get something like we're seeing happen right now. So it's really because of that. I think we have a lot of concern that is being expressed by people, by parents. And so I would just say that I can sympathize with you, and I can understand where you're coming from as parents who are worried about if it's open for those above 12, at what point could it then become available to people under that age. And I'd hate for it to become mandatory, and I'd hate for it to be opened up where children as even earlier than 12 can go and just get it on their own accord. So that's my thoughts.
Thank you, Councillor Kovacs. Councillor Sato.
Thank you, Mr. Chair, and thank you for your presentation. I have some questions of staff, if I may.
Please.
Okay, thank you. So my understanding from our last meeting, the information we got from Dr. Loh and from staff was that given a provincial policy legislation, that we did not have the authority to change that age of consent. Could someone just answer that, please? Because I'm hearing different information here.
Yes. Perhaps through to Patrick O'Connor, or whoever else might step up for us.
Yes, Mr. Chair, I'd be happy to address that. There are, in fact, two separate questions that are being engaged here, I would suggest to you. The first is, what is a legally valid consent to treatment? And that is governed by provincial legislation, the Healthcare Consent Act. The second question, which I think is being sort of mixed in a somewhat confusing way, is what requirements should be placed on accessibility to vaccination? Or to put it another way, should parental permission be required? It is open to the region to impose additional requirements on vaccination. That's not really a question about the validity of consent to treatment. That's a separate matter. Could there be requirements in place on accessibility to treatment? Could the region require permission of parents for older than 12-year-olds? The answer to that is yes, the region can do that, apart from the question of validity of consent. That does engage legal risks, in my view. Those risks I would prefer to advise you on in camera if you want to hear about them. But I would leave it on that basis, that the region can impose these additional requirements. It cannot deal with what is a legally valid consent to treatment, which is governed by provincial legislation.
Okay, thank you. That makes that very clear. So my question now, and it might be to Dr. Loh, probably, or someone else in health. So we require parental consent for up to age 14 for all of the other vaccinations. Is that correct? And if it's correct, then why would this be different?
So through you, Mr. Chair, to Councillor Sato, the age of consent for COVID-19 and school-based vaccinations take a different approach in Peel. School-based vaccinations require parental consent for 14 years of age due to agreements with the school board in recognition that many times the children in school are not attended with their parents at the time where they are vaccinating. The purpose of the consent is also to verify past vaccination history for the school-based vaccine, for ease of preliminary information collection, and also for expediency during the clinic. But it is important to note that even during the school-based program, the decision is still assessed on the basis of the consent and capacity of the child who does present. This is really just in agreement with the school boards and in respect of the different setting in which they are being vaccinated. The considerations used to maintain an age of consent for school-based vaccination are not applicable within the COVID-19 vaccination program because, as you can imagine, the disease is different. Many parents typically accompany their child to the vaccine clinic, and similar to the school program, at the time of vaccination, the healthcare professional must still assess the youth's capacity consent. So essentially it is different context, different disease, different process, and governed by a different agreement.
Thank you. And my last question, if I may. So, I mean, I had the discussion with my 13-year-old grandson, and he was quite capable of understanding risks, pros and cons, and we discussed that, and he was very capable of making a decision. And I have to say that that sometimes the younger generation make better decisions than the older ones do when it comes to that. So, sorry, somebody has their microphone on. I'm getting a lot of feedback, Mr. Chair.
Thank you. Can we make sure everybody's mic is turned off except for the speaker? Please carry on, Councillor Sato.
Thank you. Thank you. Yeah, I'm still hearing somebody talking. So I guess, Mr. Chair, I did not support the motion 2 weeks ago when because I thought 16 was a ridiculous age. But I guess my question to Dr. Loh, how many children of age 12, between 12 and 14, have been coming to the clinics without a parent? That obviously would be there making the decision on their own and would not have a parent with them who presumably had the discussion with their child.
So through the chair to Councillor Sato, this is a very important point of context. The vast majority of teens of that age, 12, 13, 14, typically are brought to the clinics with their parents. And it is worth noting as well, just for Council's additional information, of 18 Ontario health units that include consent information on their website, 16 have indicated that they are operating consistently with the ministry guidelines and in respect of the Healthcare Consent Act. Of course, we do encourage that many children engage their parents in a discussion. It actually is one way to really have parents also consider whether vaccination is right for them. But the last thing I really want to highlight as well is I had a great conversation with Erwin Ellman, the previous youth advocate in the Ontario Ombudsman's office, and he pointed out that by setting a minimum age of consent for 14 for parents, it's not simply about preventing children from accessing vaccinations, but it could also come to pass that some parents would then consent for their children to get vaccinated, as in they would take the decision for their children. And that is why the Healthcare Consent Act is written to determine the individual capacity of the person that is receiving the medical treatment. So the other side here is also very important. You're essentially, the risk is you're essentially disempowering youth from actually giving the decision over to their parents for their medical treatment.
So basically what you're seeing is a very small percentage of children in that age group who are actually coming to get the vaccine without what must be presumed to be parental consent. It may not be in writing parental consent, but if a parent is with them, then you have to assume the parent is consenting. So it's a very small percentage. And of course, we want the children vaccinated before they go back to schools so that they can go back to school in the fall. I think that's very critical and protect them and their families. So thank you. That's my questions, Mr.
Thank you. Seeing no other question. Oh, no, Councillor Kovacs, did you have a quick follow-up question? Go ahead.
Mr. Chair, thank you. I see the delegate has put up their hand. I'd like to give her that opportunity just to ask a question if she could.
If she has a quick question, fine, but I'm not going to allow her to debate it with us. Did you have another question?
Yeah, sure. I do have a question. So I have two, actually, if that's okay.
Go ahead.
So my first question is to Dr. Loh. Dr. Loh, if already the majority of children are coming accompanied by their parents, then why would it be an obstacle to make a consent form or requirement for them to receive the vaccine? It seems like it really wouldn't be a far stretch from what we have already, and it would just be like an administrative decision.
And what is your second question?
Sorry, I have a short part to this question.
No, I'm sorry, we're not here to debate it with you. I did allow you one more. You've asked one question. Okay. What is your second question?
And my second question is, again, to Councillor Sato. So do you feel that...
Sorry, we're not here to debate it between you and the councillor as well. I will leave it at that. Councillor Loh, Dr. Loh, if you could answer as a follow-up to the question that was put.
Okay.
So through the chair to Chair Unique, through the chair to the delegate, certainly the question I believe I answered in part by saying, you have to look at the way the Healthcare Consent Act was written to respect an individual's right to medical treatment. Setting a minimum age for parental consent means that the parent, whether it is giving the vaccine or not giving the vaccine, is now making the decisions on behalf of the child. So we do respect, of course, that many 12, 13, and 14-year-olds are capable of making decisions. They understand their body. They understand what is happening. And I think to the extent that the previous ombudsperson, youth advocate for the province, indicated that you do have to look at what it means to set a minimum age of consent, we would like to remain, at least it is my recommendation, that we remain in line with 16 of the other 18 Ontario health units that have decided to stick with the Healthcare Consent Act. Thank you.
Dr. Loh, thank you. With that, Councillor Kovacs, I've indulged you twice. Unless you want to reopen the question, Councillor Kovacs, I'm moving on.
This would be my third and final time on the board. Just back to Dr. Loh, you said right to medical treatment, but if a child or person is not sick, what exactly are you doing to treat? Is it not more, I mean, I don't know if it's semantics, but it's more prevention, not treatment. How are you treating somebody who's not sick?
So through the chair to Councillor Kovac, immunizations are well known as a medical treatment and are usually viewed as such, I believe, under the law, but I would defer to the regional solicitor as to whether immunizations are covered under the Healthcare Consent Act. From my view as a practicing physician, certainly having practiced in primary care previously, we did obtain consent and assess consent of all patients for whom we immunize, so I presume the law would view it as such as a treatment.
Solicitor O'Connor, can you speak to that?
I would confirm, Mr. Chair, that vaccination is very clearly treatment within the meaning of the Healthcare Consent Act.
Okay, thank you very much. Fair point, John, to ask for clarification on that. With that, I see no other questioners on my list. If Councillor Kovac and Councillor Sato would move receipt of the delegates, does anybody object? Seeing none, thank you. Thank you for your presentation. I now move on to our final deputant, item 7.7, Sylvia Roberts, resident appeal regarding the development of the 2022 Region Appeal budget in relation to local municipalities and requesting an increase to the Peel Paramedic Services budget. Sylvia, welcome, and you know of the 5-minute time limit. Please proceed.
Hello, my name is Sylvia Roberts. I've read the report from the CFO and I fully understand it. It definitely makes sense for the region of Peel to argue to the higher tiers of government that we need increased funding for many of the services. However, we also need a better conversation on intermunicipal decisions, because the decision by the region of Peel does have impacts on the lower tiers. Next slide. So here are some charts from Brampton Fire, and as you can see, their incident counts are going up, not just in absolute terms, but in addition to relative to the population, it's also in absolute terms. But here's the interesting thing. Next slide. If you look at the fire and explosion incidents, it's actually going down. So the question is, what are the firefighters doing if their incidents they're responding to keeps going up, and yet fires and explosions keep going down? Next slide. The answer is the fire department is acting as a second medical service. It is the majority of calls that Brampton Fire responds to are medical. It has reached the point where they're getting trucks outfitted specifically to deal with medical emergencies. If only there was something somewhat more effective than 2 firefighters in a truck. Next slide. The region of Peel actually does have an entire department dedicated specifically to this, with professionals that are much better trained at handling medical emergencies and much better equipped. Additionally, unlike the firefighters' trucks, this one can actually transport patients. It's a case of underfunding. The lack of coverage by the paramedics has resulted in the fire departments taking on increased burden in dealing with medical calls, which is significantly outside of what they're trained for. And while they do have some training, it's not the same as having paramedics in a properly designed vehicle explicitly for this. It's if in both yes. So normally paramedics are funded by money from the provincial government. And yes, this would be a little bit different with using property tax money to fund it. However, we're currently already funding medical service with property tax dollars, but is being delivered by a less effective department. So By increasing the paramedics budget using property tax, you're overall delivering a better service for residents at a lower cost than dispatching a fire truck with, what is it, 4, 5 people to what is a medical issue and not a fire issue. Next slide. Yes, so it really does boil down to, if you spend more on paramedics, you will save money times, and this would allow them to improve it. Mississauga's fire response times could use improvement, and I believe you're raising property taxes to build more fire stations to try to improve it. And I remember from numerous meetings, ambulance coverage in Caledon can be spotty, shall we say. And so in Brampton and Mississauga, there's definite improvement in offloading services from the fire departments and improvement of service. And in Caledon, this could make a significant difference on response times. Thank you. That's my delegation.
Sylvia, thank you. I see no questions at this time. But as always, Sylvia, very thoughtful, very concise. Know that everybody's listening in, especially our CFO, and this is the type of input we welcome as we deliberate the budgets going forward. So with that, thank you. And I have a receipt of the delegation, moved by Councillor Mahoney, seconded by Councillor McFadden. Anybody opposed? That is carried. Once again, thank you, Sylvia. Okay, that brings us on to having concluded the delegations. Item 8, COVID-19 related matters, our update on the Region of Peel's response to COVID-19 from Dr. Lawrence Loh. Dr. Loh.
Thank you very much, Mr. Chair, members of council. I believe I have a presentation that should be coming up shortly. I really want to cover the following topics today, just an update as to our current situation, an update on our vaccination strategy, and then we would like to really highlight what I think is a very exciting aspect of our communications and outreach, what is called the Real Peel campaign. And I have Lisa Dillon and here to help and talk through some of those slides and the amazing work that she and our communications team have been doing, and also to highlight some of our priorities moving forward as we continue to hopefully bring the acute phase of the pandemic to a close. We'll go to the next slide, please. So our case counts continue to decline. This is our 6th consistent week of decline across all ages and municipalities. This is very favorable news. Right now, our rate in the Region of Peel is approximately 21 per 100,000 cases. Our healthcare system capacity is also continuing to improve, and our pandemic picture is now comparable to late September and early October. And it's important to note that the trends that we see from April through May, those really reflect the impact, the immediate impact of the stay-at-home order and the sanitary measures that were brought into place to limit contact interactions. And then subsequent to that, the continued decreases that we're seeing through May and June really reflect the impact of our vaccination efforts, where we now sit at approximately 76% rather, 18 plus first dose coverage, and 30% almost 30% second dose coverage at this point. Actually, I think I may have misspoke. That's the provincial number. I think we're just above 25. We're around 27, 28% second dose coverage at this point in time for 18 plus, and we're adding 10% of our eligible population with second dose coverage every week. We do remain vigilant. An area of concern is that approximately 50% of our specimens across Peel have tested negative for the mutations that are being screened. These are the mutations that are being screened to identify the alpha, beta, and gamma variants. So with tests that are negative for both mutations at this point in time, these cases are presumed to be Delta variant cases. And I think certainly as we remain vigilant, we must monitor the situation in other areas of the province. I think the experience of Waterloo right now in the continued reopening is a cautionary tale for Peel about the potential impact, where you have significant Delta variant circulation and unimmunized pockets, or only first dose coverage pockets in communities. It is really important for us to continue to push towards second dose acceleration, but also to try to reach our vulnerable populations that experience barriers to first dose vaccination as well. We're now about almost 2 weeks into our step one reopening, and certainly continuing on a steady reopening will allow us to monitor the impacts of each step as they occur, and also to increase our second dose coverage. And basically, as I said, we're adding 10% of our 12 plus eligible population each week. That's 150,000 doses being delivered every week, and each additional week makes a significant contribution to our overall protection. Next slide, please. So, in respect of coverage rates, I just wanted to highlight the percentage of Peel residents that have received their first dose only and second dose by age group. This is denoted by the dark blue lines, which show, and the light blue bars, respectively, which shows one dose and second dose coverage. And so, at this point, 79% of Peel residents 50 plus have received at least one dose of vaccine. 38% have received 2 doses. 74% of Peel residents aged 18 to 49 have received at least one dose of COVID-19 vaccine, with 12% having received 2 doses, and significant uptake amongst our youth population, with nearly 60% having received at least one dose, and certainly now benefiting from that protection. I'd also like to mention some of our outreach efforts for youth aged 12 to 17. Throughout June, we have a number of youth-focused clinics that have been deployed, including 6 school-based pop-up clinics that have been planned in collaboration with Dufferin Peel, Peel District, and Mont Avenir school boards. And these youth-focused clinics are hosted in familiar school environments, focused on youth with special education needs. And then there will be dose 2 clinics that will return in August to support the youth and family that attended these pop-up clinics, aligned with the province's target date of having as many youth as possible fully vaccinated before school returns in September. We also have additional youth-focused clinics in Peel, including the William Osler Youth Pad at Century Gardens, which is a family-friendly and interactive space, as well as participating pharmacies and primary care clinics that are offering Pfizer. And we are planning throughout the summer to include additional youth-focused pop-up clinics. We will certainly keep you informed and updated as to where they are in our community to support our ongoing hospital and fixed and mobile offerings. Information and resources will also be shared not only with council, but with partners across the system, including youth-focused organizations, primary care, and pharmacy partners to support youth and their families in feeling confident with their choice to get vaccinated. We'll go to the next slide, please. I think it's really vital at this point in time to highlight, that while we have the goal of trying to get Peel residents vaccinated with second doses as much as possible, we do have supply volatility. So given that the supply has improved since the start of our campaign, but we have seen throughout, for example, Pfizer had the delay in February and March. Subsequent to that, Moderna had a delay throughout the spring, and now we're dealing with a Pfizer delay that started this week and is also anticipated to impact supplies in July. So it really, I've messaged this, that it's important to remember that mRNA is mRNA. And the goal is to really try to get to 2 doses of vaccine to ensure that you are a 2-dose covered. And it is we are continuing to work on communicating the safety and effectiveness of vaccine interchangeability. It'll allow us to reach higher second dose coverage sooner, which will assure our reopening and continue our momentum in our community, and also provide protection to our residents. And we also have ongoing outreach work with, to promote vaccine confidence through the high priority community strategy that is led by a number of community agency partners. This was originally the strategy, as you know, to target high transmission neighborhoods and high risk neighborhoods with access to testing and wraparound supports and COVID-19 education. It has now been expanded to include vaccine confidence and promoting vaccination uptake. And the other example, which I'm very excited to pass on to Lisa Dillon to talk about, is Real Peel, Real Voices, which is our campaign to really bring a voice from our residents to continue our efforts to promote uptake in our community. So Lisa, can I please pass it over to you to share the awesome work of your team?
Thank you, Dr. Loh, and good afternoon, members of Council. I'm very excited to be presenting the Real Peel, Real Voices campaign today. COVID-19 was the perfect storm, and we weathered this storm in different boats. Disparity of the pandemic and how it affected different segments of our population differently have been shared with Council previously. As we all know, different communities have experienced things differently. With Real Peel, we are with residents listening and capturing what those experiences are and the different trajectories that different communities have been through in dealing with the pandemic and how all these factor into the decision of getting vaccinated. Everyone has their own path to get to the same decision point of vaccination. Next slide, please. The concept is simple, yet very powerful. Real residents, real community spaces, real languages, real voices, real stories, real influencers, real confidence, making real impact. To continue to build vaccine confidence, we need to mirror the Peel community. As we know, when you mirror the community and have community members leading this work while representing them in languages, race, ethnicity, experiences, and spaces of familiarity, vaccination too becomes relatable. This is a community-led approach to build vaccine confidence, which also complements the work that our community partners, task forces, and the High Priority Community Strategy Group are leading to reach our hardest to serve. This is the real power of personal narratives. Video, please.
My name is Gurinderjit Singh, and I am a frontline worker in UPS, and I have got my Tika 2020 ਮਈ ਚ ਆਉਣਾ ਸੀਗਾ ਸੋ ਡਿਊ ਟੂ ਕੋਵਿਡ ਲੋਕਡਾਊਨ ਉੱਥੇ ਲੋਕਡਾਊਨ ਲੱਗ ਗਿਆ ਆਪਣੇ ਇੰਡੀਆ 'ਚ ਸੋ ਮੈਂ ਸਤੰਬਰ ਦੇ ਵਿੱਚ ਇੱਥੇ ਆਇਆ ਮੈਂ UPS ਜੁਆਇਨ ਕੀਤਾ 6 ਮਹੀਨੇ ਹੋ ਗਏ ਉੱਥੇ ਕੰਮ ਕਰਦਿਆਂ ਨੂੰ ਮੈਂ ਆਪਦੀ ਫੈਮਿਲੀ ਨਾਲ ਰਹਿਣਾ ਇੱਥੇ ਮੇਰੀ ਸਿਸਟਰ ਦਾ ਘਰ ਆ ਕੰਮ ਤੋਂ ਆ ਕੇ ਵੀ ਡਰ ਹੁੰਦਾ ਕਿਉਂਕਿ ਮੇਰੀ ਸਿਸਟਰ ਦਾ ਛੋਟਾ ਬੇਬੀ ਵੀ ਹੈ ਇੱਕ ਘਰੇ ਸੋ 2 ਸਾਲ ਦਾ ਉਹ ਸੋ ਉਹਦੇ ਕਰਕੇ ਥੋੜਾ ਜਿਹਾ ਜ਼ਿਆਦਾ ਡਰ ਹੁੰਦਾ ਵਾ ਮਨ ਦੇ ਵਿੱਚ ਸੋ ਧਿਆਨ ਰੱਖਣਾ ਸ਼ਾਟ ਲਵਾ ਕੇ ਵੀ ਆਪਦਾ ਧਿਆਨ ਰੱਖਣਾ ਕਿਉਂਕਿ ਤੁਹਾਡੇ ਨਾਲ ਤੁਹਾਡੀ ਫੈਮਿਲੀ ਜੁੜੀ ਹੋਈ ਹੈ
Fear is a terrible thing. And I believe that if we would be rational and if we would think of our future and the future of those around us, that we would say it's no problem to get a vaccine.
I apologize, the video was a bit laggy. The faces you see here are real residents of Peel, highlighting the different parts of our community. They represent different ethnic backgrounds, ages, life stages, and roles in our community. Youth, faith leaders, essential workers, international students, these are just some of the collective voices of the Real Peel campaign. You've seen the impact of personal narratives in the previous video, and we have a full campaign and suite of videos that showcase our community's journey to vaccination. It delivers the message of vaccination in a way that resonates with the people of Peel. As we roll out this approach today, we're employing numerous tactics to share these community voices. They include a media release, a dedicated webpage on our website, peelregion.ca/realpeel, social media, ethnic media engagement and advertisements, community agency partnerships with inclusion in our COVID communications toolkit that is also shared with our partners for them to use. We will continue to gather these amazing stories, and while today the context is about vaccine confidence, our passion for this community-led approach shows the value in work like this moving forward. Real voices, real spaces, real people, real languages, all from this beautiful community that we are so proud to be a part of and represent in this work. Some got the vaccine to honor the loved ones they've lost. Some with the hope that they'll be able to go home and visit their parents in India. Some thought it was a conspiracy before the virus hit their own home. Some just want to be able to hug grandma again. And some got the vaccine because it was offered to them in a familiar place. The Real Peel approach gives voice to these residents. Last video, please.
To be part of this Martin community is a very great honor.
we as a family have been in this community for more than 10 years because this is our community. If we have many organizations like this, then we're going to have a better society. A society that doesn't discriminate, a society that takes everybody as brothers and sisters, a society that have belief that if we work together, we're going to achieve a lot.
My name is Latifa and I got this vaccine for my community and for my family.
There will be more good out of COVID-19 than bad. Yes, we lost lives, and lives are precious.
And get everybody vaccinated, it'd be great. Share those doses.
मेरा नाम हुमा आफ्ताब है और मैं ये माल्टन में ही रहती हूँ तो आज ही मैंने अपनी वैक्सीन अपनी इंजेक्शन लिया है.
My name is Nurlip Brar and I got my vaccine in memory of Gursevik Singh Brar.
We appreciate our parents, our loved ones.
Je m'appelle Isaiah, j'ai 13 ans, je vis dans la région Peel et je dédie cette vaccination à ma mère.
I am Hamid Slimi and I got my vaccine for my parents and also for my community so I can serve them better and be there when they need me.
Thank you, Lisa, for your presentation and for the great work that your team continues to do. I think it certainly, I've seen that video before and it just continues to tug at my heartstrings when I do see it because it really speaks, I think, to the resilience of our community and how we have all collectively come together to really push us into what will hopefully be brighter days in a post-pandemic future. So certainly with our priorities going forward, we're continuing targeted outreach for first dose coverage. It's vital to continue increasing and reaching those who are facing the significant barriers, even while we do accelerate second dose coverage to prevent increased transmission of the Delta variant in our community. The Real Peel campaign is one big part of that, but also helps to supplement a lot of really excellent community engagement and outreach work that has been continuing through our mass vaccination program. Certainly, I also wanted to highlight that as we start to move through steps 2 as of next week, and then presumably step 3 following, we are also looking at the nature of reopening other programs within public health. At this point in time, we are just to sort of outline where we're going with this. We do need to take a bit of a deliberate approach in reopening public health programs. Staff have been in the COVID response for an extensive period of time, over 500 days, which represents the longest emergency response since the inception of Peel Public Health. Together with the founding of the region of Peel in a very high-pressured, fast-paced environment with very little to no time off. And so similar to our situation between waves, we are at a time of declining case counts and the easing of public health measures and the emergence of a more transmissible variant of concern. And so we're very fortunate that the context is different with vaccination, but we do need to remain cautious as we restart our public health programs. We will, of course, make sure that critical time-limited programs, such as inspections that need to be conducted, those get started up to support the reopening. But overall, it's a matter of continuing to monitor our progress closely, keeping our vaccination momentum going, and then really trying to ensure that our staff are given an opportunity to recharge and reflect. And I really want to stress again that even while we do reopen, it's important to remember that until we get to broader second dose coverage, there is still the potential risk for resurgence, as we've seen in the United Kingdom, where the reopening was delayed, and elsewhere. So it is absolutely vital that while we take our time to restore public health programming, we also take our time to restore just our general day-to-day interactions and really emerge slowly and gradually as we ramp up second dose coverage. And finally, I really want to highlight that, in managing a volatile vaccine supply and also vaccine preferences, our employees working in the public health clinics and call centers continue to be met with ongoing harassment from some members of the community. And it is really important to remember that they are doing a tremendous job for the good of our community, and that really it is a lot easier for us to be kind, that any abuse and harassment is simply not tolerated and really does not help our ongoing situation and cause. Certainly everyone is tired of the pandemic, but I think kindness and empathy go a long way as we try to push through to the finish line on this one. So with that, I will thank Council with going to the next slide, and I'm happy to answer any questions that you may have. Thank you.
Thank you. First up, Councillor DeMerla.
Thank you, Chair, and good afternoon, Dr. Loh and your team. Great video and a really great campaign by Lisa and her team. And as well, I would second the fact that really it's quite surprising that even now the harassment of healthcare workers continues. I'm kind of surprised. I thought that was maybe we are past it, given that there's lots of vaccines and should be much smoother. That said, Dr. Loh, it'll come as no surprise to you what I'm going to say, because I have been advocating offline, but it would be remiss of me as the local councillor if I didn't raise the issue here at the region as well, that I am somewhat concerned about the lower levels of vaccination in L5A and to some extent L5B. And as we discussed, the numbers don't tell the whole story, because there's a huge part of L5A where I know the vaccination rates are going to be very high because it's very affluent. And so despite that affluent piece pulling up the numbers, when I see that the overall average number is quite low, it tells me, without having to actually, I wish I could break it down further and not just by postal code, but I do know the areas that are under vaccinated and where they are. And I'm a little concerned that even now, despite the new pop-ups that your team is planning, that it doesn't really address some of the underserviced areas in L5A. So I know Brian has promised to get back to me with some more options, but I really am concerned, and I wanted to raise the alarm a little bit, and I hope to work with your team to find some solutions.
Dr. Loh, did you have a comment?
No, other than to say through the chair to Councillor DeMerla, absolutely. We share similar concerns and have identified various postal code forward sortation areas that are in need of targeted approaches. And we will certainly work with you, at least in respect of L5A and L5B, as with other high risk and high priority communities that have been identified through our data. Thank you.
Thank you. Moving on, Councillor Paleshi.
Thank you very much, Mr. Chair. It's great to see Lisa. Lisa, you're an absolute rock star. I absolutely love the Real Peel, and everything's going so well with the advocacy that we're getting out into the public. Dr. Loh, I hope you can relay the words of council that to Peel Public Health staff. We're behind them 100%. If they need anything, we're here to support them 100%. Dr. Loh, my only question was, with respect to Israel jumped out in the vaccinations really early, was doing well. I know Canada stepped up the vaccination since then. I guess they're on the cusp of another wave that is going after even vaccinated people. It's the Delta Plus variant, the mutation from the Delta. Are you paying close attention to what's happening in Israel? Are we watching this Delta Plus and the fact that it's, I guess, one of its main mutations is the resistance to monoclonal, which I don't even know what that is. But if you can talk about that at all, Dr. Loh, I'd appreciate it.
Absolutely. So through the chair to Councillor Paleshi, the concern with the Delta Plus variant, as you identified, is that it may reduce the effectiveness of a specific treatment that has been used using monoclonal antibodies in various settings. And so at this point in time, though, everything that we have indicated from the Delta Plus variant is that it very much behaves still like the Delta variant, and that at least from a prevention perspective, getting to 2-dose coverage is likely the most effective negative way. So the concern with Delta Plus is really on the treatment end. If someone ends up, particularly if someone who is unvaccinated ends up in hospital or in ICU, and I think that's the specific concern with the Delta Plus variant, and that speaks to the need to try to get to 2-dose coverage. Because as I'll also add, my understanding in Israel is that while some people who are fully vaccinated are coming down sick in the midst of some of those outbreaks in Israel, many of them are not becoming severely ill or hospitalized or succumbing to the disease. And that really reflects ultimately the goal of what we're trying to accomplish, which is essentially trying to turn this disease into something that isn't a roulette wheel, that you're trying to see whether you end up passing away or ending up in ICU because of a severe immune response, but really just priming your immune system so that when it does show up, it is a milder illness that is not fatal or severe.
Thank you so much, Dr. Loh. Thank you, Mr. Chair.
Thank you. That's my list of questioners. I guess I have moved by Councillor Paleshi and Councillor Fonseca. Anybody opposed? That's carried. Thank you. Brings us on to presentation 8.2, COVID-19 Recovery Planning Framework. We have an oral presentation here, but I don't have a designated presenter. If staff could help me out.
Oh, through you, Mr. Chair. That's me.
You'll do. Go ahead, Janice.
All right. Thank you. So as Dr. Loh mentioned in his presentation, as public health are turning their minds to recovery, of course, we are also looking at recovery more broadly across the region. Last fall, we did present a regional recovery framework to Council. But of course, we had to pause and set aside a lot of that work as we confronted the second and then the more deadly third wave of COVID-19. But there's reason for optimism, and with reason for optimism comes a need, obviously, for us to turn our minds back to what does recovery look like so that we can transition from the response phase of the pandemic to this recovery phase. So we thought today we would give you just a very quick overview of the work that's being undertaken as we speak. So if I could have the next slide, please. And really, this work is being done in about roughly 7 different areas. And just I'm not going to go through each and every word on the slide, really just the buckets, but just to give you a sense of the color coding, the blue are things that we have already started and we believe are the most critical things that we have to look at. We have some midterm issues and plans to develop over the summer, and then some things will be looked at in terms of start back up in the fall. So the future of work is really around the role of remote work in the future employee work conditions of the region of Peel. We all know that we had to pivot very quickly back in March of 2020, and those who could work from home have been asked to now for well over a year. We have always had flexible work practices, but we know that we need to look at the integration and the new guidelines around what that future of work looks like. So that work is underway with the support of a consultant. We brought in a consultant to help us with this for 2 reasons. One, to have a fresh set of eyes and industry best practice come to the table. But the second reason was just simply a capacity issue in terms of having the people available who could undertake some of this work. And we know it's important to move forward with it. And so we thought getting some additional help to do that would be useful. We also have to look at our buildings in terms of reopening and reoccupancy. There are some very practical considerations that we need to look at in terms of getting back to the office environment. We need to consider the timeline for council's return to chambers, and very much will be looking for your input on that issue, looking at which staff groups might have to be prioritized to come back first. There will be safety and cleaning protocols that we presume will need to continue post-occupancy, and ensuring that as we're doing that, we're looking at continuous improvement. How can we consolidate service counters and improve resident-facing services and make them more accessible? So this is a second basket that we will be doing significant work on over the summer. The third area of workforce health and well-being is probably one of the most critical categories, and Dr. Loh referenced it in his presentation, and the fatigue factor that we're seeing in public health, and certainly in many, many areas of the region. I've taken to saying recently that we've kind of ended up being a little like Humpty Dumpty. We fell off the wall, which was COVID, and we've had to put pieces of our resources into the most critical areas of COVID response and mass vaccination. We now have to not only put those pieces back together, but we have to consider the health and well-being of our staff. Some of our staff have not had the ability to take vacation of any significance for a very long period of time. We have large vacation banks that have built up. We have time in lieu of overtime that has built up as well. And so we need to consider that in order to ensure that as our staff come back and as we recover, they come back healthy and they come back refreshed. That may necessitate a strategy of accommodating everybody that in fact may delay the implementation or reinstatement of some services and some projects. We will be sorting out that over the summer, but certainly we want to start implementing employee health and recuperation as soon as possible. And I know some divisions are hard at work now trying to ensure that we can give our staff relief as the summer months unfold, because of course that's prime time for vacation. Next slide, please. We have to look at our service delivery and strategic priorities. Many of our projects that were identified for this term of council have been slowed or delayed because of COVID, and we have now just over a year remaining in this term of council. So we will need to revisit those priorities and consider what can be accomplished and what has to be delayed. But we also are looking for opportunities to modernize our services and look at a digital first approach to customer service. So, you know, we want to ensure that we balance those return to strategic priorities with looking at opportunities for innovation and continuous improvement so that we can improve and enhance the services that we provide to the public. Of course, we can't forget about the budget and the financial and economic impacts. We know that there will be long-term consequences, we believe, coming out of COVID. And while in the short term, we have had significant provincial and federal support in some of the challenges that we faced, there will be a need for us to consider the longer term implications of that, and that work is underway. And you will see, of course, some of our early considerations of that issue as we give you a budget preview. And there is business continuity. We have to move from emergency mode back to something that looks more normal. We want to make sure we do a lessons learned from that we carry over the best practices that we've been able to implement and things that we've learned through COVID, and make sure that we are communicating that work clearly to our stakeholders and to the public and to council. Next slide, please. So we have now teams that are turning their minds to each of these areas, and we will be reporting back to Council. You will certainly get a fulsome update in the fall of our progress in some of those areas and recommendations on some of our reprioritization work. And we know that we've asked a lot of our staff, because some of the teams that are identified here have been heavily involved in both the emergency response and the mass vaccination program. So even as we turn our minds to recovery, we still have to be mindful of the demands that we're placing on an organization that really is tired, has worked, so hard, and under some of the most challenging circumstances I think that you could ever ask public servants to work under. So pacing out this work will need to be a consideration as we go forward. And final slide. So while all of this is happening, as Lawrence has said to you, we do have to be mindful that we are certainly in a better place, but not out of the woods entirely. There are still risks out there that we will have to pay attention to. I think there are still considerations to be understood about the future of vaccination. I mean, there's talk of booster shots in 2022. What will that look like, and who will be responsible for those? So, we're not ready to put COVID in the rearview mirror just yet, and we will have to manage these issues as we go forward. The workplace fatigue, I can't emphasize enough, and that's why it is on this slide again. We have a very tired workforce, and we particularly have a very tired workforce of all of the staff that have had to respond to and pivot constantly around COVID. And that is everything from, the public health response, the long-term care response. These are the things that people will think of first. But our human resources team, our communications team, our early years and childcare team, who have been standing up and standing down and standing up emergency childcare, our human services team who've been managing isolation centers. It is a very long list. It is deep in the organization. It has taken a toll. And as an employer, we have an obligation to ensure that we recognize that and that we pay careful attention to it, but most importantly, that we allow our staff and our team the time to refresh and recover so that we can be a healthy, productive organization going forward. So some of the timing of this is estimated right now. And as I said, we will have a more fulsome update for you in the fall. And we will be communicating, consulting with council, with staff, and with the community as we go forward with this work. So that's my presentation, Mr. Chair, and happy to take any questions.
Thank you. I don't see any questions now. So with that, I'm going to ask Councillor Innes and Councillor Carlson to move receipt of the presentation. Hearing no objections, are there any? Seeing none, that is carried. Thank you, Janice. That brings us to item 10, staff presentations. 10.1, Peel Renewable Natural Gas Center Anaerobic Digestion Facility, Decision-Making History, here for information, a presentation by Norm Lee, Director, Waste Management. And if I could, just before we start the presentation and go to Norm, it was a question I put to our CAO, because as you see, this is history and here for information, so we're not making a decision today. And so I did ask the CEO, what do you hope us to do today? And she reminded me there's a follow-up report. And I said, you'd better couch how the two relate to each other so that we manage our time best at this meeting and at an upcoming meeting. So through to the CAO before I go to Norm, what's before us? What do you anticipate coming before us? And what are we hoping to achieve today and the next time it's before us? Janice, through to you.
Thank you, Mr. Chair. So today you have in front of you what I would consider to be a bit of an education report, I think, at the request of the Waste Management Committee. And I think at the committee there was a discussion that this process has taken a long time. So we thought it would be helpful to both refresh Council's recollection of the process that we're engaged in to look at the potential acquisition of a facility such as this, but also to talk about the decision-making process, what led up to a council decision to pursue this particular procurement. So staff are really going to go through the history of the project today. On July 8th, you will have a report coming forward in the next agenda, which is really where council will get the outcomes and results of the procurement process, and then staff will have recommendations about next steps. So there really is, this is just for information today and for receipt and for council's understanding. So clearly, obviously, questions of clarification and to understand the process, most welcome. But today is not for purposes of debating the procurement outcome itself. That will be before you on July 8th.
Very, very helpful to me and very helpful to the team. And so you've made it very, very clear. So with that, let me bring up Norm Lee, Director, Waste Management, for his presentation of this report that's here for information. Norm.
Actually, Mr. Chair, it's Keely Dedman, Commissioner of Public Works. I'm just going to lead off the presentation before passing it over to Norm Lee.
My apologies, Commissioner. Go ahead, Commissioner Dedman.
That's fine. So our CIO has already mentioned that the purpose of today's presentation is to provide an overview of the history and the justification for the renewable natural gas anaerobic digestion project, which I'll refer to as the AD project, because that's a bit of a mouthful. The presentation is going to cover key regional council decisions relating to the AD project. We'll review the rationale for moving forward with this particular technology and ownership model. We'll talk about the potential role of mixed waste processing as part of Peel's integrated waste management system, and a look at the project team who are working hard behind the scenes. Next slide, please. So we'll start with the current status of organics processing in Peel. Our current approach involves processing half of the total green bin material in-house and using private processors for the other half through a number of small tonnage short-term contracts.
Keely, you just went to mute. I can't hear you. Why don't you start up again?
Oh, there we go.
There you go.
My apologies. Go back to where I was. So our current approach in Peel involves processing half of the total green bin material in-house and using private processors for the other half through a number of small tonnage short-term contracts. But Peel's outgrown the capacity of the composting system, and as well the system's aging and it requires significant maintenance. The Peel system does not separate the contamination very effectively either. So that means that we can't maintain the status quo, and a new process or approach is urgently required to manage Peel's current and our future green bin organics processing. This need for a new approach is what prompted the previous studies and the strategies and the decisions of Council. Next slide, please. So this slide provides the background on Council's past decisions on the organics processing program and the anaerobic digestion project itself. The first step with respect to the AD project occurred in 2014 with Regional Council's endorsement of the Waste Management Infrastructure Plan, which recommended a Peel-owned AD facility in either Brampton or Mississauga. As you can see, staff has reported back to Council almost every year with information, and Council has made multiple decisions to move the project forward. The most significant Council decisions were made in the last few years. In 2017, Council approved the long-term waste management strategy that included a Peel-owned AD facility to help achieve Council's diversion and climate change goals. In 2017, Council also approved the key terms for the anaerobic digestion procurement, including its capacity, the use of design, build, operate, and maintain contract, and production of renewable natural gas. Then in 2019, Council approved the property at 125 Orenda Road in Brampton as the site for the facility and approved the issuance of an RFP for that site. $130 million has been identified in the region's capital budget and $14 million a year in the operating budget for this project. And now I'll pass it over to Norm Lee to speak to the specific studies and report findings that led to this decision. Next slide.
Thank you, Keely. Council considered processing technologies and ownership models. This slide deals with the technologies, and the next slide will deal with ownership. So when it comes to processing technologies for green bin organics, two proven technologies exist, and they're composting and anaerobic digestion. Anaerobic digestion has a higher capital cost, but a review of recent large composting and AD projects shows that at this scale, AD can be competitive with composting, especially if you factor in haulage costs. And you see some of the differences between composting and AD on the slide. Composting requires significant separation distance from residents to prevent odor impacts. It requires a larger footprint. It retains material on site for a longer period, which means you need a larger site. And it cannot process an expanded list of organic materials. AD, on the other hand, has better odor control, smaller footprint, which means it can be allowed closer to the source of the organics. It has a much better ability to separate contaminant materials, which allows new materials to be added to the green bin, which will increase diversion. And of course, as you know, it produces renewable natural gas, which reduces greenhouse gas emissions. And for those reasons, Council selected AD as the preferred technology option. I would note that Toronto, York, Durham, and now Halton have all chosen AD over composting for similar reasons. Next slide, please. Staff assessed market capacity and considered 3 ownership scenarios for the AD facility. At the time the infrastructure plan was developed, there was no single processor with enough capacity to meet our needs. There still isn't, so the analysis we did back then is still appropriate. The first scenario, and it's described in the first column of the slide, assesses, the one we assessed was private ownership with multiple contracts, each using a bit of their own capacity, which is really a status quo option. This type of capacity is typically procured through a request for pricing. It can include some minimum qualifications, but the decisions are generally made based on price. And you can see some of the considerations there. This is the lowest cost option, but it does come with the highest risk for Peel. There are all short-term contracts. At the end of that contract, we lose access to that capacity, meaning we have to go out for another procurement. There is a risk that we would be unable to secure capacity at the end of those, at least not locally, and we've seen that in some other municipalities in the GTA who are currently hauling their organic material, beyond Ottawa to find processing capacity. Excess capacity is not expected in the province over the foreseeable future, so there would be a risk there. And with these types of procurements and contracts, you have no control over the design or operation of the facility, and you acquire no environmental benefits. So we would not own any renewable natural gas or get credit for any of the greenhouse gas reductions. The second scenario we considered in the middle column is private ownership with a single dedicated facility. So this type of contract is typically procured through a request for proposals, where qualifications of the operator and capabilities of the system are scored along with the price, and often the best overall value is not the lowest price option. So some of the considerations there, The cost is dependent on the term and the requirements. If we impose stringent requirements for odor control or efficiency or performance, the cost goes up. Facility owner retains the environmental attributes typically, so we would not get any greenhouse gas reduction credits for that. Facility ownership provides leverage in disputes, and this is important. We've operated facilities for years, as have our colleagues in other municipalities, and from time to time you get into disputes with the operator. And we found time and again that whoever owns the facility tends to have the upper hand in disputes. So that's an important thing. And with private facilities in Ontario, both composting and anaerobic digestion, there's been a history of shutdowns due to odors, control orders issued by the ministry, or sometimes just from improper or incomplete maintenance. Finally, at the end of, sorry, I'll skip one. If there's a business failure, let's say, for example, the owner goes bankrupt. If we have third-party capacity and the owner goes bankrupt, we lose access to that facility and we have nothing, and we're back kind of in an emergency to start over, where if we own the facility, obviously we could just bring somebody new in to operate it ourselves. And again, although these would be long-term contracts, 15, 20 years, at the end of the contract, we lose capacity, we lose access to the capacity, and we have to do it all over again. So for respondents who build new facilities in response to this type of RFP, the tip fee would typically include some amount to recover the capital cost of building it. So Peel would likely end up paying the capital cost to build the facility without owning it. And we know there's challenges citing waste management facilities. In Peel, there are very few properties available. Our assessment is that without us helping the proponent find a property that's properly zoned, it would be most likely the facility would be outside of the region. So any investment that we make would be investment outside of the region, creating jobs outside of the regions. The third scenario we assessed was, of course, the Peel-owned facility, as shown on the right. This is, without a doubt, going to be the highest cost option, but it's also the lowest risk option, and I believe the only option that gives us guaranteed, reliable, long-term processing capacity. Access to capacity extends beyond the original contract, and the current design, build, operate, maintain contract would go on for up to 20 years. At the end of that, we still own the facility, and it could still be workable. So we would just be able to bring in a new operator and continue to have that access. Of course, we own the environmental attributes, and I'll talk in a minute about the value of the renewable natural gas. And of course, this is the option that Council selected as a preferred option. Next slide, please. The key environmental attribute from anaerobic digestion facilities is the production of renewable natural gas. This facility will produce, and these are just numbers, but 600,000 cubic meters of natural gas per year, contains 215,000 gigajoules of energy. Peel right now for our facilities for heating and cooling uses around 600,000 gigajoules of energy, so it's about a third of it. So if we chose to sell this RNG at current market prices, we would get about $4.3 million per year, which would reduce the operating cost by $48 per ton. So that's a significant amount of revenue that we could earn. If we use that renewable natural gas ourselves, it would offset our purchases of normal natural gas to the tune of about $2 million a year, which, again, that's just about half of that previous number, but still a big number. And if we use the renewable natural gas ourselves, we'll reduce our emissions by over 12,000 tons per year of CO2, which would bring Peel halfway to its 2030 target. Next slide, please. I just want to talk a little bit about the role of mixed waste and how it kind of works with anaerobic digestion, because we get asked about that a lot. And at the end of the slide, I'll talk a little bit about the European situation, because we get asked about that a lot too. So staff has been investigating mixed waste processing for some time. You'll recall it's part of our long-term strategy to do so. It includes visits to some existing mixed waste facilities. It includes meetings with mixed waste vendors. And it actually included a short 6-month mixed waste pilot with a firm in 2017. There are key risks, as we've told Council, that need to be resolved before implementing mixed waste on a full-scale basis. And the main one is related to the organics produced from mixed waste processing and the use of it, whether it would meet provincial and federal quality standards, and whether or not reliable markets would be developed for those that would be sustained over the long term. Of course, a mixed waste pilot would help resolve these risks and give us answers to those questions. And as you know, staff has been asked by Council to investigate and report back on whether or not Peel should proceed with such a pilot. And those investigations are underway. They included a request for expressions of interest, which generated keen interest. Respondents were reluctant to take on all the risks and indicated they would need Peel to backstop some of the key risks, which confirms the risks identified by staff are also seen by proponents in the industry. And as the slide shows, mixed waste processing does not replace AD, but it complements it by recovering recyclables and organics from garbage. Some of the reasons include provincial policy requires Peel to collect green bin organics separately and does not allow those green bins to be processed together with mixed waste. Diversion of organics from anaerobic digestion is a proven approach with high quality outputs that have well-developed stable markets in Ontario. Diversion of the lower quality organics from mixed waste processing is still unproven in Ontario. I've included, and I'm just going to jump to the European situation, because we get asked, or I get asked often, why can they do it there? Why does it always seem so easy? Two reasons really are the regulatory framework is different and their funding opportunities are different. In 1999, the European Union issued a landfill directive, which prohibited the disposal of unprocessed waste in landfills. And they did that to reduce the impact of landfills. It drove a significant investment in mixed waste processing and also in energy from waste. But while Europe supports the use of mixed waste processing to reduce landfill impacts, they still have questions about the quality and use of compost and organic fertilizers from mixed waste processing. And they still recognize source separation, like our green bin program, as the preferred approach for managing organics. In 2018, they amended their waste directive framework to require separate collection of organics at source by the end of 2023. And as of January 1st, 2027, only separately collected and processed organics will be counted as diversion in Europe. And that's important because a lot of European grants are tied to things like diversion rates in the member countries. Also in 2019, the fertilizer regulation in Europe was amended and no longer permits compost that came from mixed waste processing to be marketed as a fertilizer across Europe. On the cost side, European countries had access to EU grants, which were quite generous in many cases. And most EU countries have introduced landfill taxes as a way to fund investment in waste infrastructure. The landfill taxes, they start at a low of €5 per ton, but some countries have landfill taxes over €100 per ton, which is about $150 Canadian. And the UK, their landfill tax is currently £96 per ton, which is about $160 per ton. So you can imagine if you're generating those kind of taxes on every ton of waste you landfill. That gives you quite a bit of money each year to spend on diversion initiatives. So in contrast, only two Canadian provinces have landfill taxes. Manitoba charges $10 a ton. Quebec charges $20 a ton. Very low compared to the European numbers. So in summary, I think both EU and Ontario agree that source separation is preferred path to resource recovery, especially for organics. But landfill bans and landfill taxes support mixed waste process in Europe, but they aren't present in Ontario. With that, I'm going to turn it back over to Keely, I think, to wrap it up. So if you can go to the next slide.
Thanks for that, Norm. There were some questions at the last time that staff presented to council on the topic of who was involved in this project as well. So we thought we'd just give you an overview of that. You can see in this slide that there's an extensive team supporting the AD project. It involves a steering committee, there's a procurement team, and a dedicated project team that's supported by in-house staff from procurement, from legal, and from finance. And in addition to that, we have consultants that are a big support. We have GHD, Aird & Bearless, as well as EY. So as you can see, this project's being managed by a very diverse and competent team from both internal and external experts. Next slide, please. I'll just close out the presentation by reiterating that the previous staff recommendations and decisions that Council has made with respect to the anaerobic digestion project still continue to be appropriate today. Although mixed waste processing could complement AD and the green bin program, as long as those risks that Norm talked about can be resolved, we could certainly look at that, and the upcoming pilot in Peel will help to inform the next steps on that front. So next up, staff will be bringing a report on the anaerobic digestion project to Regional Council to the July 8th meeting, and that's going to include the results of the RFP process as well as recommendations for next steps. Finally, there's some breaking news this week that I wanted to share, and that's that the federal government announced a new $1.5 billion clean fuel fund to support the development of clean fuel production facilities, such as anaerobic digestion. Staff are currently reviewing the available information, but it appears that this project meets the funding criteria. So at this point, we're cautiously optimistic that Peel will be able to secure some of that funding. Some more information on this will be provided through the July 8th report to Council. And with that, Mr. Chair, it concludes our presentation, and we're very happy to take any questions.
Keely, Norm, Janice, thank you very much. Before I go to my question, just to remind you, Keely's closing point. This was here for information. A full detailed staff report and recommendation will be to us at our next meeting. So I hope there's just some quick points of clarification here. My list is Councillor Starr. Councillor Starr.
I'm glad we're doing it this way because I have a ton of questions. I've gone through the report. I've gone through the reports of Peel, Halton, and York, who are all going to market as we speak right now. And the problem that I have is with the presentation, and I'm sure we're going to get more clarification, is there's a lot of words here, but there's not a lot of numbers. And I'm concerned about that because certainly when I take a look at a comparison of the per tonnage basis, Halton is working with a number of around $100 per ton. And we're working with a much higher number. And all three, by the way, are certainly looking at and promoting going public-private. And that's changed. And I guess going back, and again, when we started this process 7 years ago, I think the parameters were a lot different than they are right now. And how have we changed with the movement of technology, et cetera? And the thing, Keely, that I'd like to get some clarification on, what expertise, and you put up that last chart, which was telling that the support staff, are these technical experts when it comes to AD or other processes and working with private? Or is it the consultants that have driven the reports? I mean, to me, that's the first one I'd like to know about.
Maybe Keely, I can start that.
Or Norm, yes?
Go ahead, Norm, if you wanted to start.
Yeah, I was going to say, and you know, our consultants are obviously experts in this area. They have a lot of experience. Our engineering consultant, GHD, is one of the preeminent consultants dealing with organics in Ontario and certainly with AD. But within our own team, Brian Van Opstal is a, sorry.
Norm, we're asking you to speak up a bit if you can. You're hard. If you would just speak up, Norm, thank you.
Okay, well, sorry. Within our own team on staff, Brian Van Opstal is leading this project for us, and he is, I think, arguably the #1 anaerobic digestion expert in the province of Ontario. He built 2 anaerobic digestion facilities when he worked in Toronto before he came to Peel. So he and his team, they have a lot of bright engineers. Our finance people looking at costs and reviewing them for us. So I wouldn't say this is being driven by consultants. I think you know, we have some expertise on our team too.
Councillor Starr, anything else?
No, I think he's speaking.
Oh, sorry, you may have frozen, Norm. I didn't know if he was completed. My apologies.
Okay, I'm not sure where I froze up then.
You were finishing off with Van Opstal and his expertise, and I think you were moving on from there.
Yeah, I think that was the main one. I mean, we have other engineers working on this project, and people in our finance department, our procurement staff are quite experienced with different types of procurement and understanding risks. So we do have quite a bit of expertise within the region, and we're not relying solely on our consultants, but you know, just the amount of work generated on a project like this, we need outside help to get it all done.
And that's a kind of a sidebar, and I'm not sure if we want to make that public, but you can take it offline. I'd like to know what we spent over the last 7 years with our consultants and outside sourcing for this at this point. The other question, and I have, and I'm going to probably take a lot of the ones I have offline, but the concern about capacity that you bring up. And I'm not sure exactly what you're talking about when the other municipalities don't seem to be concerned about the amount of waste or capacity, whatever, and from what I gather, neither does the province, and yet we're concerned about that. Norm, can you elaborate?
Well, yeah, I mean, there's no excess capacity right now other than dribs and drabs. You know, and there's certainly none in the real near vicinity of the GTA. For example, York Region is hauling most of their organics right now east of Ottawa to a facility because that's where they had to go to get processing capacity. There was a study done by the Canadian Biogas Association within the last year that showed there is some new capacity coming online. There's a couple of proponents are thinking of building, you know, private facilities. There could be a new facility developed in response to York Region's RFP, but those will not be enough to keep up with new demand. The food and organics policy statement at the province is driving new people into the green bin program. So cities like London, I think there's about a dozen cities. London's the largest one. Have to implement green bin programs in the next couple of years, and also commercial enterprises have to put organics diversion in place. And on top of that, the province, and you know, we're getting close to an election, so it might kick over into the next term, but they're getting ready to start work on an organics disposal ban. So once that comes in place, that's much more significant than just targets, right? You just have no choice but to meet it. So the conclusion from the Biogas Association was that the new generation of green bin material would exceed the amount of new facilities being built over the next 5 years or so. So, we just don't see a lot of excess capacity in the province. People, if we issued an RFP, they might build one either for us, as our RFP is doing, or like York's is doing, they might build a private one. But there's not going to be, I don't think, a lot of excess capacity for the foreseeable future.
Is there, and I think I know the answer, but can you elaborate on what the total cost per tonne will be? And talking about this capacity, I mean, I want to compare this to what I've read in those other reports from the other municipalities. What's our total cost going to be? The total cost per tonne if and when this would be running?
If I could suggest, Mr. Chair, that might be a better question for the next meeting when we bring the results forward of the RFP. We could then debate, whether it's or council, I guess, can debate whether it's the best option or if there's other options.
Okay. I'm just concerned that, and I had an old saying years ago, if it's in the yellow pages, why is government doing it? And I would certainly hope that you've done your homework and your research with respect to the technology changes and the number of newer, I guess, private enterprises that have been formed in the last few years that are doing almost the same thing. And I'm not sure how we can compare those directly, but when I see other municipalities around us taking a good look at it, I would hope at the next meeting you can answer that. But what I will do, Mr. Chair, is get back to Keely and Norm. I have a bunch of others, but I don't want to waste time today because some of these are probably more technical and probably not germane specifically to what we're trying to do today, just to hear the history and where we came from. But I'm glad we were brought up to date on this and that it has taken a long time. And the big concern I have is at this point, I think to me it's a little bit COVID driven, is spending the money, spending it wisely and making sure that we're heading in the right direction. That's all. Thank you.
Ron, thank you. And in fairness to staff, I think, and I should have jumped in, I think it is more appropriate to let them do the complete report, and that way they can bring their best, fullest foot forward, and all the data is before us, and it's easy to compare accordingly. The other point that I would make, Norm's too modest to say it, but in the handful of conversations I had while Minister Urick was the minister, and always driven from the same point: innovation, new technology, because he was a real advocate for Ontario getting out of the landfill business. And I really have to give him a shout out for that. Norm's too modest to say it, but I will say it. It was made very clear to me several times that the greatest expert about waste and waste management in Ontario is on our screen right now, and it's Norm. And the government of Ontario will tell you that unabashedly. He's held in not high regard, the highest regard of anybody in the province. So Norm wouldn't say that, but I will, because it was made clear to me many times from the ministry. Okay, I've got Councillor Innes next for questions. Councillor Innes.
Thank you, and thank you for that report and the information. The stuff that you had mentioned in regards to the European Union was new information, because certainly when we did the mixed waste processing tour, I think that was maybe 5 years ago now, that was not the case. So it's very interesting that they've evolved, and they always do seem to be a step ahead of us. So that is definitely something that we should be looking to. Knowing that the province is going to be coming forward with a ban on organics to landfill, this is crucial, and we're not the only municipality that is going to be looking for anaerobic digestion or some means to deal with our compost. Keely, you mentioned something very interesting, and I just want to ask that maybe at the next report coming forward, if possible, could more information be included about the federal government's Green Fund, because that funding, as well as the the environmental offsets and the gas, the energy that's coming from this is quite substantial. And so those two things combined obviously help with the finances of doing what is socially and environmentally the right thing to do, which I always applaud and acknowledge Peel as being a leader, not only in the province, but in the country for taking that role. So if you could bring that forward so that we could get more information, and if that's something that perhaps we should be reaching out to our federal MPs in Peel through government relations to make sure that they know that we are in the process of, an RFP process for an AD facility, and that we will be requiring and requesting their support for federal funding when we get to that stage in the game.
Okay, thank you. Direction through the staff to come back in a couple of weeks. Councillor Starr, are you back on my list for one last comment?
Yeah, I forgot to ask with respect to producing gas and I guess other forms of energy. We're heading towards electricity or electrical part of our, I guess, our whole economy and the way we do business. Is there any comparisons, Norm, and I'll just leave that with you, where that's heading, where the curve's going? Is gas going to be the be-all in 10 or 20 years? Is it going to be electricity, and where's it coming from? So just as a sidebar, I think that's interesting because we're also saying we can sell that gas, and I'd just be interested in just knowing the comments on that later on. Thank you.
Okay, I see no other questioners on my list. A lot more to come in a couple of weeks' time. I have a motion from Councillor Starr and Councillor Innes to move receipt of 10.1. Anyone opposed? That is carried. Thank you very much. 10.2, approach to the development of the 2022 budget. A presentation from Gary Kent, Chief Financial Officer and Commissioner of Corporate Services, and Norm Malam, Director of Business and Financial Planning. Gary, over to you.
Thank you, Mr. Chair, and I know you've had a long day already, so we'll get through this as effectively as we can. So good afternoon, Chair and Regional Council. Presenting with me today is Norm Lum, who you know well as our Director of Business and Financial Planning, and we're here to present Council with really a status update. We recognise we've got lots of work to do over the summer, but this is a status update and a recommended approach to the development of the 22 budget. I can tell, I think it was Councillor Innes who raised the separation of the conservation authorities and Peel Regional Police. We've already taken a note of that for next year, and we've embedded that into our process for the following year. So next slide, please. Before I pass it to Norm to walk you through the details of the budget approach, I think it's important to highlight some of the key risks and trends that will inform the development of the 22 budget. Now, as you know, 2020 and 2021 have been years like no other. And as we recover from a health and economic perspective, we not only have to stay focused on how we will do that well, but we should also not forget the issues we had pre-pandemic. And you'll see some of those on the screen. I always like to remind the public and say thank you to the provincial and federal governments for all the financial support that they've provided to local government already. Without that, the financial picture for our communities would have been so much worse. And we'll need that continued support on a few financial issues, such as the GTAA PILT, which Norm will speak about. And we also look forward to hearing shortly about confirmation for our mass vaccination programme, which has been so vital for the community. We heard that we would be fully funded for that, and we expect confirmation of that by the end of June or early July. You'll see on the 8th of July a report on the 2021 financial performance, and we're making a big assumption there that we're going to be fully funded for the MVP programme. And of course, 2022, maybe even 21, brings with it provincial and federal elections. They're looming, and they're creating an opportunity for advocacy for fair share funding and additional infrastructure stimulus funding. And we'll be watching closely to see if the higher orders of government are budgeting for austerity or prosperity, and also any new rules or approaches that will influence the financial resources we have to raise locally. We have ongoing changes in legislation and regulations, especially for the health sector. And Council will recall that the province was, very vocal about public health prior to the pandemic. So we'll see what they say after it. We know that as we build back better, climate change and weather patterns are going to be in the forefront. And you heard a lot this morning about the valuable contribution of our conservation authorities. We're told by the scientists that this is the decade where action really is required. Of course, we've got evolving technology. That was pre-pandemic also, and that's been accelerated by COVID, hasn't it, with a very much digital-first approach. The nature of employment was already changing with robotics and automation. And again, now we're looking at how our cities and communities actually constructed. And Janice touched on some of the elements that will impact how the corporation of the Region of Peel goes forward with regards to remote work. But what would that mean from an employment and society perspective? We have economic and market volatility, which may drive higher inflation. And we saw in May, I think inflation was up about 3%. We do expect that to settle down this year, and traditionally it's been 2% or under, but we have to keep an eye on that. Of course, and Council is very much aware of our ageing infrastructure and of the growth needs and how we manage those and the financial impacts around them. And most importantly, of course, the impacts to the community as it recovers from the COVID-19 pandemic. All things will stay agile and nimble on, and we'll give you our best advice when we come back in the fall. Next slide, please. Just as a reminder, helping to guide Peel through this very complex and challenging environment is the region's long-term financial planning strategy. And the goals of this are to ensure the long-term sustainability of our services. The core principles of the strategy that will be used to guide the development of the budget, again, are full respect for the taxpayer, ensure the capital plan is sustainable, manage our assets, and deliver value for money. Next slide, please. And there's some significant work in collaboration with our colleagues in other departments, some significant work currently underway that will help to inform future budgets. Most of these you will see coming forward or at least significantly advanced during the rest of the term of this council. The long-term utility financial plan, which is looking at improving the sustainability of the water and wastewater services. The waste management financial plan, which is examining alternative ways to fund the waste management service and increasing waste diversion. We're developing a strategy to try and address the $500 million state of good repair liability for housing. And of course, the climate change financing strategy, which will recommend an approach to financing Peel's climate change master plan. So the outcomes of these financial plans will help ensure the long-term sustainability of the services in ways that are consistent with Peel's long-term financial strategy. And I'll now pass it over to Norm, who is going to remind you where we left you off as you approved the 2021 budget, and then walk you through the updates as we go forward. Thank you. Next slide, and over to Norm.
Thanks, Gary. So through the 2021 budget presented earlier in the year, a net tax levy increase of 4.2% was forecast for 2022, which included a 1% infrastructure levy to support capital work over the next 20 years. For the utility rate, which even after the 2021 increase left Peel with the lowest wastewater rate in Canada, a 7.6% increase was forecast for 2022. This included a 5% infrastructure levy to help address the unfunded capital pressure of $1.1 billion over the next 20 years. Next slide, please. So since the approval of the 2021 budget, there have been a few significant changes that will impact the 2022 budget. The province announced an additional funding cut to the early years in childcare service, which staff estimate will be around $3.7 million. The 2022 forecast had included the full implementation of the Seniors Health and Wellness Village. This past April, Council approved a phased-in approach to the opening of the Seniors Health and Wellness Village, which will reduce the impact to the 2022 budget by about $2.3 million. And finally, the payments in lieu of taxes from the Greater Toronto Airports Authority. The most recent data indicates that the passenger volume in 2020 was even lower than initially forecast, adding an additional $1 million in pressure. Next slide, please. So with these changes, the preliminary 2022 net tax levy increase is now 4.4%, which is equivalent to a property tax increase of 1.8%. Over the next several slides, I'll walk you through each of the key drivers behind the revised estimate. Next slide, please. So experience in the last several years, changes in provincial funding continue to put pressure on Peel's budget. As mentioned earlier, an additional $3.7 million funding reduction is estimated for early years and child care service. Excuse me. This is over and above the $3.8 million funding impact from 2021 that was deferred by Council last budget, bringing the total funding pressure to $7.5 million for 2022. Other potential provincial funding impacts include the funding freeze for public health. Public health will likely receive the same level of funding that it did in 2018. So there may not be increased dollars for inflation or for increased service demand. In paramedics, even though service demand and inflation are cost shared with the province 50-50, there is a 1-year funding lag, so the region must fund the province's share of any increase for 1 year. Continued advocacy efforts are required to ensure that Peel receives its fair share of funding for provincially mandated programs. Next slide, please. So one of the most significant pressures that arise from the loss of PILT revenue from the GTAA. This PILT revenue is based on passenger count from 2 years earlier, so Peel won't feel the funding impact of the lower 2020 plane passenger volume until 2022. Passenger count decreased by 75% in 2020 due to restrictions on air travel. So Peel is projected to be short $8.8 million in PILT revenues in 2022. And based on current legislation, PILT revenues will not rebound for 35 years if the current revenue cap of 5% isn't changed. The cumulative loss in revenue over that time period is over $240 million. Removal of the increased cap will help in the long run as passenger volumes increase, but it won't help immediately. The province has indicated its intent to address PILT shortfall in some way, but we aren't sure what this is going to look like, whether it's adjusting the cap or subsidizing the shortfall temporarily. Advocacy is underway and is critical to address this issue. Next slide, please. So another portion of the preliminary 2022 net tax levy increase comes from the external agencies, the Peel Regional Police, the OPP, the 3 conservation authorities, and the Municipal Property Assessment Corporation, known as MPACT. Overall, the external agencies represent 45% of the total net tax expenditure for the region of Peel. A key pressure for the 2022 budget is the 4% increase forecasted by the Peel Regional Police, who represent 41% of the net tax budget. The conservation authorities, whose collective budgets represent 2% of the tax budget, have forecast a 3.4% increase. So managing the 2022 budget increase will require the support from the external agencies. Next slide, please. Additional items included in the 2022 forecast are service investments that advance Council's priorities, such as the phased-in implementation of the Seniors Health and Wellness Village that I mentioned earlier in the presentation, enabling paramedic services to meet the call volume for a growing population, expanding the early on program in early years in childcare, in housing support. While nothing's been reflected in the forecast yet, a report will be going to Council on July 8th, highlighting the service demand pressure. And finally, investing in waste management to sustain and increase waste diversion. Next slide, please. Council will recall a 0.6% infrastructure levy was approved through the 2021 budget process to help address the $1.3 billion shortfall in capital reserves required to fund the capital work over the next 20 years. To help close the gap, a 1% infrastructure levy would be needed in the next 5 years from 2022 to 2026. Next slide, please. So in addition to the drivers already mentioned, the net tax levy increase also reflects pressure in the base budget, which is really the cost to deliver the service levels from the prior year. This typically includes inflation and other economic adjustments. To try to mitigate the pressures from the base budget, the CAO has presented a 1% challenge to all services to find savings equal to 1% of their respective budgets. To find these savings, staff will use a number of options, many of which are listed on the slide. And as Gary said earlier, we know we've got a lot of work to do over the summer, and we're going to keep pushing at it. And staff have started some things already, but we'll come back to you in the fall. Next slide, please. So now I'll switch gears a bit and talk about the utility rate. So after the 2021 budget increase, Peel's water and wastewater rate was still 35% below the average rate of neighboring municipalities, even before their 2021 budget increases. For 2022, an increase of 7.6% is forecast. Next slide, please. So in order to maintain a state of good repair of Peel's water and wastewater infrastructure over the next 20 years, the forecast includes an infrastructure levy of 5% to help address the $1.1 billion unfunded capital pressure. Next slide, please. So one of the biggest variables for the 2022 budget will be COVID-19. Will it still be here? Things sound very optimistic, but it's still really difficult to predict. For the purposes of the budget, we will be assuming the pandemic will be over, but need to take into account if there will be any legacy impacts on Peel services as we recover. As you heard earlier from the CAO, many staff were redeployed to support the COVID-19 response, and there may be some transition required in order to get back to pre-COVID service levels as time for recovery is needed. For any COVID costs and pressures that are identified, they will be funded from any remaining COVID funding after 2021 pressures are addressed. And although things may change, as we learn more, it's estimated there will be just under $16 million in COVID funding remaining to address 2022 COVID pressures. Next slide, please. And last but not least, I want to give a quick overview of the timelines for the 2022 budget. Staff plan to provide council with the materials for the budget on November 4th, 3 weeks prior to the proposed start of budget deliberations on November 25th. At that day, an overview of the 2022 budget will be provided, followed by service presentations from the departmental commissioners. The following week on December 2nd, the external agencies, so Peel Regional Police, OPP, and the 3 conservation authorities will present their respective budgets. December 9th and 16th have been held for additional budget deliberations. Next slide, please. That concludes our presentation, and Gary and I would be happy to answer any questions that council may have.
Thank you. I don't see any questions at this time. Very thorough presentation with much more to come. So if there are no questions, I do need to record. Councillor Parrish, I see your hand up now. Go ahead, Councillor Parrish.
Yes, thank you. We had a report, Gary's probably familiar with it because he probably worked on it, but we had a consultant's report yesterday on available taxes that we can impose as municipalities without getting any special permission from the province like Toronto has. And one of them was pretty exclusively a regional one, and that is a levy on all the disposables like Amazon delivering everything in cardboard boxes. And I know we get money back for cardboard, but there's still a process involved. I'm wondering, I'm going to ask that report, Gary, I don't know if you have it, but there's a couple spots in there that would relate well to the region as well. One of them is an uplift on the value of land from when it's purchased to when they finally get around to developing it, like the Rogers development on Burnhamthorpe. And the land that they paid, peanuts for is now worth millions, and there is a tax available in there. So I'm going to ask them to send it to you. I'm sure you were involved in the beginning stages of it, but there have to be some areas in there that we can raise revenue without raising taxes on the citizens of Peel, but go directly to where the problem lies.
Gary, a quick response?
Yeah, sure. Certainly, Councillor Parrish. I actually haven't seen the final one, but it's on my list of things to do. So I'll speak to Jeff Jackson, and Norm and I will get together, and then we'll make sure that our ELT is up to date here, and we'll factor that into our summer conversations and come back to you.
Well, you set it up and you did a great job on it, and you'll be pleased with the report. So happy to have you go through that. Thank you.
Thank you.
Thank you, Councillor Parrish. I again back to my list, and I don't see any other questions. So, as I say, with much more to come back, I need a formal vote on this for receipt. Moved by Councillor Parrish, seconded by Councillor Fonseca. Madam Clerk, for a recorded vote, over to you.
Thank you, Mr. Chair, and I'll take the vote on the staff recommendation contained in Report 10.2, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Support.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Early?
In favor.
Councillor Early in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
In favor.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr? Councillor Starr? Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. And the motion carries. Thank you.
Thank you. And that concludes finally all of our presentations and deputations, which leaves us with matters held by my colleagues. First up, 15.1, Canada Home Share, a pilot program in Peel, as requested to be held by Councillor Demerla.
Oh, thank you, Chair. And I just didn't want to pass up on the opportunity to really commend and thank staff for bringing this pilot home share project forward. It's a program that really checks off so many boxes, the affordable housing piece, the social isolation, and it's cost effective. And it's doing what government doesn't do enough of, Chair, which is act as an intermediary or a facilitator and not just about spending dollars. And I'm personally very interested in this program because I read about it first, I don't know, about 4 years ago or 5 years ago in the Toronto Star. And I have to admit, I wanted to do something about it at the provincial level, but that went nowhere. So I'm just thrilled that we're doing this now at the regional level. And I really want to thank Jennifer and her team, for just running with it. It just, when I first spoke to them last summer about the idea, they were really receptive, and I just wanted to say, good job. I'm really excited, happy to move this, and I look forward to the results of the pilot, and hopefully we can scale this up more. So thank you, Jennifer McLaughlin and your team for running with this, and I look forward to seeing how this goes. Thank you, Chair.
Thank you, Councillor Parrish.
I was asked to do a talk on Monday to a provincial riding association. So I did a little bit of research, and it was interesting to find 69% of 65 to 84-year-olds in Mississauga live in single-family homes. That's huge. And you as chair and you as former Mississauga councillor have always talked about empty bedrooms and unused rooms in houses. And I'm thinking 69% of 65 to 84-year-olds could use somebody to help with the snow and the garbage and everything else. Probably not necessarily with keeping their homes affordable, but affordable housing for students and young people. So this is an excellent program. I'm happy to see it. In Mississauga, apparently 81% of all residential lands are low density. So we got a lot of single family houses out there. And this would be very helpful. And we also apparently have a massive underground economy of basement apartments. And maybe a program like this will cause more people to register those apartments. So I too support this 100%. Glad to see it here.
Thank you. Councillor Sato.
Thank you, Mr. Chair. Reading the report, you may recall, long time ago, the former Ward 2 councillor, Pat Mullen, brought this forward to regional council and to city council because she had so many seniors living in very large homes with high taxes in Ward 2. And we were not able to implement this type of a program back then. And you know how long she's been off council. So it was quite some time ago. But she also, as chair of Peel Housing at the time, she advocated for this type of a program for so many years. And I hope she is aware that it is finally being implemented nationally, because she was such a huge advocate. And I'm very pleased to see that it is finally coming to the region of Peel. It's so long overdue, and just an amazingly much needed and very beneficial program. Thank you.
Thank you. Well said. Okay, so with no other speakers on my list, I need a motion now to deal with the matter, as moved by Councillor Demerla, seconded by Councillor Sato. Madam Clerk, recorded vote over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
100% yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yep.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Early?
In favor.
Councillor Early in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes, in favor.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and it carries, and it's unanimous. Thank you.
Thank you, Madam Clerk. The next item that was held was a communication item that was added to our agenda. And Madam Clerk, I want to make sure I've got my direction here accordingly and that it is proper. I believe I'm being advised that given that it's a communication item held by Councillor Downey, we require 2/3 votes to allow a motion from a communication item before dealing with the motion. So just so I'm clear to the clerk, can we hear the matter out and then determine if a motion comes from it? Or do I require a motion of 2/3 to even deal with it, Madam Clerk?
Yes, we do require the 2/3 vote before we deal with the motion because it's a communication item.
Very good. So I have a motion from Councillor Downey, seconded by Councillor Mahoney, to deal with the matter first, and I need 2/3 for that to succeed. Any speakers to that? Seeing none, Madam Clerk, over to you for the motion. I need 2/3 on so that we can deal with item 16.1.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demerla?
Yes, thank you.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon? Councillor Dillon? Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
In favor.
Councillor Fortini in favor. Councillor Groves. Oh, sorry, Councillor Early. Councillor Early.
In favor.
Thank you, Councillor Early. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
Yes.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes, in favor.
Councillor Vicente in favor, and that motion carries.
Now properly before us, Councillor Downey.
Thank you to you, Chair, and recognizing that we've all had a long day, I'll keep it short. The BPW is a group out of Brampton, the Brampton chapter. My apologies. I was contacted by Alexander Hopkins last evening, noting that Brampton passed the same resolution of support for the group and their ongoing efforts to raise funds in regards to family violence and intimate partner violence. It's somewhat self-explanatory, and they are looking for support from this council to continue, their work and search for provincial funding.
Thank you. So the motion moved by Councillor Downey is one of support of the correspondence to us. Do I have a seconder?
I believe Councillor Santos would like to second.
Very good, Councillor Santos. So I have a mover and a seconder. Do I have any speakers? Seeing none, Madam Clerk, the vote over to you.
Mr. Chair, wait, it's Mayor Crombie. I apologize. I don't have this item of communication, so I don't know what we're voting on. Could you just give us the highlights and how much the amount is for?
Very good. Through to either Joanna or to staff. Very good point, Bonnie. Can someone help us? I see it's on the screen, but hard to make out, and I know it's rather lengthy. Joanna, can you speak, or can somebody speak to the salient points?
Yes. So BPW has built a roster of resolutions that they take forward to the province. In this particular case, they're seeking funding for a pilot project, Project Guardian. And there are similar programs that align with Peel's Community Safety and Wellbeing Plan. They're actually looking for provincial funding, not funding from the region. They're looking today for our endorsement of their work.
Mayor Crombie, that's satisfactory?
Mr. Chair, thank you.
Thank you. And it was seconded by Councillor Santos. Madam Clerk, for the vote, over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie. Mayor
I'm on
Crombie.
mute. Sorry about that. Yes, I'm here. Yes, I vote favor.
Mayor Crombie in favor. Thank you. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
Sure.
Councillor Fortini in favor. Councillor Early.
Yes, in favor.
Councillor Early in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes, in favor.
Councillor Mahoney in favor. Councillor McFadden. Yes, thank you. Councillor McFadden in favor. Councillor Medeiros.
Oh, sorry.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor, Councillor Sato.
Yes.
Councillor Sato in favor, Councillor Santos.
Yes.
Councillor Santos in favor, Councillor Sinclair.
Yes.
Councillor Sinclair in favor, Councillor Starr.
Yes.
Councillor Starr in favor, Mayor Thompson.
In favor?
Mayor Thompson in favor, Councillor Vicente.
Yes.
Councillor Vicente in favor, and the motion carries. Thank you.
Thank you. I was hoping to avoid this, but we've still done very well. We're right at the 3:30 hour with only a couple of items left, but I will now deal with a motion from Carlson and Early to extend beyond 3:30. Does anyone object? Seeing none, let's get to the last couple. Item 19.6, establishment of a public art and monuments committee as held by Councillor Paleshi. Councillor Paleshi.
Thank you very much, Mr. Chair. I'll be brief. I think that the establishment of the Public Art and Monuments Committee is something that could be had maybe sometime down the road, or maybe something of somewhat of a PAMA responsibility. But the City of Brampton's taken this back to say, you know what, Bill Davis is a resident of Brampton, and although he was a great premier for Ontario, Brampton's going to go ahead and take the lead on this one. We will be coming back at a future time to request a small amount of funding from the region, but we're going to take this in-house. We're going to issue a procurement. We're going to look at possibilities of having it on Brampton-owned land. We respect all of Regional Council's comments in the last meeting when we had former Mayor Peter Robertson delegate to Council. But I'd like to move receipt of the committee with no further action, and we'll report back as soon as we can with some hopefully exciting news. Thank you, Mr. Chair.
Thank you. I'll take a seconder from Brampton if Councillor Fortini will second that. Do I have any other speakers to that? I see none. Madam Clerk, for the vote, over to you.
Mr. Chair, my hand's been up. Councillor Sato.
I apologize, Councillor Sato. Go ahead.
Thank you. Yeah, I was, quite frankly, Mr. Chair, I was a little surprised to see the report recommending a committee. When I asked for it to be referred back to staff at the previous meeting, it was for staff to bring forward a policy on public art for the region. I still think, I agree with Councillor Paleshi, the issue of a committee, that we just shelve that for now. But I still think that the region needs to have on the books, approved by council, a policy, which is what was originally asked for, and that is actually in the report, that that's what was asked for, with regard to public art and donations of public art. And, you know, this was not about one request. This was, when I asked, I said, we don't have a policy. And we're being asked to allow a piece of public art to be placed on regional lands. If someone else comes forward before we have a policy, we're right back where we started from. So I would like this actually referred back to staff to formalize it in the form of a policy, and to perhaps take a look at the local municipalities as to what we have in our policies. So, for example, in Mississauga, we have a policy that commemoration art, statues, which we don't have any of, plaques, that type of thing, namings, are generally done posthumously. And, you know, I think we need to really examine going forward the entire premise of placing statues of political figures, given the high number of statues of political figures that are being removed, torn down, damaged all around the country, and you know, and all around North America, actually, primarily. So I think it's a very sensitive topic, and I think it does need more review. So I would actually move that the issue and the original motion that was for a policy go back to staff, that they take a second look at it, and then bring in the fall bring a policy back to council that we can get behind, not a committee, a policy for the region for this type of request.
Thank you. First, I want to hear from Commissioner Baird, then I will go to Mayor Brown and Councillor Paleshi. Commissioner Baird?
Thank you, and through the chair, I apologize for the title of the report and perhaps the recommendation wasn't clear. There is, however, a draft policy in the appendix that's attached to the report, as well as some more detailed guidelines that go along with that policy. So I can assure you we certainly took that seriously and have came back with a potential policy that we can use going forward. But I understand the concerns raised as well, and I will say that those specific concerns are not directly addressed within the policy. What it speaks to is the importance of having informed individuals consider all of the various positive and negative issues associated with any potential public art or monument. So that's the way it's addressed within the policy, but it doesn't speak directly to whether or not it's appropriate to have monuments of these figures.
And Mr. Chair, could I point out there's two different issues here. One is staff selecting, purchasing, receiving donations of public art. That's public art. We have that policy at the city. But when it comes to recognizing individuals through that public art, that is a separate type of review, and it is done by council, not an external committee. So it is not appropriate for a committee that is not an elected body to be making that recommendation. And at the city, our staff would review it and it would come to council. It would not go to the external public art committee or art culture review committee that we have. It's two separate issues when it comes to recognizing individuals. So that's where I'm concerned, that it's sort of been thrown together, and the recommendation is to give it to external people, a committee that is not inclusive of council. So which is why I wanted to go back and put that in, take a further look at that and see what we're doing at the other cities.
Yeah. And the chair would agree with Councillor Sato that I think they are two separate issues. Let me try to position them before we go forward with the debate. I think the first one from Councillor Paleshi is simple with regards to the quite appropriate, may I say, memorial to Premier Davis. Brampton wants to take that back and they will deal with it and need nothing further. And I think what Councillor Sato is saying, and I also think quite appropriate, can we refer the rest of it back to staff to address some of the points that she made and some of the other moving pieces? I think that would hopefully deal with it, but that's what I have before me. I will carry on with my list of speakers. Mayor Brown.
Thank you, Chair Unica. As Councillor Paleshi noted, we've sort of taken the bull by the horn in Brampton wanting to honor this great Canadian. Originally, Peter Robertson suggested the Region Appeal at PAMA because of the former Premier's role in creating the Region Appeal, being a sort of the godfather of the Region Appeal and being a resident of the Region Appeal. But that wasn't as straightforward. We brought it to the Region Appeal, so we're taking the ball forward in Brampton, and our council unanimously supported that initiative. And I would just note, I think we're at a unique time in Peel Region history where we've got some of the greatest builders in our region's history who are still of sound mind and body. And you look at the Hazel McCallions, the Emil Kolbs, the Bill Davises. I would like to see them honored while they're still with us. And I think we all have a debt of gratitude for their contributions, and I'm not sure what way the Region Appeal could be part of honoring such a great statesman, but hopefully as we study how we're going to do this in Brampton, we can come back to you in a manner in which the Region Appeal can have their acknowledgements as well. I believe Bill Davis's father actually practiced law in the courthouse that is now PAMA. So there's a lot of history and synergy, and where PAMA is located, the former Premier has actually lived every day of his life. And I know Councillor Sato mentioned that there are controversial figures who sometimes there is questions of should there be statutes for when it comes to those that have built Peel Region like former Mayor McCallion and former Premier Bill Davis. I've yet to meet anyone who has said a bad word about those individuals. I don't think any of them would be controversial. If anything, there are unifying presences within our community where there is widespread admiration and appreciation. So I just wanted to say that note. We're moving this forward in Brampton, but that's not to say there may not be an opportunity for the region of Peel to participate down the road.
Thank you, Councillor Vicente.
Thank you, Chair. I want to echo what the mayor just said. At Friends of PAMA board meeting, we discussed this potential idea, and the members of the board were open to the idea. And I think that as the city of Brampton works through its vision on what this movement can look like, I would still like to keep open the possibility of PAMA playing a role. The mayor of Brampton, of course, is correct in that Bill Davis's father did practice law within those very walls. There is a strong historical connection, and I think that that is something that we should celebrate in the future, and we would be remiss if we didn't explore that option. Thank you.
Thank you. So unless anybody else wishes to speak, and I apologize if I don't see your hand, nobody's in the queue along the margin that I look at. So with that, I think Councillor Pelleschi was right from the outset in saying, please let us take the appropriate acknowledgement of Mr. Davis back. By the way, only been held up because of his modesty. This would have been done decades ago, but the former premier is such an incredibly modest man, or else, as I say, it would have been done a long time ago. But I think that rightly goes back to our friends in Brampton, as the mayor has outlined as well. And that, I think, leaves us again with the very appropriate referral of Councillor Sato back to staff, as spoken to by the commissioner, to address many of the other moving parts that you brought up in a more formalized, fulsome policy related to more current events. So to the clerk, if I have no other speakers, I don't know, I leave it to you. I don't know that I need anything from us on the first suggestion, the Davis going back to Brampton. There's no motion there. They'll just deal with it. Do I have a referral? How best do you want to deal with Councillor Sato's suggestion? And I will need a seconder, of course. Madam Clerk?
Thank you, Mr. Chair. So if we have a seconder for Council Sato's motion to refer the matter back to staff, then you can just confirm if there are any objections. And if so, the motion will be
seconded.
Thank you. Councillor Pelleschi, I think you may have been seconding it. Okay, so Councillor Sinclair has the first matter has been dealt with.
Yes.
The second matter, the referral back, has been moved by Councillor Sato, seconded by Councillor Sinclair. Okay, I'm hearing I'm assuming everybody's good with that, and I'm going to call the vote over to the clerk. Thank you.
Thank you, Mr. Chair. We don't need a recorded vote, just to confirm if there are any objections.
Seeing none, Madam Clerk, we're good. Thank you all. Okay, moving on. That brings us to other business or inquiries from members of council. Do I have any? Seeing none, Madam Clerk, over to you. Any notices of motion? I have none. Madam Clerk,
just for like this voting, we're finished half earlier.
Madam, everybody make sure you're muted. Thank you. Madam Clerk, I'm coming back to you now for the bylaws and to take us in camera.
Okay, thank you, Mr. Chair. Just need a mover and a seconder for the bylaws. Moved by Councillor Fonseca, seconded by Councillor Downey, that the bylaws listed on the June 24, 2021 Regional Council agenda, being bylaws 42, 2021 and 43, 2021, be given the required number of readings, taken as read, signed by the regional chair and deputy regional clerk, and the corporate seal be affixed thereto. Are there any objections? Hearing none, that motion carries.
Very well, Madam Clerk, carry on to move us into in camera.
Got a motion moved by Councillor Sinclair, seconded by Councillor Mahoney, that council proceed in camera to consider reports related to the following: automated school bus stop arm camera program implementation and processing center recommendations, position plan, procedure, criteria, or instruction to be applied to any negotiations carried on by or on behalf of the municipality or local board, and advice that is subject to solicitor-client privilege, including communications necessary for that purpose. Are there any objections? Hearing none, that carries. And Mr. Chair, if we can just have a few minutes just to confirm that we are properly in camera.
Yes, and you'll let me know when.
Mr. Chair, we are back into open session.
Very good. So, Madam Clerk, I have a motion before me from Councillor Parrish and Fortini with regards to the deferral of the matter that we were dealing with. And it also contained the fact that it should be, and you have to tell us when you want it deferred to, and they have to the very next council meeting. And it was asked that it be the first item on our agenda to be dealt with. Can you be clear on the full motion before us as to what we are sending back so everyone can be clear on the motion?
Thank you, Mr. Chair. We are deferring. The motion is to defer the item 24.2, which is the automated school bus stop arm camera program implementation and processing center recommendations. And the request is to defer it to the next regional council meeting, which would be July the 8th.
And again, can we be clear that we would like it addressed as requested? I'm asking for clarity, as requested that it be the first item on our agenda.
Yes, absolutely. We can deal with it first thing at the first part of the meeting.
So there you have it, I believe. I think that's pretty clear. I have a motion of deferral duly moved by Councillor Parrish, seconded by Councillor Fortini, that matter 24.2 come back to us at our very next council meeting to be dealt with first on our agenda. You've heard the motion. For the vote, over to the clerk.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
No.
Mayor Brown opposed. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes, I agree.
Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Sorry, this is referring, right?
Deferring to July the 8th.
Oh, deferring, yeah, yes, yes.
Councillor Dillon in favor. Councillor Downey?
Not in favor.
Councillor Downey opposed. Councillor Fonseca?
Not in favor.
Councillor Fonseca opposed. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Early?
In favor.
Councillor Early in favor. Councillor Innes?
Not in favor.
Councillor Innes opposed. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney, I believe he indicated he had to leave. Councillor Mahoney, are you here? Thank you. Councillor McFadden?
Not in favor.
Councillor McFadden opposed. Councillor Medeiros?
In favor.
Councillor Medeiros in favor. Councillor Paleshi?
Not in favor.
Councillor Paleshi opposed. Councillor Parrish?
In favor.
Councillor Parrish in favor. Councillor Raz?
Not in favor.
Councillor Raz opposed. Councillor Sato?
Yes, in favor.
Councillor Sato in favor. Councillor Santos also indicated that she was leaving. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr? Councillor Starr? Mayor Thompson?
Not in favor.
Mayor Thompson opposed. Councillor Vicente?
In favor.
Councillor Vicente in favor. And the motion carries.
Thank you. It's moved to our next council meeting. Madam Clerk, that brings me to item 25, any bylaws relating to the in-camera matters.
Mr. Chair, there are no bylaws related to the in-camera matters.
Very good. So now you have the motion to confirm the proceedings of council as moved by Councillor Early, seconded by Councillor Carlson. Anybody opposed? Hearing no one, that carries. A motion to adjourn from Councillor Fonseca, seconded by Mayor Crombie. Anybody opposed? That carries. We stand adjourned. Thank you to all for a very long day's work and well done. Thank you to all. Thank you to the staff.